along with super specialty courses per year. As we embark on the CME event, allow me to commence with a quote by Sir William Withygull, a pioneering physician and one of the founders of modern forensic pathology, who aptly said, "The evidence is the clue, the expert uses it." These words resonate profoundly with the essence of our gathering today, the pivotal role of evidence and expertise in unraveling truths and seeking justice. To our distinguished speakers, delegates, and esteemed guests, your presence here is a testament to your dedication to the advancement of forensic medicine. Your expertise and insights will undoubtedly enrich our discussions and inspire us all. Thank you for joining us on this journey of exploration and discovery. I wish everyone a productive and enlightening forensic quest ahead.
Now, we are moving to the session, Forensic Psychiatry in Medical Officer's Perspective. Forensic Psychiatry requires a distinct understanding of both medical and legal principles, allowing medical officers to provide critical insights that bridge the gap between psychiatry and law. Medical officers in this field often evaluate individuals to determine their mental state at the time of an alleged crime, their competence to stand the trial. Understanding the legal principles, psychiatric diagnosis, and application of mental health laws are crucial aspects of their work to ensure fair and just outcomes in legal proceedings involving individuals with mental health disorders. Now, it's my privilege to welcome Dr. M.P. Abdul Rahman Sir, Associate Professor and Head of the Department of Psychiatry, Government Thoothukudi Medical College. A man with clarity in his words, who has a deep understanding of complexities of human mind. Through a combination of expertise, empathy, and innovative principles, Dr. Abdul Rahman Sir fosters a safe and non-judgmental space for individuals to share their concerns and work towards a path of self-discovery. I welcome you, sir. The chairpersons for the session will be Dr. S. Shivakumar Sir, Professor of Forensic Medicine, Mada Medical College, Chennai. Welcome, sir. Dr. V. Dhanalakshmi ma'am, Professor of Anatomy, Government Thoothukudi Medical College. Welcome, ma'am. Dr. S. Sharavanan sir, Associate Professor, Department of General Medicine, Government Thoothukudi Medical College. Welcome, sir. Now, I request the speaker and the chairpersons to occupy the seats.
So good morning. So we congratulate the Department of Forensic Medicine for organizing such a nice, wonderful CME. And the speaker, Dr. Abdul Rahman Sir, the HOD of Psychiatry, who usually take care of the students' mental health. So we usually contact him at any time in a day, and the students also, they used to contact him at any time of the day. So this topic, the forensic psychiatry, the most needed topic and the interesting topic. So thank you, the organizers, for selecting this topic as the first topic for this session. So over to you, sir.
Thank you, madam. So, good morning. First of all, I thank Professor Solimuthu sir and his team for giving me this opportunity. So, today my topic is on forensic psychiatry in medical officer's perspectives. Medical officer means, who is a medical officer? Any idea? So, most of us students thought that nowadays every student thought that it is only for a specific branch. For example, surgery is only for surgeon, pediatrics only for pediatrician. But so not like that. So medical officer means all the registered medical practitioners come under the category of medical officer. So those who are finished MBBS, they called as medical officer as well as the registered medical practitioner. But in the latest Mental Health Act, so Mental Health Care Act 2017 is the latest act. According to the act, medical practitioner means both allopathic as well as other medical branches also, including Siddha and Unani and Ayush medical officers. Okay, so there are various new terms after the Mental Health Care Act. So the important one is DMHRB, that is District Mental Health Review Board. The district mental health review located at Tirunelveli for 4 districts. That is, we call it as zones. Almost 13 district mental health review boards are there in our Tamil Nadu. Okay. The board is chaired by a retired judge, member 1 psychiatrist. I am the member of Tirunelveli Medical Board. Then another member is from any MBBS doctor. One MBBS doctor is there. Other two members are one person from an NGO and one person from patient's relative or caretaker. So the board's decision is not based on the scientific data, it is based on majority decision. So sometimes it may take decision against any hospital or any doctor, another monitoring body against the medical field. Okay, already we know Clinical Establishment Act is there and Consumer Act also there. Now Mental Health Care Act, under the Mental Health Care Act, the District Mental Health Review Board also play a role regarding the mental health patients. Okay. So it is a quasi-judicial body. For example, it has a power, lot of powers in the legal aspect. For example, if the District Mental Health Board, sometimes it may take action against the doctor or the hospital. If they take some action against the doctor or the hospital, we can approach only the High Court. We can't approach any local court against the order of the District Mental Review Board. So this already it is functioning for the past 2 years. Some in Coimbatore or some other district, they take action against some doctors also. So it is one of the important area in which our medical practitioners also face some legal challenges. Okay. So, according to the Mental Health Care Act, the medical practitioner can play a role as a government medical officer as well as a private medical practitioner. Okay. So, what are the roles of medical practitioner? The latest Mental Health Care Act, there is a procedure for patients with high support needs. That means those who are admitted involuntarily. For example, we also all know, severe patients in severe psychiatric illness, they refused to admit they are suffering with some psychiatric illness. That is called as insight. So insight may be absent. So at that time, we got to admit the patient without the consent of the patient. Suppose if we admit the patient in the hospital without the consent of the patient, then either relative or friend may apply as nominated representative to the Mental Health Review Board. So the Review Board ask the psychiatrist as well as one medical practitioner. For example, if the patient is admitted either in government hospital or private hospital, if the patient is admitted involuntarily, then 2 doctors certified individually about the patient. One will be psychiatrist, another one from any medical field. For example, MBBS doctor as well as Ayush doctor. Okay. And they inform the fact to the Mental Health Review Board if the case of minor or female within 72 hours, and if the patient is a male within 7 days. Okay. Suppose if you are working in a GH in which only one psychiatrist may be there. So at that time, if the patient is admitted in that GH, they may ask from any department doctors along with the psychiatrist. For example, one pediatrician and psychiatrist may be there in the GH. So at that GH, the psychiatrist as well as the pediatrician both will certify the patient individually. That is very important. And what are the points noted by the medical practitioner? Either the individual is either intend to harm himself, or he may try to harm others. So to harm to himself means any deliberate self-harm or attempts at suicide, or the individual may try to assault other people or try to harm other person. Number 3, he is unable to take care himself. In that case, the doctor, the medical practitioner as well as psychiatrist both will certify individually either on the day of examination or within the 7 days prior to the admission. Okay, this is the role of medical officer during the patient admitted without the consent of the patient. Okay. Sometimes, according to Section 100 of Mental Health Care Act, sometimes the patients, wandering mentally ill patients, may brought by the police officer, SA or above the rank of SA, may brought the individual to the nearest public health establishment. That the point is very, very important. Public health establishment means any PAC, GH. Okay. So in that PAC or GH, the medical officer role is he has to examine the patient about the presence of psychiatric illness. If he has any doubt about the presence of psychiatric illness, then he refers the individual to the mental health establishment, that is a psychiatric facility hospital. Okay. If the medical officer thought that the individual is not having any psychiatric problem, the individual may be brought to persons with homeless, that is provided by the Ministry of Social Welfare. In each and every district, they have one home. So they refer the patient to that home by the police. So this is the role of medical officer whenever you are posted in a PAC or GH. So usually the police, they take the person within 24 hours, they will produce the person in front of the public health medical officer. Okay. So the medical officer in charge of the public health establishment shall be responsible for arranging the assessment of the person. Okay, that is very important. So if you are in a PAC and if the police brought the individual for assessment, psychiatric assessment to you, then you will be responsible for the case. So already we mentioned. So remand prisoner. So after everybody knows the Sathangulam case, all the previously also they brought the remand prisoner to the casualty, nearest casualty or nearest government hospitals. But nowadays, after the incident, there is a strict procedure regarding the physical as well as mental fitness of the individual. Okay. If you are the casualty medical officer, the remand prisoner is having some abnormal behavior or with the history of any mental illness, you have to examine the individual. Okay. And if you have the doubt, you have to refer the case to the concerned judicial magistrate. Okay. You can't admit the patient directly to the psychiatric ward or in the hospital. If the patient has any physical ailment along with the psychiatric problem, then you can admit the patient and inform the judicial magistrate. Otherwise, the patient is physically fit but mentally he is not stable, you will note down the points and refer the case to the judicial magistrate for admission in psychiatric ward and evaluation. So that is the power given only for the judicial magistrate. So you can't admit the patient directly to the hospital unless he has any physical complaints. So the magistrate may give the order, we call it as reception order for admission and evaluation by a psychiatrist. So the previous section is CRPC 328. Now everybody knows the new law, so BNS. So 367, the magistrate can order the police to admit the individual in a psychiatric facility without remand. So before remand, the magistrate can admit the patient to the psychiatric facility. Okay. And if in case of a convicted prisoner, already conviction are given, then no problem, you can admit and treat the patient in the hospital. Okay. Then regarding various certificates, so these certificates produces lot of problem for many medical officers. Okay. So one case in Kanyakumari district, while I was working, so for example, one case, one old lady. So she was living with her elder son. Okay. So the elder son brought the lady to a physician in a private clinic, and they get the certificate regarding the status of the individual as dementia. So dementia is already known. So dementia is a major neuropsychiatric illness. The individual has loss of ability to make any decision making. Okay. So with that certificate, they change some property to the elder son's name. So after few months, again there is a quarrel between the elder son and the mother. So mother joined with the younger son. So both filed a case against the elder son. They told that I am not suffering from any mental illness. It is purely due to the malpractice by my elder son. So court will ask us to examine the individual, but the problem is that the old lady is only having mild cognitive impairment that is due to old age, not amounting for dementia. So what happened is, after the report, the police arrest the elder son, as well as the doctors also added in the case sheet as A3 or A4 accused. Consequences. Number one, from our medical council, they will take action, including penal erasure. Number two, the government side or police side, they will take action against under forgery. If there is some malpractice is there, then you are also come under the case. Okay, consider as accused. Okay, so these are the problems. So whenever any person asking for psychiatric diagnosis, even though you have some doubt about psychiatric diagnosis, kindly mention as query or provisional diagnosis. Okay, even though you mentioned as its certificate is not valid for medical legal purpose. Sometimes you come across some prescriptions or some reports. In the top, they mentioned as the certificate is not valid for medical legal reasons. So forensic purposes are there. They are very well known. So the court will accept as legal evidence. Whenever you give a prescription with signature, then it is considered as legal document as far as the court concerned. Okay, so it is very, very important. And number two, so whenever you give fitness after the medical leave, you have to ask the individual to produce the documents submitted in his department or in the court. For example, sometimes what happened, again another one case is going on in our hospital, not our hospital, it is due to some other one central government agency, so running in our district. Okay, so one person, he was a ex-military man, and actually he was working as a chemical engineer in that army. So after that he developed severe psychiatric illness. So from the army they terminated him. The reason is under medical invalidation. So he is not fit for the job. So he terminated from the military service. After some years, he joined in a nearby government agency with the qualifications. Okay, but here the fitness is issued by some civil surgeon. Okay, so already we know before joining any government job, people ask us to give a fitness certificate. So in the physical fitness certificate, they didn't mention anything about the psychiatric illness. So now the case is going on. Okay. So what happened? Still, almost 50% of the inquiry is over. Still, inquiry is going on. So it may end up some problem with the doctors. So you have to, whenever you give fitness certificate, even after medical leave or for a job, physical fitness can okay, but mental fitness you have to examine the individual very careful manner unless you have clear knowledge about the psychiatric illness. So you can't give any certificates. And in the latest Right of Persons with Disability Act, whenever the individual claiming disability, there are 21 disabilities are there now. So 21 disabilities, 4 disabilities are come under psychiatric illness. For example, number 1 is mental illness, number 2 mental retardation, that is intellectual disability, number 3 SLD, specific learning disability, or called as dyslexia, then autism. Okay, so in which autism, specific learning disorders must require medical board's certificate. You can't give any individual certificate for the case of autism or SLD. So according to the act, the board consists of 3 persons. One is psychiatrist, another one is pediatrician, another one be the clinical psychologist or trained psychologist. So as we are know, now one female IAS case is going on. So it's a disability, false certificate. One is visual disability, another one is mental illness. They told mental illness. So all we are know now, if the sometimes if any problem arising due to our certificates, and all are come under the screen. Okay. So my carry-on message is, whenever you give certificates regarding the psychiatric illness, so be careful about the psychiatric illness. It creates both criminal as well as civil problems. Civil problem means if you give a certificate as mental illness for a husband, then the wife or other people may go for court for divorce. Okay. Sometimes if the certificates, they can approach the registrar of the particular Good morning, sir. So welcome our chief guest.
Guest of.
So certificates regarding mental illness, always be careful, and regarding both it creates civil as well as the criminal problem to us. Okay. So with this I conclude my session. Thank you for it.
Start.
Thank you, sir. Very informative topic. Any queries from audience side? Any doubts need to be clarified? Can you please give mic to him?
அத்தி பூத்தார் போல் அப்படின்னு சொல்லுவாங்க. அந்த பொண்ணு சொன்ன மாதிரி forensic psychiatryல very rarely we conducted CME.
Yes.
1985 when I was a medical student, திருநெல்வேலியில ஒரு தடவை like that, it's very nice. And forensic psychiatry as is very rarest of the rare specialties. Roughly maybe I think 1% of the defense is pleaded for insanity, I presume. But very often, not as a defense, but in the government side, they may ask you to aid in the mitigation for what is that, sentencing. How often you participate? What is your experience about this sentencing? The other thing is likely to even in civil cases, like fitness to competence, inheritance of property handling, and the Marla experience. Again, we have to develop interface with the legal.
Insanity defense. Insanity defense in criminal cases as well as the civil cases. Okay, so every month almost we received one case, sir. From since our Thoothukudi district, we are having facility to examine the. So from the Thoothukudi district, almost every month we received one MLC case. So either the individual may claim the defense after the arrest, or he told that for the past 3 months he was on treatment. So at that time, we will examine the individual records. If necessary, court may ask the concerned psychiatrist to appear in the court. So if Sir asked about the insanity defense, according to section 84, nothing is an offense by which the individual is at the time of committing the crime, if he or she is of unsoundness of mind, he may be acquitted from the case. So, for example, for murder பண்ணிட்டாரு அப்படின்னு சொன்னாருன்னா அந்த டைம்ல அவருடைய ஃபாரன்சிக் சார்லாம் இருக்குன்னு தெரியும். மென்சிரியா ஆக்டர்சிரியா ரெண்டு பாயிண்ட்டும் இம்பார்ட்டன்ட். மென்சிரியா மீன்ஸ் அவருடைய கிரிமினல் மைண்ட், ஆக்டர்சிரியா கிரிமினல் ஆக்ட். ஸோ ரெண்டு இருந்தால் மட்டும்தான் பனிஷ்மெண்ட் கொடுக்க முடியும். ஸோ அதான் நம்ம சார் கேட்டிருக்காங்க. ஸோ whenever there is a case, any criminal case, so we require consent judicial magistrate order for psychiatric examination. If the magistrate give the order, we admit the patient for 10 days. So we observe the patient's sleep and day-to-day activities. Then we will give the report to the concerned magistrate. If he is of unsoundness of mind, the magistrate may postpone the trial until he is fit for trial. Suppose that at the time of committing the crime, whether he is suffering from mental illness is up to the individual's choice. So for 3 months body murder. So at the time of crime வந்து ஒரு murder நடந்திருக்கு அப்படின்னா, for example 3 months முன்னாடி murder நடந்திருக்கும். நம்ம என்ன பண்ணுவோம்னா அந்த டைம்ல you can't give any clear report. So we give maybe. So அந்த டைம்ல இருந்திருக்கலாம், இல்லாம இருக்கலாம், அது நமக்கு தெரியாது. So for as the law is concerned, all the persons are considered as sane. Okay, unless proved otherwise. So the insanity defense வந்து அந்த கன்சென்ட் டிஃபென்ஸ் லாயருடைய ஒர்க், அவங்க தான் அதை ப்ரூவ் பண்ணணும். நம்மளுடைய ஒர்க் இல்லை. We will give the certificate as whether the individual is suffering from mental illness or not. Okay, so that is the point.
Any other questions? Any other doubts from audience side? So I have one question. Can I ask you?
Only one psychiatrist is enough, sir. Sometimes the judge may ask to form a committee to examine the individual. So at that time, we form the committee.
So can I ask one question? So regarding a lucid interval, suppose accused is claiming that he was in a lucid interval, how to prove in the court that at the time of committing crime, he was suffering from mental illness, not in the lucid interval? How to prove that?
Sir, there are some points whenever the crime is committed by the mental illness. So number one, there is no motive, and there is no planning for that. Number three, and there is no concealment of evidence. So for example, the weapon, everything is in that place only. And most of the time, the individual is only roaming in and around the place only, and they never escape from that place. So with that point, we may commit, at that time of the committing the crime, he may be suffering from mental illness. But the evidence will be proved only by the defense lawyer, and if the judge is convinced about the points, then they will acquit. But usually they won't acquit easily. If there is if the individual, the judge thought that he is suffering from mental illness, then they refer the individual to the IMH Chennai. So there they will kept about 6 years, 7 years they will be in the IMH only. So if the relatives are giving surety, then they will hand over the individual to the relative with the condition that he should be admitted in a mental health hospital.
One more thing, for all remand prisoners, police once after arresting the accused, will the accused should be submitted for mental examination for every crime?
No sir, it is up to the role of medical officer. The medical officer examines the physical as well as mental fitness. suppose the individual claims that I am suffering from some mental illness, if they produce the record, then medical officer note down the point and refer the individual to the
Psychiatric examination. Thank you.
Thank you.
So we thank Professor and HOD, Department of Forensic Medicine, for giving us the opportunity. Supposed to be the first CME in our college from Forensic Medicine Department, and first workshop from Tamil Nadu. So as per their version. So we wish to continue such kind of CME in the future also, sir. Thank you, one and all.
Thank you, sir, for the wonderful session. Now we take a moment to welcome our guest of honor, Professor Dr. A. Edwin Joseph, former Director of Medical Education, Tamil Nadu. He is also the Professor of Forensic Medicine, Sri Muthukumaran Medical College, Chennai. Welcome, sir. Now, with great esteem, I request all the chairpersons to felicitate our honorable speaker, Dr. M.B. Abdul Rahman, sir, Associate Professor, Department of Psychiatry. I welcome our HOD R. Sudalimuthu sir to present memento to Dr. S. Shivakumar sir, Professor of Forensic Medicine, Mada Medical College, Chennai. Next, with great regards, I invite Dr. S. Peranandam sir, Associate Professor, to honor Dr. V. Dhanlakshmi ma'am, Professor of Anatomy, Government Thoothukudi Medical College. Next, I kindly request Dr. B. Arumugaselvi ma'am to honor Dr. D. Sharavanan sir, Associate Professor, Department of General Medicine, Government Thoothukudi Medical College. Once again, we express our gratitude to the speaker and the chairpersons.
On to the next session, examination of sexual assault victims, procedure, protocol, and its medico-legal aspects. Examining sexual assault victims involves specialized procedures and protocols to ensure both medical treatment and legal documentation are handled appropriately. It's crucial for healthcare provider involved in examining sexual assault victims to know in-depth details to ensure they can effectively manage both the medical and forensic aspects while prioritizing the well-being of survivor. It is my privilege to welcome Dr. T. Rajalakshmi ma'am, Assistant Professor in the Department of Obstetrics and Gynecology at Government Thoothukudi Medical College. Her dedication to advancing women's health through education, research, and compassionate patient care is exemplary. With a wealth of experience and a commitment to excellence, she continues to inspire and educate the next generation of medical professionals. Please join me in welcoming Dr. T. Rajalakshmi ma'am for the session on examination of sexual assault victims, procedure, protocols, and its medical legal aspects. I also invite our chairpersons to this session. Firstly, we have our beloved Dr. B. Meenakshi ma'am, Head of the Department of Pharmacology, Government Thoothukudi Medical College. Welcome, ma'am. Next, we have Dr. S. Janani ma'am, Associate Professor of Forensic Medicine, KAPVMC, Trichy. Welcome, ma'am. Next, we have Dr. A. H. Suganchandra sir, HOD in charge, Department of Forensic Medicine. Department of Forensic Medicine, Government Medical College, Thiruvannamalai. Welcome, sir. I request the speaker to continue the session.
Good morning all. I'd like to congratulate the Department of Forensic Medicine for organizing this sort of CME in Forensic Medicine for the first time in our college. All the topics chosen are very interesting and will be informative to all our students and practitioners. And you can't get this type of information anywhere else. So I request all our students to listen and make use of the program. Thank you. And over to the speaker.
இல்லை இங்கே வா லைட் ஷோ வந்துடுமான்னு கேட்டேன் அதில் வரல Good morning all. I thank the FM department and also OG department and our college for giving me this opportunity. As a woman doctor and also as a gynecologist and also as a proud woman, I would like to present this topic. This is a very sensitive topic. Penetrative act is a sexual violence. Today we have included the non-penetrative act also into the sexual assault. So what is this? Sexual assault could include anything from touching another person's body in a sexual way without consent for a forced intercourse, and also even fondling or attempted rape will come under a sexual assault. Some examples of forms of sexual violence include any time of rape during armed conflict or rape by strangers, sexual harassment, sexual abuse of children and those with mental and physical disabilities, or any forced prostitution, female genital cutting, even the exposure of the children for pornography or the woman, and forcibly disrobing and parading naked any person will come under sexual violence. So how we have included it? That is after 2013 only. By the Criminal Law Amendment Act 2013, they have expanded the definition of the rape to include all forms of sexual violence as both penetrative and non-penetrative, and they have also given the right for treatment for all survivors or victims of the sexual violence. And we all know that under this act, refusal to treat by any hospital is now an offense with a punishment of up to 1 year or with fine. Okay, and also this law will disallows any reference to past sexual practices. So now we are going to discuss about the Ministry of the Health and the Family Welfare Guidelines given in the year 2014 for the examination of the sexual victim. So how do we receive the case? You are a practitioner, maybe in a private or in a government setup. So how she will come? Either the girl, now she even can come. She need not go to the police and only come for examination. Directly the woman or the child can come to us for examination. So on his or her own, only for treatment. She may have come only for treatment, but it is our duty to inform. With a police requisition, she can come with a police requisition after a police complaint, or she may be coming with a court directive. So what is the purpose of the examination? So first we should know why we are going to do this. Why we are doing? Because we have to give a medical legal report, and that report should finally come into this conclusion whether a sexual act has been attempted or not, or whether it has been completed or not, and if the act is recent, depending on the injuries. And we have to always keep in mind that absence of signs of struggle doesn't empty in years. It comes under the POCSO Act, and the punishment will be very severe, and the proceedings and the special court, everything will be different. So age is very, very important. And also at the last, we should know whether alcohol or drugs have been administered to the survivor by taking blood samples. Why we have to do this examination very urgent? Why the time is important? Always we will record the time of starting the examination and the time of arrival in the hospital. Why? Because sperms are motile only for about 2 to 6 hours in the vagina, but they still remain in the vagina for about 24 hours. So we should not lose the precious time. And they are not found beyond 72 hours. But still, semen traces can be found in the vagina. So we have to do the examination even if she comes after 96 hours. But still, the chance of finding evidence will be greatly reduced. But we should not refuse examination even if the assault time has passed beyond 72 hours. So who is going to examine now? So the registered medical practitioner who is working in both government and the private sector. The next point is she need not be a gynecologist. The ministry has, Health and Family Welfare has told that we need not search for a gynecologist to conduct a medical legal examination. Any doctor can conduct the medical legal examination. For a female victim, female doctor is preferred, but in their absence, a male doctor can also conduct in the presence of a female staff. When it comes to a minor children, that is less than 18 years, or a mentally disabled person, to whom the child is comfortable, we can allow them. If the child suggests a male or a female, whoever she is comfortable, we can arrange for the examination. For transgender, that's also a special thing. Their choice of examination, they can choose if they want a male or a female doctor. And the one thing we have to know, they will all come with the police. Police person must not be allowed in the examination room, even during the history taking, consultation, and also the examination. So what is the role of the medical professionals now? So what we should know, what we have to do in the case of medical legal cases. This is just a gist. We have to provide medical treatment, psychological support, try to collect a good history, good examination, collect the evidence, prepare a medical legal report, and then we have to inform the police. And the one thing we have to keep in mind that police requisition is not required for medical legal examination and treatment. That's very important. We should not ask for whether you have filed an FIR, whether you have gone to police station, I will not treat. Just treating alone is not enough. For examining and collecting evidence also, you need not need a police requisition. You can do everything, inform the police, and then you can give the evidences. So this is just a flow chart of what we are going to do. This is the MOHFW guideline. It's a comprehensive healthcare response. I am going to discuss in this order only. So how we are going to get the consent, how we are going to give a first aid, do a proper history taking as we do in all the cases, because history is going to give a clue of what has happened and how we are, what is the conclusion and what is the, who will be the accused, and everything will depend on a good history taking only. Then comes the examination, which also includes age estimation in case if there is a doubt of age. Then we can do an age estimation also, and we can do an evidence collection, pack it and hand over to the police. Give at the side by side, we have to do a treatment to the victim also. Proper documentation. The documentation should be given to both the victim and the police, and we have to discharge her and follow up. So what the hospital should do? Every hospital should sponsor some protocol, because everything is not possible in all the hospitals. It may be a PHC, it may be a GH, it may be a medical college, or it may be a small hospital in a town. So they don't have all the facilities for any surgery or any suturing or anything. So what should be their hospital? They have to form a SOP. So why we have to form a SOP? To provide a comprehensive service to smooth handling of the cases, and this SOP should be given to all the doctors in the hospital. So where we are going to examine, it should be, the girl should be examined only in the one-stop center. This one-stop center, what is the importance of the one-stop center? It was established for the comprehensive medical, psychological and legal assistance under one roof. That's important. Everything should be done in one-stop center only. It should be done for all victims of sexual violence, domestic violence and acid attack. We have one-stop room in our hospital also. It's a separate room, child-friendly room. We have TV, we have dolls. We have every child should feel comfortable in that room. It is established in all government medical colleges, hospitals, and child should never be examined in the labor ward, general or obstetric casualty. And even the private hospitals are now bound to treat the medical legal cases. So who can be with the child or the woman? It's not only the child who can, if the child is less than 18 years, who can be there? in whom the child proposes trust, or if the woman or the child is not brought by anyone, she has come alone, then any woman which is appointed by the head of the institution can be present, example, a staff nurse even, or another medical officer also, or if she is mentally disabled or speech disabled, any other disability, then special educators can also be present. So only the doctor, the special educator and the attender can be present. So coming to the consent. So what is a consent? It's an informed consent, okay? So first we have to explain the nature of the examination, purpose of the examination, why we are doing this examination, and what all details we are going to get from the examination, and what information you will need. So we have to get a consent in the form, and who will sign? If the child is less than 12 years, we have to get it from the parent or the guardian or whom the child is reposing the trust, and if it's more than 12 years, we can get from the survivor even. Whether all cases we have to make a AR entry. Okay, so any medical legal, any sexual assault, always make an AR entry, a separate AR register to be maintained, and it should be entered only by the examining doctor, and in case of PHC, they can give a first aid and refer to the medical college, and in private hospitals, they can do an AR and they can give intimation to the police. Whether she can refuse to file FIR, after the AR, we have to intimate the police. But still the woman can refuse to intimate the police. Then we have to document the refusal also. We have to inform her that refusal of informing to police will never affect the treatment. If she refuses to inform also, we have to treat them. That's very, very important. But it's our duty to inform the refusal also to the police. So coming to the history taking. Okay, next we are going to the proper history taking and examination. So always record the time of starting the examination, get a good medical history about her past illnesses, and coming to the gynecological history, a detailed menstrual history is very important. Whether she has attained menarche or not, because child may be even 8 years, 9 years, or 10 years, even have not attained menarche, that's very important. So whether she has attained menarche or not, a menstrual history including a last menstrual period. Because based on that only we have to decide whether we have to give emergency contraception or not. So any sexual relationship prior to this episode is important, because traces of semen may be present in the vagina also. We have to differentiate it from the accused or it was from a husband. So we have to ask her when was her last sexual activity, and usage of any contraception, and any history of pelvic surgery also. So what will be the common complaints she will tell? She will come with the complaints of pain in the genital region, breast and abdomen, or a generalized body pain, weakness, or a bleeding from the vagina, anus and the mouth, and pain and bleeding due to the bruises and lacerations. So what will be the physical health consequences? Only if we know what are all the history, what are the complications, we can ask the history. So we should know what are the common things she will tell. She will complain of severe abdomen pain, burning maturation, sexual dysfunction, dyspareunia, urinary tract infection. Even she may come with unwanted pregnancy or unsafe abortions, any STDs, any pelvic inflammatory disease. When a child comes with this complaint, we have to always keep in mind about sexual abuse also. So coming to the psychological, as I told, they can have fear and shock, apathy, and so many depressions also. And they may even have a long-term psychological effects. This is a very important history. That's the history of the assault. That's very important. So we are going to ask when it happened, where it happened, how, and the location of the assault. And we should also note the surface, because if it's a road or if it is a wooden or if it is a bed, because based on the surface, the injuries may be present on the woman's back or on her body. We can collect some evidence based on that also. That's why the type of surface is also very important. The name of the person, the name of the accused, and the number of accused, and the nature of the contact, whether they have used any weapon. Why weapon is important? Weapon history also, because we can find the injury on her body and we have to relate the defensive injury and other injury to the weapons also. whether they have given any drugs to her, alcohol to her, and whether the clothing was removed or not. Because if it is removed, there won't be any stains in her body. That's why this history is very important. And we have to also ask the history of ejaculation of the semen inside or outside the female genitals. Next, we have to ask whether there was any other penetration into the anus or the mouth, and record the time of assault and the examination. Why? Because after some time the semen will be lost. That's why the time of assault is very important. And after that, did she bath, void urine, defecate or change clothes? All these acts will lead to loss of evidence. That's why we have to get this history very important. Because we may think there is no semen, but she would have told that I have did all this. So this will lead to loss of evidence. So if also I already told we have to ask the history of lost consensual sexual intercourse, and here we have to get a clear differentiation between the negative history and the not sure history. She might have forgotten. She may tell his name. So always make sure to differentiate between the negative and the not sure history. Also, will be the type of injury. Either it can be a abrasion or it can be a contusion. So we have to know whether it is fresh, and the day of injury can be identified by this chart, as we have studied in pathology even. Two persons in the hospital. So daily the staff nurse has to check whether the safe kit is ready. So what it should contain? As you can see in this picture, it should contain the forms for documentation, a large sheet of paper to undress the cover, and a paper bag, catchment paper, sterile comb, nail cutter, wooden sticks, scissors, tubes, disposable gloves, glass slides, wax and everything. So we should know where we have to take the sample, okay? So based on the history only we are going to take the sample, as I have mentioned before. What the history says, we have to take a sample based on, but we have to do a complete examination. So when it comes to a peno-vaginal assault, we have to take swab in both vagina and the body. If it's a anal or anal and body, if it's a oral and the body, and if they have used any object, if she tells a history of usage of any object or finger, we have to take swab for lubricant also. And if so, we have to, as I already told you before, the evidence will be present mostly for up to 96 hours only, but still we have to do a sampling. So coming to the clothes, so how we are going to collect the clothes, that you have to tell. So always we have to keep a big paper. The paper should be spread down. The woman has to stand on the paper and should undress in that paper only, because this cloth will contain a pieces of grass, mud, hair, and everything we can collect in that paper. And we have to check each piece of cloth for any stains, any blood, any hair or any foreign material, and we have to collect it. And each piece of cloth should be kept in a separate cover, sealed, and it should be packed. Alternative clothing should be present in the one-stop center. We have to provide it free of cost to the victim. So next, coming to the swab, as I told you before, it should be collected from other areas. We can, if any stains are present in the body and if it has dried, apply some normal saline over it and you can take the swab also. Next, coming to the nails. Inside the nails, because of the scratching of the accused, behind the nails there may be some epithelial cells of the accused. So always take nail scrapings below the nail scrapings, and then we have to clip the nails also. If the nails are deeply cut, mention that also. Coming to the pubic hairs, if there are matted pubic hairs, it has to be cut and taken first itself. And then we have to comb some pubic hair also, because sometimes we will get some loose hair, and we have to also cut some pubic hair for a control sample to differentiate between her hair and the accused hair. Coming to the swab, we have to take 2 vulval swab, 2 vaginal swab, and 2 vaginal smear for presence of spermatozoa, and anal and perianal swab if history is suggestive of other intercourse. And if oral penetration, oral swab. Give some 10 ml of saline to rinse the mouth and collect in a sterile container, or else you can directly take swab from the buccal, posterior aspect of the buccal cavity. So coming to the blood, alcohol for DNA testing and also the viral markers. And always we have to do a urine pregnancy test irrespective of a last menstrual period, and estimation of the bone age if it is required. After finishing the sampling, what I have mentioned before, always record the time of completion of examination. Okay. Then how we are going to send the sample? That's very important. What is chain of custody of evidence? Okay. So that is the responsibility of the doctor and the hospital for safely providing the evidence to the police, because sometimes if the woman has come to us directly, we have to keep it safe in our hospital until the police arrives, and we have to give to them safely. So one staff member must be responsible for it. Only she should have the possession of the evidence, and she should tape all over the envelope, put a seal on it. If it is a moist specimen, mention it as a moist specimen. And always we have to keep a signature on the envelope and keep a biohazard sticker also if needed. If needed. So how we are going to finish? Now we have finished the history and examination. Next, what we have to do? We have to do a proper documentation, because documentation is only going to speak for years. So the report consists of 13 pages. The one thing, the copy should be given to the victim immediately after the completion of the examination free of cost. And also we should know that the survivors should receive all services free of cost in both government and the private hospital. So now I am just going to explain you with a case scenario. So just a girl has come, she is a 13-year-old. So age is very, very important. So first, by seeing the age itself, you have to think of it, okay? So age is 13, so she comes under, so we have to think of the POCSO Act. She has come with the complaints of history of bleeding PV and a history of an intercourse. She was not able to walk properly. She had a bruises. On examination, you are finding the bruises on her hands, chest and back. There is also some tear in the vagina, and you are seeing that it is bleeding. She is looking scared. So psychologically also she is affected. And who has come with her? She is accompanied by her mother. So the girl has come to our hospital by herself. She has not come with the police. So what we are going to do now? Since it's a 13-year-old, we have to put, any age, we have to put an AR entry, inform the police immediately and also the child welfare committee, and start doing an examination and start filling up this. So this is the 13 page of medical legal examination report of the sexual violence. So coming to just a detailed short thing, always write the name of the hospital, OP number, name, address, age. Why age? In ages, as I told you already, If we don't know the age estimate, we can do age estimation also. Coming to the sex, it has male, female. We have other column also, others for transgenders. And date and time of arrival in the hospital. That's very important. The arrival time and commencement of examination and ending of examination should always be recorded. Brought by whom? Her mother. Here we have to write that she was brought by the mother. MLC number, that is the AR book number. And whether she is conscious, oriented. Yes, she is conscious and oriented because the girl has come by walking only. So she is conscious and oriented. She doesn't have any disability. Police station, only after giving, only if she comes with the police requisition, we have to fill that, okay? So next we are going to get a consent, okay? She is 13 years. Whether she can give consent? Yes. She can give consent by herself. So get a sign from her for medical. She has to understood, always explain the consent in her own language. She should know the nature and purpose of the examination. If needed, if any special interpreter, if she doesn't know any language or if she is with any disability, we have to mention whether we have asked for any special interpreter and write their name also. Now if it is less than 12 years, get signature from the parent or guardian and with date, time and place, mention 2 ID marks. And always, as I told you before, ask about the menstrual history, whether she is pregnant. That's also important. Pregnant or not, because of the previous sexual act, contraception, whether she is using or not. And the most important thing is about her vaccination status. When she has last put her TT injection and whether she is vaccinated to hepatitis B, because we will discuss about it later. And the date of incident, time, we have to ask the history and we have to fill all this. As I mentioned before, the number and sex. And the history always should be here, the description of incident. In this, always you should write in her own words. Next, we have to ask about the type of physical violence. As I mentioned before, what is the weapon he was using? Whether she biting, kicking, pulling hair, banging, dragging, and emotional abuse, whether she was being threatened or any verbal threat by showing some videos, or if there is a fear of killing some other person whom the survivor is interested, or in child giving sweets and chocolates, or any drug or alcohol has been given to her, and whether she is sleeping or unconscious at the time of the incident, and if she has, we have to ask the history whether she has left any marks on the accused. So coming to the sexual history, we have to ask which is the orifice, vagina, anus or mouth, and all these should be answered as yes, no. If she don't know, mention that also as D and K. So all these should be asked. We have to ask her where it happened and any kissing, licking, touching, fondling, condom are used, and post-incident whether she has changed her clothes. As I told you before, if she has changed her clothes, what we have to do? We have to ask her to bring her clothes from home also. If we can ask her, because sometimes evidence may be there. So we have to can ask her to bring her clothes from home, and we have to ask whether she has passed urine and stools, time since incident, whether she has any history of any bleeding, discharge, why. If there is here the girl has come with bleeding. So there will be some form of, because since 13 years, most of the time she will have some form of vaginal tear. We may have to suture it immediately in the theatre also. So always ask for the bleeding. And discharge, why? Discharge is about sexually transmitted infections. So coming to the general examination, always record our vitals, and examination of the whole body we have to do. So this is the whole body examination. This picture will be there in the medical legal report. So always mention the site, size, shape and the degree in the picture. Okay, the number, it all should be the number. Each and every injury should be numbered, and the whole body has to be examined from the scalp to the limbs. So coming to the external genitalia, always examine the urethral meatus. So this is the picture of the external genitalia. always mention whether the pubic hairs are present or not, if it is shaved or matted, clippings can be done or not, and mention if there is any vaginal tear, degree of tear, size of tear, location of the tear, and whether if she needs any suturing. All these things should be numbered in this picture. Only then it will be complete. So always we should mark it in the picture also, and we have to do a gentle speculum examination only if needed. If you are suspecting bleeding from inside, you should do a speculum, or else you need not do a speculum examination at all. Always ask her history and do an anal and oral cavity examination also. And other vitals should be recorded. And we have to collect samples for viral markers, urine test for pregnancy, ultrasound for pregnancy. If she has any fracture or any other injury, we may need to take an X-ray also. And we have to collect all the samples and the clothing evidence, and everything should be kept in separate paper bag, and also mention how many swabs were collected. As I mentioned before, we have to collect these swabs, nail scrapings, nail clippings, blood for grouping typing alcohol, urine also for drug testing. In coming to the external genitalia, whether the pubic hair is matted if it is taken, and combing or cutting of the pubic hair, and also vaginal washing if it is done, and everything should be mentioned. Okay. So what we are going to do next? We have completed the examination now. So what we have to do? Immediately we have to give some provisional medical opinion. So I have examined this girl aged this how many hours after the incident. So it may be even 6 hours or 12 hours or 1 day. Everything should be mentioned, and whether she has bathed or douched, and what are all the samples collected from her, and what findings you have observed. Based on that, you have to give a provisional opinion. So what treatment you are going to give also should be mentioned. So what are all the treatment? Just we are going to give a short gist about it. If there are any lacerations in the vagina, always clean with soap and water, and if needed, we have to do a suturing also. If facilities are not available, refer her to a center where suturing could be done. If she is not immunized, give her TT injection, okay? And if there is a possibility that she can have you are suspecting some sexually transmitted infection, treat for that also. For non-pregnant women, you can give acitro and doxy with mentro. For pregnant women, we can give amoxy with metro alone. Metronidazole should not be given in the first trimester of pregnancy. If you are suspecting hepatitis B, take a sample for HbSAg and give her immunoglobulin immediately. And if you are suspecting HIV, if you think that HIV risk is high, you can give her post-exposure prophylaxis also. And the most important thing is, we have to always provide her with emergency contraception. Here also the time is important. It can be given for up to 5 days of the intercourse. So we are giving 2 tablets of levonorgestrel or oral contraceptive pills. And if she misses her next, always keep this in mind. If she misses her next period, always do a urine pregnancy test. Now if she has come with pregnancy, what you can do? We can advise MTP also. Any girl as per MTP Act, any woman or girl has the right to do MTP as per the MTP Act. Up to 20 weeks, 1 medical practitioner, and after 24, we need the consent of 2 doctors. So what we have to do in this? We have to always fill the form C. But the special thing is, we have to preserve the abortus here, preserve the product of conception. So we have to contact the respective police station, ask them to bring the kit, and we have to collect the DNA kit and also the products, and we have to give the police in an ice box. And at last, we have to give a good psychosocial care also, because all survivors should be provided the first line psychosocial care by a healthcare worker, and follow-up is very important. And all follow-up should also be documented, and we have to re-examine her after 2 days, and again at 3 and 6 weeks, test for pregnancy, and repeat after 6 weeks for all other sexually transmitted infection, and assess the psychological opinion or psychological support also. So coming to the provisional clinical opinion, it should be done immediately after the examination. And we always should know, normal examination findings will neither refute nor confirm the forceful sexual intercourse. Why? Because absence of injuries. So we should know what is the importance of absence of injuries. So absence of injuries may be due to inability of the survivor to offer resistance, delay in reporting for examination, or it may be because of the activities such as urinating, washing, bathing, and use of condom. So all these reasons must be mentioned before we are coming to the opinion. So based on the injuries, if she has a genital and physical injury, directly you can give there are signs suggestive of recent intercourse, but still we are waiting for the forensic report. If there is absence of physical injury, still because of the genital injury, we have to tell that there is signs suggestive of recent forceful penetration of the vagina. She may be under the influence of alcohol, so wait for the FSL report. If only physical injuries, then we have to tell that there are signs for use of force, but vaginal or oral penetration cannot be ruled out because we are waiting for the FSL report. If all the injuries are absent, then we have to tell that there are no signs of use of force and we cannot rule out sexual violence, and final opinion is pending based on the FSL report. So this is the final opinion after receiving the FSL report. So we have to know how we are going to give the report. So this is based on whether we are detecting semen or not only. So based on that, if there is positive, if the report has come as positive, then surely there are signs suggestive of forceful vaginal or anal intercourse. If genital and physical injuries are absent, we have to remove the word forceful. That's all. So if it is a positive means we have to know that there are signs suggestive. What if the semen report is, if the semen traces are absent, but physical injuries and genital injuries, both of them or any one of them is present, we have to tell there are no signs suggestive of vaginal or anal, but still there is evidence of physical assault or genital assault or both. So always mention it clearly if she has any injuries. If she is positive for the presence of drugs or alcohol, mention that she was under the influence. If it is negative, we have to, for semen, alcohol, all the injuries, everything is negative, then you have to tell there are no signs suggestive of penetration. And if it is any lubricant is present, you have to mention that also. So coming to the special conditions, for transgender, what you have to do? Transgender, everything, information should be kept confidential. Always keep in mind they can also become pregnant, and we should get the confidence of them. We should not mock on them, and choice of examining doctor should be given to the survivor. And for alternate sexual orientation, that is other forms of sex, we should not comment on her other sexual practices, old injuries, everything, and we should not give any advice to them. And coming to the sex workers, don't believe that all sex workers will be HIV positive. Treat them with respect and give that only we have to inquire about the current episode of the relevance. Her past sexual work is not important. Coming to the persons with disability, let the person, for them we have to provide special provision because they cannot climb on the couch or something. We have to take them with care, and we may need some interpreters, special educators. We may need special assistance for examination also. And people facing caste, religion-based discrimination, please mention that also if she says. If she mentions alone, we have to mention it. In case of unconscious, what you can do? We have the hospital and any unaccompanied person also, the senior most medical officer, the examining doctor, staff nurse can be taken as a witness, and we can start the treatment. What if the woman is menstruating at the time of examination? Always ask because it will lead to loss of evidence. We cannot do a complete examination when she is menstruating. So a second examination is always recorded on a later date. So this is about the history and examination of the sexual victim. So coming to the medical legal implications, so what is very important about the sexual victim, the reason? That is the POCSO Act. So what is the POCSO Act? It is the Protection of Children from Sexual Offences Act. It was established in the year 2012. Before that, only the 375, that is the IPC, that is the rape law was present. So based on that only punishment was given. But since India has planned to give a full protection to the children, we have given this act, and it gives a stringent punishment to all the accused. So it was developed by the Ministry of Women and Child Development, and the act came into force on Children's Day in the year 2000. 12. So what are the salient features of the Act? Previously, boys were not included. Here it is gender neutral. We are including boys also, okay? So any boy can also be sexually assaulted, and it defines a child as any person below 18 years of age. So if the age is less than 18 years, it comes under the trial, everything will come under the POCSO Act. So it defines what are all the types of abuse, what are all the sexual harassment, and any form of pornography to the children will come under this Act. Why it is formed? Mainly for the well-being of the child, because the child are the future citizens of India. So it gives a strong punishment. Whoever is whoever is doing the offense, whoever is trying to do, even if it is not completed, it is completed as a offense. Okay. So what are all the punishments we are giving on it? Based upon this, I think forensic medicine, you will know very detailed about it. So based on the penetrative or aggravated, they are giving even a life imprisonment. Okay. What is the role of a doctor here? That's important. What is our role? So we have to collect evidence. That's important. As I told you before, properly collect evidence, treat the injuries, age assessment, STD prophylaxis, emergency contraception, psychological support, family counseling. Because here the child, so the family counseling, the parents also need a counseling. So what we should do? So the child, its age is less than 12 years. As I told you before, consent must be obtained from the parent or the guardian. We should be very careful during history and exam, because the child may even be accompanied by the abuser. So try to take the child separately and ask her whom she wants to be with her during the examination. If she refuses the person who has come with her, always you can send them out, and the person which are appointed by the institution can be present. And genital and anal examination should not be conducted routinely as we do in all. We have to be very gentle. Only if needed, we are going to do a genital examination and a speculum examination. So we have to make her comfortable. We have to use dolls, body charts, and what is more important is we have to believe what is reported by the child. Don't tell that what the child telling is wrong. No, it cannot happen. What she is telling. No, we have to believe what she is telling, and the special needs of children should be kept in mind. Doses of treatment have to be adjusted, and always give a psychological support. So here also comes, can you examine a child without a police requisition? Yes, we can examine as per the section 27 of the POCSO Act, and also the hospital also is obliged to examine the examination if the victim comes to the hospital directly, because they will be given a punishment if they are not examining them without a police requisition. Is it mandatory to go only to a government hospital? No. They can, as per section 357, all hospitals are government sector, public sector and private sector has the responsibility of providing the first aid and treatment free of cost. Here also they will have, it will be offense if it is not done. And here whether we have to inform police. Yes, all cases of sexual violence have to be informed to the police, and in POCSO it becomes more important because the age is less than 18 years. So cases have to be reported immediately, and if fail to do so, there will be a punishment. And if it has happened in some institution like principal or hospital administrator, and those who are in a higher position, they will have a more punishment like 1 year imprisonment. And any person who is reporting, whether they will get civil or criminal liability, no. Okay, so we should not fear for reporting, either doctors or police. So who can report? Parents, teachers, public servants, doctors, hospitals, social worker, any child, general public. They will not have any civil or criminal liability. So any person can report a sexual violence of a child. So recently we have got an information for the radiologist also. So if in an ultrasound clinic, if less than 18-year-old girl found to be pregnant, they have to directly inform the police or the child helpline. Okay, they have to get a form F signed immediately. Even she might have come for a simple ultrasound abdomen and pelvis, but you are detecting a pregnancy in her. Most of the time they will come with amenorrhea or they will come just with amenorrhea, vomiting or pain abdomen. We are founding pregnancy incidentally. So we always, the radiologists also have a role. They have to inform the police directly with a written complaint with scan report, PCP&T certificate copy of the center and the girl's ID copy. Also inform the referral doctor who has prescribed the ultrasound and also the hospital administration. So who we are going to report in the POCSO Act? The police or a gynecologist or what, or children or any other persons, as I mentioned before. They have to inform to the local police or special juvenile police unit and the child line. Very easy, that is it, 1098 and State Commission for Protection of Child and Right and also the National Commission. And last, the role of the Child Welfare Committee. This is also our responsibility. As a doctor in our hospital, we have to inform the Child Welfare Committee within 24 hours. Immediately, whatever may be the time, within 24 hours, the Child Welfare Committee should come because they will come directly and they will decide what is the requirement for the child, whether the child can be kept in the shelter or whether she needs hospital administration, and also they have to decide within 3 days whether the child is safe to be in her home or whether the child is safe to be with the family. So Child Welfare Committee role has also come after the POCSO Act only. So what is a woman doctor? POCSO has got a special thing, violence against women. So always we have a special program called Violence Against Women. There is a special cell called Violence Against Women cell, and we are conducting various programs for reporting and many conferences for how to conduct and how to report the examination. Thank you.
Thank you, ma'am. Thank you, ma'am, for the very wonderful and exhaustive presentation. Madam had kind of covered the medico-legal aspects, everything in a nutshell. So the session is open for questions from the audience. If there are any questions, kindly clarify with ma'am. Yes, sir.
Assault is sexual assault is very common every 90 seconds and it's very underreported. That's what. So there are two issues which I wanted to do. Nanu konja naal Meenakshi Mission Hospital open. What will you do when very often they bring the the victim on her own? You know, there are so many immigrants. They may not be accompanied by a informant or a guardian. How will you do? How do you record? Informant illatina neenga eppadi, how do you approach the assailant?
That's what, if the child is not accompanied by any person, the hospital can even make some attender. We have to inform the Child Welfare Committee. They will come immediately.
Sometimes in the PSC la co-medical officer rather than relying upon the police karaka avaralla adudha enga professor solli kodutha. The other thing is false reporting. Have you ever come across, because vexatious and frivolous complaints, it's very easy to, like dowry harassment,
if the child gives a false reporting also, no punishment will be given to the child. We have to believe in what the child is saying and after the trial only we can
Have you
decide.
come across any vexatious frivolous complaints and நீங்க ஏதாவது
Actually, Madam has given a very elaborate class on examination of sexual offences, but actually, whether all the doctors know it, because the Madam has given a take-home message to all of you, is given also a warning. All doctors should know this, and if at all you say that you don't know this, you will be punished. So that is the take-home message. So you cannot just like that leave what she has told. She has given a very elaborate class on how to examine sexual offences, whether they be a government doctor or a private doctor. They have to examine the case at the first instance and cannot shed away the responsibility by saying that I am a private doctor, I am not a government doctor, so I don't know how to examine. You cannot tell this. If you don't know how to examine, you are almost taking away the license you are doing for your practice. So you will have to know that first. So this is a warning. And I will blame the medical officer who had been, when the law was enacted, they will get a medical opinion also. See, first of all, know that doctors are not judges. Many of the criteria facts which she has told cannot be found by a medical person. That you should know. And you should be bold enough to say that these are the things which the person says and I cannot establish it scientifically or medically. And you will have to give an opinion, not in the negative and not in the positive also, because you don't have a finding. So these are the things which you will have to go home, take a look at what she has already given, and then find out what are the facts. This case dependent, but you will have to have this thing in your OP. While a person comes, you will have to examine and say and give an opinion. You cannot shed your responsibility whether you are a private doctor or a government doctor and get yourself entangled into the legal problems thereafter. So nobody can come to your help. So first of all, you should know what she has told. Have it in your, just like that you have learned the national anthem by heart, you will have to learn it by heart, and as experience grows, you will understand what is the meaning of it, and ultimately you will understand to be a good doctor. Thank you. Thank you, madam.
Thank you, ma'am, for giving us such a wonderful insight on a sensitive topic. With great esteem, I request our chairpersons to felicitate our honorable speaker, Dr. T. Rajalakshmi, ma'am, Assistant Professor, Department of Obstetrics and Gynecology, Government Thoothukudi Medical College. With great admiration, I request Dr. K. Vinod, HOD, Department of Forensic Medicine, Kilpauk Medical College, to honor, to present memento to Dr. B. Meenakshi, ma'am, HOD Pharmacology, Government Medical College, Thoothukudi. With regards, I invite Dr. Dhanalakshmi, ma'am, Head of the Department, Department of Anatomy, to honor Dr. Janani, ma'am, Associate Professor, Forensic Medicine, KAPVMC, Trichy. Next, I kindly request Dr. R.C. Rajesh, ma'am, HOD, Department of Pathology, to honor Dr. A.H. Sugan Chandar, sir, HOD in charge of Forensic Medicine, GMC Tiruvannamalai. Once again, we express our heartfelt gratitude to the speaker and chairpersons. I request everyone to maintain silence and be seated in their seats for the next session.
Moving on to the next session, justice through the eyes of a medical expert.
Trailer. Before that, we have a trailer.
Before that, we are here to present the Department of Forensic Medicine's trailer for the day.
The same type of silence you have to maintain during the speech also. Okay? Thank you.
Moving on to the next session, justice to the eyes of a medical expert. Justice is not just about punishment, but about uncovering truth and ensuring fairness. The forensic department plays a role in analyzing the evidence, reconstruction of possible events, and present findings that can withstand scrutiny in court. Justice means holding those responsible for crimes while also protecting the innocent from wrongful accusations. It's about using science and expertise to bring clarity and closure to complex cases, ultimately contributing to a fair and impartial legal system. I now invite our speaker, Mrs. Judy Angelo, ma'am, Assistant Public Prosecutor, a Judicial Magistrate Court, to enrich us with the valuable words for this session. She embodies the essence of commitment and integrity in the legal profession. Her journey has been marked by unwavering determination and deep-seated passion for upholding the principles of law and order. Welcome, ma'am. I now welcome our chairpersons for this session. I invite Dr. Manik Vasagam, sir, Associate Professor of Forensic Medicine, GMKMC Salem. Welcome, sir. Moving on to our next chairperson, Dr. Pavanan, sir, serves as the Head of Orthopedics Department at Government Thoothukudi Medical College, bringing extensive expertise and dedication to his role. Welcome, sir. Finally, I welcome Dr. Arasi Rajesh, ma'am, Distinguished Professor and HOD of Pathology at Government Thoothukudi Medical College. Welcome, ma'am. I request the speaker and chairpersons to occupy their seats.
legal profession. I must mention about Dr. Sudalai Muthu, the head of the forensic department here. Doctor and me have been friends for the past 11 years, which all started in the court halls of Tirunelveli. That shows the cordial relationship being maintained between the legal professionals and the medical professionals. My warmest greetings to all the dignitaries present over here, though I am not able to mention the names and the designations. Thank you, and I request to give few minutes to give your ears to me. எனக்கு கொடுக்கப்பட்டிருக்க டாபிக் என்னன்னா justice through the eyes of a medical expert. என்ன மேடம் நாங்கள் மெடிசன் ட்ரீட்மெண்ட் தான் கொடுக்க முடியும், எங்கள் மூலமாக என்ன ஜஸ்டிஸ் எதிர்பார்க்குறீங்க அப்படின்னு கேட்டால், justice starts from you. As a legal professional, as a public prosecutor who represents the victim, பாதிக்கப்பட்டவங்களை கோர்ட்டில் ரெப்ரசன்ட் பண்ணுற ஒரு ஆளா, what I expect, what I see can be done, immense contribution from the medical field to prove our prosecution cases. Wonderful topic to be spoken about. இப்போ முதல்ல ஜஸ்டிஸ்னா என்ன, எக்ஸ்பர்ட் அப்படின்னா என்ன அப்படின்னு பார்த்துட்டு let's go into what I have to talk. In its broadest sense, it is the concept that individuals are to be treated in a manner that is equitable and fair. A society in which justice has been achieved would be one in which individuals receive what they deserve. எனக்கானது நியாயமான முறையில் எனக்கு வழங்கப்பட்ட அதுதான் நீதி. ஓகே, ஸோ ஜஸ்டிஸ் எப்படி உங்ககிட்ட இருந்து ஸ்டார்ட் ஆகுது அப்படின்னா, I should mention about, எனக்கு இந்த மைக் பிடிச்சி ஒழுங்க பேச தெரியல. It will be better if I have a standing mic. இது ஒர்க் பண்ணுமா? அதனால I will stick to IPC itself. The offenses in IPC, mentioned in IPC itself. I guess it's okay with you all. இப்போ justice பார்த்துட்டோம். Who is an expert? A witness, a doctor becomes a witness, a common witness, when he gives evidence as to the variety, the size and the position of injuries. என்ன காயங்கள், எப்படிப்பட்ட காயங்கள் ஒருத்தரோட உடம்புல கண்டுபிடிக்கப்பட்டிருக்கு அப்படிங்கிறத ஒரு காமன் விட்னஸ் யாராக இருந்தாலும் அதை பற்றி சொல்லலாம். He becomes an expert when he mentions the nature of these injuries, the kind of, அந்த injuries எப்படி ஏற்படுத்தப்பட்டிருக்கும் அப்படின்றதையும், as to whether they were caused during life or after life. இதை எங்களாலேயோ வேற யாரோ ஒரு காமன் மேனாலேயோ கண்டிப்பாக சொல்ல முடியாது, எக்ஸப்ட் தேன் யூ டாக்டர்ஸ். தட் இஸ் வை யூ ஹவ் பீன் கால்ட் as experts. சரி, இந்த எக்ஸ்பர்ட் ஒப்பீனியன் லைக் மெடிக்கல் எக்ஸ்பர்ட் ஒப்பீனியன், ஒரு ஹேண்ட் ரைட்டிங் எக்ஸ்பர்ட் ஒப்பீனியன், ஒரு ஃபொரென்சிக் எக்ஸ்பர்ட் ஒப்பீனியன், டிஎன்ஏ ப்ரொஃபைலிங் ரிப்போர்ட்ஸ், இது எல்லாத்துக்கும் என்ன ரிலையபிலிட்டி சட்ட உலகத்தில் அப்படின்னா, இட் இஸ் 99.9% only. It is not wholly reliable at all, because it is subject to discrepancies, which you will all know. Adanale, a medical report is not a substantive piece of evidence. It is a piece of corroborative evidence. But corroboration na enna? Supporting evidence. Yeah, நாங்க இப்போ கோர்ட்டில் when we open a trial, we give evidences, we give depositions of prosecution witnesses. அதாவது அரசு தரப்பில் சொல்லப்படுற சங்கதிகளை உங்களுடைய மெடிக்கல் ரிப்போர்ட்ஸ் சப்போர்ட் பண்ணுது. தட் இஸ் why it is called corroborative evidence. இப்போ let's move on to what kind of system, criminal justice delivery system is being adopted in India. உலகத்தில் 2 டைப் இருக்கு, adversarial and inquisitorial. In India we follow the adversarial broadly, wherein இப்போ நான் பாதிக்கப்பட்டிருக்கேன் அப்படின்னா I go to court and I have to prove my case against the person who offended me. என்னை பாதிச்ச நபருக்கு எதிராக என்னால் எவ்வளோ எவிடன்சஸ் கொடுக்க முடியுமோ I present them before the court of law and I get a conviction for the accused. Whereas inquisitorial, the trial starts with the accused himself. நம்ம நாட்டில் certain offenses are like that. For certain POCSO and other offenses, the accused has to prove that he is not guilty. Adversarial, but broadly speaking, நாம தான் அவன் எனக்கு எதிராக தப்பு பண்ணியிருக்கான் அப்படிங்கிறத ஒரு விக்டிம் தான் ப்ரூவ் பண்ண வேண்டிய கடமையிலையும் கட்டாயத்திலையும் இருக்கும். அப்படி இருக்கும்போது usually what happens, a person is being criminally assaulted by someone, he goes to the police station, he files an FIR or he gives a complaint and an FIR is lodged, and then a charge sheet, a police report is filed in the court of law, and the trial proceeds weighing on the kind of evidences provided. He is acquitted or convicted. That is a different story altogether. அப்போ எல்லாருக்குமே broadly speaking what we think is justice அப்படின்றது it starts, or a criminal trial or a criminal offense starts where on reporting the crime அப்படின்னு நினைக்கிறோம், on filing an FIR. Actually it is not like that. எங்களை பொறுத்த வரைக்கும் it starts with a doctor, a medical practitioner. இப்போ ஒருத்தன் வந்து போலீஸ் ஸ்டேஷனுக்கு ரத்தம் சொட்ட வரான், என்ன பி அடிச்சிட்டான் அப்படின்னு சொல்லிட்டு வந்து சொல்லும்போது the doctor, the police officer does not take the complaint first and then send him to the doctor. இல்லை, அவருக்கு ஒரு மெடிக்கல் மெமோ கொடுத்து he sends him to the hospital first, and after that they come and investigate there, inquire and note down all what had happened. அப்போ அந்த victim ஒரு மெடிக்கல் எக்ஸ்பர்ட், ஒரு டாக்டர் கிட்ட என்னெல்லாம் சங்கதிகளை முதல்ல சொல்றாரு, உங்ககிட்ட தான் முதல்ல சொல்லுவாரு. He was assaulted by so and so person, known persona, unknown persona, எங்கே எப்போ எத்தனை மணிக்கு என்ன கைண்ட் ஆஃப் வெப்பனை வச்சு எத்தனை பேர் என்ன இப்படி அடிச்சாங்க அப்படிங்கிற ஹிஸ்ட்ரியை, லைக் மேடம் ராஜலக்ஷ்மி said, the recording of history of what the patient says is very essential, because I will come to the corroboration part of it. In the AR, that is called AR entry, right? Accidental report, entry, accidental register. அதில் நீங்கள் போட entry till the end of the judgment, it helps, it works, because அங்கே தான் நீங்கள் வந்து you first check the vitals of the patient, if he is conscious or if he is in a fit state of mind to tell what he is saying, and அதை நீங்கள் ரெக்கார்ட் பண்ணிடுறீங்க. And then the so called wound certificate comes to us. இப்போ இங்கே என்ன in between நடக்குது அப்படின்னா, பேஷண்ட் ஒரு வழியில் ஒரு பரிதவிப்பில் உங்ககிட்ட வந்து he says a lot of things, நீங்கள் அப்படியே நீங்களும் ஜோசியம் பார்க்கல, இன்வெஸ்டிகேட்டிங் ஆஃபீஸரும் ஜோசியம் பார்க்கல, அவன் சொல்கிறது தான் நீங்கள் எழுதுறீங்க, நீங்கள் ரெக்கார்ட் பண்ணுறீங்க. What happens is, investigating officer when he comes to the hospital to get a statement, புகார் வாக்கு மூலமோ புகார் மனுவோ வாங்க வரும்போது there arises discrepancies. I have spoken to a lot of police personnel also, requesting them to first go through the AR entry. ஏன்னா AR entryல நீங்கள் என்ன கொடுத்துருக்கீங்களோ that will start the investigation, will lead the investigation fairly. ஏன்னா உங்ககிட்ட என்ன கம்பால் அடித்தான் அப்படின்னு சொல்லுவான், but while investigating to the police, the victim either tutored or for some his own reasons, he might say என்ன கம்பியால் தாக்கினா அப்படின்வான். ஸோ அந்த கம்பிக்கும் கம்புக்கும் உள்ள வித்தியாசம் will reflect on the nature and the type of the wound inflicted on him, right? So இதில் தான் ஆரம்பிக்குது. That is why I said justice begins with you. சரி இப்போ வந்து எஃப்ஐஆர் இஸ் ரெஜிஸ்டர்ட் வித் டிஸ்கிரிப்பன்ட் இன்ஃபர்மேஷனே வச்சுக்குவோம். Again, the victim is given an opportunity to tell what actually happened to him trial சமயத்தில் witness boxல ஏறி நிற்கும்போது he is able to tell. Again, hurt cases பற்றி பார்க்கும்போதுல there are 4 types of hurt, as you all should know. Simple hurt, with weapon, without weapon, grievous hurt, with weapon, without weapon. A lot of guidelines have been given to medical practitioners as to how to decide on the injury. Grievous hurt na ungalku theriyum, deadly weapons kondu taakumbodhu, if there is any misfiguration of the face or an extraction of tooth, or 15 to 20 days ku mele if the patient is complaining of body pain or some permanent disfiguration, in the madri you have some guidelines to follow whether it is grievous or simple. இப்போ அதை பொறுத்து எங்கள் இன்வெஸ்டிகேட்டிங் ஆஃபீஸர்ஸ் ஒன்றும் பெருசாக ரெக்கவரிலாம் பண்ணுறதில்ல. ஐ எம் சாரி டு சே, பட் தட் ஷுட் பி டன் வெரி ஃபேர்லி. ஒரு கம்பியோ கத்தியோ லத்தியோ எதை வச்சு அடித்தாலோ எதை வச்சு காயப்படுத்தினாலோ தட் வெப்பன் ஹேஸ் டு பி ரெக்கவர்ட் ஃபார் தட் ஹர்ட் கேஸ் டு பி ப்ரூவ்ட். இப்போ சொன்னேன் இல்லையா, ஜஸ்டிஸ்னால் எனக்கு உண்டான நீதி நியாயமான முறையில் எனக்கு கிடைக்கணும். And the discrepancy caused by the police officer in not recovering the weapon. அப்போ என்ன ஆகும், ட்ரையலுக்கு வரும்போது விட்னஸஸ் ஐ விட்னஸஸ் எல்லாம் சொல்லுவாங்க, இவன் இந்த இடத்துல இன்னாரை இப்படி அடித்தா நான் பார்த்தேன் அப்படின்னுவாங்க. ஸோ ஐ விட்னஸஸ் ஆக்குலர் விட்னஸஸ் சொல்லிடுறாங்க. ஆஃப்டர் தேட் அதை சப்போர்ட் பண்ணுறதுக்கு என்ன எவிடன்ஸ், கொராபரேட்டிவ் எவிடன்ஸ் ஆஃப் த மெடிக்கல் ப்ராக்டிஷனர் கம்ஸ் இன். அங்கே ஏஆர் ரிப்போர்ட்டை போய் பார்த்தோன்னா ஏஆர் என்ட்ரியில் பார்க்கும்போது இங்கே கத்தின்னு சொல்லியிருப்பான், அங்கே கம்புன்னு சொல்லியிருப்பான். The major contradiction comes in, sets in, and sometimes the case is completely denied justice because என்ன சொல்லுவாங்க, இப்போ ஏன்னோ கிரிமினல் ட்ரையலில் வந்து கேஸ் இது எடுத்துருங்கப்பா, நான் ஏதாவது நோண்டிடுவேன், அதில் இதை எடுத்துருங்க, எதையாவது நோண்டிட போகிறேன், ஒன்றும் இல்லையா? ஓகே. Proved, disproved, proved, not proved, and disproved. Proved na enna, case proved and hence an acquittal. Not proved நிறைய பார்க்குறோம். acquittal என்ன சொல்லுவாங்க, மேஜிஸ்ட்ரேட் கொடுக்குற ஜட்ஜ்மெண்ட்டில் the prosecution has not adduced enough evidence to prove that the accused is guilty. So சந்தேகத்தின் பலனை எதிரிக்கு அளித்து அவரை விடுதலை செய்கிறோம் அப்படின்றாங்க. ஸோ கேஸ் நாட் ப்ரூவ்ட். டிஸ்ப்ரூவ்டுன்னு ஒன்று இருக்குது, அது வேறு அசிங்கமான விஷயம். அதில் வந்து we are the persons who are being affected because நாங்கள் கொடுத்துருக்க எவிடன்ஸை தப்புன்னு டிஸ்ப்ரூவ் பண்ணுவாங்க. இது தப்பான எவிடன்ஸ் அப்படிங்கும்போது கொடுக்க முடியலைங்கிறது வேற, கொடுத்த எவிடன்ஸை தப்புன்னு சொல்லும் போது அது எவ்வளோ பெரிய அவமானம் ப்ராசிக்யூஷன் டிபார்ட்மெண்ட்டுக்கு. ஏன் அது வருது? போலீஸோட அஜாக்கிரதை. We have told a lot of seminars are going around. Please take note of the AR entries which are made by the doctors because that is where investigation starts. A fair investigation can start only from the AR entry. இது ஒரு புறம். அடுத்து பார்க்க போனால் dying declarationல வந்து முக்கியமான விஷயம், டாக்டர்ஸ் play a very pivotal role because only எத்தனையோ கேசஸ் விடுதலையில் முடிஞ்சிருக்கு because doctors opinion that the patient was not in a fit state of mind. ஆனால் investigating officers, that is the police agency and the prosecution department, அவங்க வந்து எப்படியாவது ஒரு சர்டிஃபிகேட்டை கொண்டு வந்துடுவாங்க, ஒரு ரிப்போர்ட் கொண்டு வந்துடுவாங்க that so and so person caused this to her or him or whatever. அந்த ஒரு வரி the victim was not in a fit state, he was slipping into a coma அப்படின்னு இருந்துட்டாலே that dying declaration is totally non-admissible. It cannot be reliable at all. அங்கே போச்சு. So I hope you understand and get the point. The crucial, the crux, pivotal point வந்து it is in the hands of the doctor. So I expect and I request, அந்த நேரத்தில் I know the kind of work you do, the commitment and the work tension and the pressure and all that. ஒருத்தர் ரெண்டு பேரை ட்ரீட் பண்ணுறதுக்கே அவ்வளோ பிரச்சனையாக இருக்குது வீட்டில், எத்தனாயிரம் பேர் உங்ககிட்ட வராங்க. ஸோ இட் இஸ் அ tedious job. பட் உள்ளதை உள்ளபடி நம்ம ரெக்கார்ட் பண்ணிட்டோன்னா everything will go on in a very perfect way. Coming into முக்கியமான விஷயம், accident cases. இதில் நிறைய பேர், all of us or many of us drive 4-wheelers here. நம்ம ரோட்டில் போகும்போது தான் தெரியும் ஆக்சிடென்ட்ஸ் எப்படி நடக்குது அப்படின்ட்டுன்னு. லிக்கர் அண்டர் இன்டாக்சிகேஷன் ஒரு 2-வீலர் ஓட்டிட்டு வந்து நம்ம மேலே மோதுவான், இல்லை ஒரு லாரி மேலே மோதுறான், இல்லை ஒரு பஸ் மேலே மோதுறான், செத்து போயிடுறான். ஃபைன், ஹீஸ் லாஸ்ட் ஹிஸ் லைஃப். அவன் இன்குவெஸ்ட்டுக்கும் போஸ்ட்மார்ட்டத்துக்கும் வரும்போது அட் த ரிக்வெஸ்ட் ஆஃப் நல்ல மனம் படைத்த சில போலீஸ் அதிகாரிகளோட வேண்டுகோளுக்கு இணங்க நம்ம நல்ல மனம் படைத்த மெடிக்கல் ப்ராக்டிஷனர்ஸ் என்ன பண்ணுறாங்க, there was no content of alcohol in the bowel அப்படின்னு ஒரு ரிப்போர்ட் கொடுத்துட்றாங்க. இங்கே you all know the famous saying, right? அதாவது 100 குற்றவாளிகள் விடுதலையாகலாம், ஆனால் ஒரு நிரபராதி தண்டிக்கப்படக்கூடாதுங்கிறது தான் கரெக்டான ஒரு ஸ்டேட்மெண்ட். அப்போது நம்ம நோ ஆல்கஹால் இந்த பவல்னு கொடுத்துட்றோம். ஸோ ஹீஸ் என்னமோ அவர் வந்து ரோட்டில் போயிட்டுருக்கும்போது ஒரு பஸ் அது நம்ம லெட்ஸ் நாட் கோ இன் டு ஹவு தி ஆக்சிடென்ட் ஹேப்பன், பட் ஐ எம் டாக்கிங் ஆன் டேர்ம்ஸ் ஆஃப் இன்டாக்சிகேஷனில் ஒருத்தன் தானாக வந்து மோதி இல்லாட்டி ஹீ டேஷஸ் இன் டு அ வெஹிக்கிள், அ பிகர் வெஹிக்கிள் அண்ட் ஹீ டைஸ் அப்படிங்கும்போது அந்த அக்யூஸ்டுக்கு அங்கே நீதி மறுக்கப்படுது இல்லையா? ப்ராசிக்யூஷன் இஸ் நாட் அபவுட் காயம்பட்டவனுக்கோ அடிபட்டவனுக்கோ இறந்து போனவங்களுக்கோ வந்து நீதி கிடைக்கணும்னு இல்லை. Justice to everyone. So there the accused is being penalized or he is being convicted for wrong implications. அது தவிர்க்கப்படணும். அதனால again I am saying எதுவாக இருந்தாலுமே உள்ளதை உள்ளபடி நம்ம எழுதியோ நம்ம ரெக்கார்ட் பண்ணி பழகிட்டோம் அப்படின்னா till the end that justice will be carried. Truth எங்கே போனாலும் உண்மை வந்து கடைசி வரைக்கும் நிற்கும். That is my statement and my expectation, என்னுடைய தாழ்மையான கருத்து. Also, இப்போ POCSO case, sexual offenses பற்றி வந்தோ, Rajalakshmi ma'am was very elaborate and exhaustive on what are the methods and procedures and protocols that has to be followed. I have absolutely no doubts on that. அவங்க உங்கள் தாட்ஸை கொஞ்சம் borrow பண்ணிக்கிறேன் மேம்னா. Like how I said, the case history, recording of the case history is very important. இப்போ இதில் I have conducted, sometimes I have conducted POCSO cases also. Usually, ma'am, நீங்கள் சொன்னீங்க 72 ஹவர்ஸ்க்கு மேலே traces of semen இருக்காது, it is very hard to detect அப்படின்னு சொன்னீங்க. அதுதான் உண்மை. POCSO கேசஸாக இருக்கட்டும், ரேப் கேசஸாக இருக்கட்டும், sexual assault அப்படின்னா என்ன? It is forcible sexual assault on some woman. And the girl or the woman, when she comes either to the police station or to the doctor, அவ மனசுக்குள்ள ஒரு குழப்பமாயி இதை சொல்லவா சொல்ல வேண்டாமா அப்படின்ற முடிவு பண்ணி by the time she comes to the reporting agency, very sadly இன்னமும் நம்ம நிறைய POCSO cases பார்க்குறோம், but it is only 25% of the cases being reported. Statistics அப்படி தான் சொல்லுது. Most of them do not, out of shame, they do not come out. ஏன்? ஒரு பொண்ணு, ஒரு child or a woman, when she is sexually assaulted and she comes and reports to a reporting agency, இந்த சொசைட்டியோட பார்வையே அவ மேலே மாறி போயிடுது. That is the whole reason. I guess you should all agree with me. In the, what was that famous case? Niharika, the நார்த்தில் நடந்த கேஸில் that girl was gang raped and நிர்பயா அந்த கேஸில் she was gang raped and that junail உங்கள் எல்லாருக்கும் தெரியும், who is set free, that boy is the one who used iron rods to, her intestines were literally strewn out through her vagina. அப்படி ஒரு grievous crime பண்ணி, ஒரு heinous crime பண்ணிட்டு, and that girl eventually she succumbed to the injuries. And there were a lot of people who were saying, அந்த நேரத்தில் அந்த பொண்ணுக்கு என்ன வேலை? That is how the society is. அந்த விக்டிமுக்கு வந்து நியாயம் கிடைக்கிறதுக்காக நம்ம போராடுறோமோ இல்லையோ, we become judges for the situation. கமெண்ட் அதிகம் நம்ம இஷ்டத்துக்கு பண்ணி பழகிட்டோம். அது கருத்துரிமை நிறைய இருக்குது இந்தியாவில் அப்படின்றதுனால we are profusely giving wrong comments on the offenses that are happening. Sadly, that should not happen anymore. So, இப்போ இந்த kind of offensesல okay, yeah, அவ வந்து why she does not report? Because of ஒரு பயம், ஒரு ஷேம், இதனால வர மாட்டேன்றா, அப்படியே வந்துடுறா. ஒரு 4 நாள் கழிச்சு பேரண்ட்ஸ் கிட்ட மெதுவாக சொல்கிறா she fears pregnancy or she fears anything else. ஏதோ ஒரு சார்ட்டில் she comes and reports. அப்போ கண்டிப்பாக ஆன் எக்ஸாமினேஷன் அந்த 4 நாளும் அவள் குளிக்காமல் இருந்திருக்க மாட்டா. she would not have abstained from changing her clothes. So definitely semen traces இருக்காது. ஸ்வாப்ஸ் எடுத்தாலும் சரி, that's okay, ஸ்வாப்ஸ் எடுத்தாலும் சரி, ஸ்லைட்ஸ் எடுத்தாலும் சரி, கண்டிப்பாக அதில் வந்து ட்ரேசஸ் இருக்காது. அப்போது அந்த டைமில் மெடிக்கல் ரிப்போர்ட்ஸ் எப்படி எங்களுக்கு கிடைக்குது அப்படின்னா, there is no evidence to show that no recent sexual activity has happened. அப்படி தான் சொல்லப்படுது. சமீபத்தில் உடலுறவு கொண்டதற்கான சாத்தியக்கூறுகள் எதுவும் காணப்படவில்லை. அது எப்படி சரியாக முடியும்? Just because semen traces are not found, that doesn't mean that the child, that the girl, the woman was not raped. There are many ways. Madam சொன்ன மாதிரி dress change பண்ணிட்டாலோ இல்லை if she chooses to have immerse herself in a bath, definitely traces போயிடும். So what is expected of the medical practitioners is, நீங்கள் அப்படியே traces not foundன்னு கொடுத்துட்டா கூட போதும். Because when it says சமீபத்தில் உடலுறவு கொண்டதற்கான சாத்தியக்கூறுகள் இல்லை அப்படிங்கும்போது அது எதுக்கான பதில்னா, the famous 2-finger test per vaginum examinationல தான் at the end result வந்து நம்ம அப்படி சொல்லுவோம். If the vagina does not admit 2 fingers, sexual activity ஏற்பட்டதற்கான சாத்தியக்கூறுகள் இல்லை அப்படின்ற ரிப்போர்ட்ஸ் முந்தி கொடுத்துட்டு இருந்தாங்க. இப்போ semen trace is not found என்றது does not mean that there was no sexual activity. So I have POCSO casesல டாக்டர்ஸ் கிட்ட இந்த கேள்வியை கேட்டிருக்கேன். மேம் 4 நாளைக்கு அப்புறம் தான் ரிப்போர்ட், அந்த கேஸில் ஆக்சுவலி பார்க்க போனால் ஆஃப்டர் 4 days only the victim has come and complained. அப்போ கண்டிப்பாக இருக்காது. அப்போ அந்த குழந்தை வந்து குளிச்சுட்டா இருக்குமா மேம்னா இல்லை அப்படின்றாங்க. இதுக்கு பதில் அப்படி ஒரு கேள்வி கேட்ட பிறகு அந்த பதிலை சொல்கிறதுக்கு பதிலாக மெடிக்கல் எக்ஸாமினேஷன் ரிப்போர்ட்லேயே செமன் ட்ரேசஸ் நாட் ஃபவுண்டு. அப்போது ப்ராசிக்யூஷன் கேட்கும் போச்சில் டாக்டர்ஸ் என்ன சொல்கிறாங்க, அப்படி சொல்ல செக்ஷுவல் ஆக்டிவிட்டி நடக்கலைன்னு சொல்ல முடியாது, பட் யூ கான் ப்ரூவ் வாட் ஹேப்பன்ட். ஸோ ஐ டோன்ட் நோ வாட் த கைட்லைன்ஸ் ஆஃப் த மெடிக்கல் ஆஃபீஸர்ஸ் ஆர் சார். அது எப்படி நீங்கள் கொடுக்கணும் அப்படிங்கிறது தெரில. இது எங்களுடைய கிரீவன்ஸ், த டிஃபிகல்ட்டி விச் வி ஆர் ஃபேஸிங் இன் நாட் பீயிங் ஏபிள் டு ப்ரூவ் த கேஸ். அந்த ஒன்று 2-finger test ஏன் பேன் பண்ணாங்க அப்படின்னா, it is of no scientific value at all. Absolutely no scientific value. In 2022 state of Jharkhand versus Shailendra Kumar என்ற கேஸ்க்கு அப்புறம் தான் this the Supreme Court issued guidelines and to the Union Health Ministry and the State Health Ministry also that it be circulated to all the doctors that 2-finger test must be banned completely. ஏன்னா not only that the woman or the girl has undergone trauma during the sexual assault, திரும்ப ஒரு டாக்டர் கிட்ட வந்த பிறகும் she undergoes a lot of trauma because of the 2-finger test. இந்த 2-finger அதில் என்ன சொல்கிறாங்க அப்படின்னா, இதை பண்ணி தான் ஒரு பொண்ணு சொல்கிறத நம்பணும்னு அவசியம் இல்லை. she says I am sexually assaulted, let's believe she has been sexually assaulted. அதுதான் ஒரு பொதுவான கருத்து. Okay, so sexual crimes pati, that is the requisition I place before the group of doctors. And the medical reports kudukumbodhu, see how far you can be fair enough. I'm not saying illadada irukku solla vendiyadilla, irukkiradha maraikava vendam, ulladha ullabadi sollita mattume podumanadu. That will speak volumes. Ennaikkum nermayum unmayum vandu maranju pogave seiyadu. One. And about corroboration I said, இப்போ யூஸ்வலி in a criminal trial என்ன ஆகும்னா, நேரடி விட்னஸஸ் கண்கண்ட சாட்சிகளை வச்சு தான் the case will be proved. ஸோ கண்கண்ட சாட்சிகள் வந்து ஒரு offense இப்படி நடந்தது அப்படின்னு சொல்லும்போது the medical expert opinion தான் வந்து எங்களுக்கு ஹெல்ப் பண்ணும். That is after the eyewitness is deposing before the court of law, that is when we look for the medical evidences report, medical experts report. So அந்த டைம்ல victim சொன்ன nature of the weapon and the nature of the injuries found on the victim and the first information given to the medical officer while examination, ட்ரீட்மெண்ட்டுக்காக வரும்போதுல அவங்க கொடுக்குற முதல் தகவலையும் corroborate பண்ணி பார்க்கும்போது that is such a golden piece of evidence for us. ஸோ அதில் இன்னும் கொஞ்சம் கேர் அண்ட் அட்டென்ஷன் கொடுத்து ஏஆர் என்ட்ரி பண்ணும்போது I guess it will be very helpful if doctors give more attention to the first information being recorded, the case history, whatever history provided by the victim himself at the beginning of treatment. Also, the Supreme Court has given guidelines about how a doctor witness has to be treated in the court of law. எனக்கு தெரிஞ்சு நிறைய பேர் கோர்ட்டில் வந்து டீபோஸ் பண்ணியிருப்பீங்க. Most of the doctors are treated with utmost respect. இப்போ நான் வேலை பார்த்த எல்லா கோர்ட்லேயுமே வெள்ளை கோட்டு போட்டு ஒருத்தர் வந்துட்டார்னா அவருக்கு தான் ஃபர்ஸ்ட் ப்ரிஃபரன்ஸ். பிகாஸ் யூஆர் அ லைஃப் சேவிங் சேவியர்ஸ், இன்ஃபேக்ட் காட். நாங்கள் அப்படி தான் பார்ப்போம், நீங்கள் எப்படி சொல்கிறீங்கன்னு தெரியல. எனி கோர்ட் ஆஃப் லா, அது மேஜிஸ்ட்ரேட்டாக இருக்கட்டும், பப்ளிக் ப்ராசிக்யூட்டராக இருக்கட்டும், டிஃபென்ஸ் அட்வொகேட்ஸாக இருக்கட்டும், first thing a doctor comes to court to depose, அவங்கள தான் முதல்ல chief and cross examination பண்ணி அனுப்புகிறோம். But still if there are certain persistently இந்த இதில் ஏதாவது சங்கடங்கள் இருந்தால் please feel free to inform the judiciary, because again and again there have been guidelines which have been issued that doctors have to be given first preference when they come to the court of law. And I have seen so far doctors have been treated with utmost respect and you know அவங்க வந்து அவங்களுக்கு தான் முன்னுரிமையும் முதலுரிமையும் கொடுக்கப்படுது. Again, சீக்கிரம் பேசி முடிச்சுட்டோம், பேப்பர் முடிஞ்சிருச்சு. ஓகே, injustice anywhere is a threat to justice everywhere. ஏதாவது ஒரு இடத்துல injustice நடந்தா கூட it is a threat to justice. உலகளாவிய அளவில் it is a threat to justice. அதனால that was said by Martin Luther King, I will do right. அது மட்டும் நம்ம மோட்டிவாக இருந்தால் போதும். எனக்கு கொடுக்கப்பட்டிருக்க பணியை நான் சரியாக செய்வேன், அவ்வளோதான். the rest will happen. அதுக்கப்புறம் the good will happen, follow in its own way. ஸோ பொய்க்கு ஆரம்பம் இல்லை, ஆனால் நிச்சயம் முடிவு உண்டு. உண்மைக்கு ஆரம்பம் உண்டு, ஆனால் முடிவு இல்லை. அந்த உண்மை உங்ககிட்ட இருந்து ஆரம்பிக்குது. That is what we believe in. Thank you. So நம்மளை எல்லாரையும் படைச்சு இங்கே ஒருங்கிணைச்சு கொண்டு வந்த இந்த இயற்கைக்கும் யூனிவர்ஸுக்கும் நன்றி சொல்லி I thank and I thank Dr. Sudalaimuthu specially for having given me this great opportunity to address you all. Thank you so much. ரொம்ப கேள்வி கேட்றாதீங்க.
It was a very nice talk, madam. You have formed a bridge between medicine and law.
Yeah, sure. Thank you, ma'am.
Some clarity is there.
சார் பயமா இருக்கு சார், கேட்காதீங்க சார், எதுவும் உங்களுக்கு தெரியும் எனக்கு.
இல்லை தேங்க்யூ மேடம், நீங்கள் ப்ரூவ் பண்ணிட்டீங்க. எப்போவுமே நாங்கள் வந்து வி ஆர் எக்ஸ்பெக்டிங் ஸ்லைட்ஸ் நிறைய இருக்கும், ரொம்ப நேரம் வெயிட் பண்ணீங்க, அப்போ நிறைய ஸ்லைட்ஸ் இருக்குமோ அப்படின்னு நினச்சோம். பட் ரெண்டே ஸ்லைடில் வந்து 40 minutes வந்து யூ டிஃபர் ஃப்ரம் டாக்டர்ஸ். ஸோ யூ ப்ரூவ் தட் யூ ஆர் ஏ பப்ளிக் லீகல் பர்சன்.
தேங்க்யூ. அதை பேச மட்டும் தான் தெரியும், எழுதலாம் தெரியாது. எனிவே டாக்டர் Sudalaimuthu இல்லை அருண்குமார் சார் கூப்பிட்டு கேட்டார் என்கிட்ட, மேடம் பிபிடி ஏதாவது ப்ரெசென்ட் பண்ணுறீங்களான்னு. அதெல்லாம் எனக்கு தெரியாது சார், நீங்கள் வேணால் எதாவது போட்டுக்கோங்க அப்படின்னு. அதாவது சொன்னேன், எனக்கு விதிக்கப்பட்ட பணியை நான் பண்ணிகிட்ருக்கேன், அவ்வளோதான். தட்ஸ் ஆல். ஐ நோ டு டாக். சொல்லுங்கள் சார்.
உங்கள் பேரை பார்த்தா ஏஞ்சலினா ஜூலியா, ஜூலியா ஏஞ்சலா? உங்க பேரு தூத்துக்குடி பேர் மாதிரி தெரியுது. I don't know. I wish that you are from Thoothukudi, son of the Sai.
Oh, yeah. நானே அந்த ஆங்கில யோசிச்சது இல்ல.
Very good. எங்க Aloysius is a convent எங்க?
Convent, Holy Cross.
I'm from St. Saviour's.
Okay, sir. Okay.
See, as is rightly said, jurisprudence is interdisciplinary or
exactly.
What is the multidisciplinary? What is your opinion about coroner? Because எங்களுக்கு வந்து the credibility தெரியாது or demeanor of the witness இதெல்லாம் தெரியாது. We just come and talk to you. Whereas, so in England, there is a combination of a medical graduate undergoing the law. So we want India to a medical law to create people like you, we have to join together. Psychiatrists, forensic scientists can do. Some of you can also join with us.
Oh, that is a great pleasure. Kandipa, that will be such a privilege to do that. Sir, what is expected of a medical expert is கன்விக்ஷன்ல முடியணுமா அக்விட்டல்ல விடுதலையில் முடியணுமாங்கிறது ஆஸ்பெக்டே கிடையாது. அதையும் தாண்டி ஒரு ஜட்ஜு ஒருத்தரை விடுதலை பண்ண நினச்சிட்டாங்கன்னா அவங்க நிறைய ரீசன்ஸ் அவங்களுக்கு வந்துடும். வாட் ஐ எம் சேயிங் இஸ் ஆஸ் அ ப்ராசிக்யூட்டர் உண்மையான ஒரு காயம்பட்ட நபருக்கு வந்து நிறைய நேரங்களில் த அக்யூஸ்ட் இஸ் அலவுட் டு செட் கோ ஃப்ரீ விச் இஸ் வெரி பேத்தட்டிக் டு நோட்டிஸ். அந்த நேரத்தில் தீஸ் மெடிக்கல் எவிடன்சஸ் வில் ஹெல்ப் அஸ். அதனால தான் சொல்கிறேன், திஸ் ஓன் சர்டிஃபிகேட்ஸ் அண்ட் த மெடிக்கல் ஒப்பீனியன்ஸ் உள்ளதை உள்ளபடி சொன்னால் மட்டும் போதும். we know how to present it in the court.
ஒரு ஃபார் யங்கர் ஜெனரேஷன் நீங்கள் ரொம்ப நல்லா கோலெல்லாம் போட்டிருக்கிறீங்க. மெடிக்கல் லா இஸ் அப்கமிங் ஸ்பெஷாலிட்டி. ஐஐடி கேரக்பூர்லாம் நீட்டுக்கு கஷ்டப்படாமல் ஐஐடி கேரக்பூர் ஹஸ் காட் எல்எல்பி எக்ஸ்க்ளூசிவ் ஃபார் சயின்டிஸ்ட் அண்ட் டாக்டர்ஸ் ஐபி அந்த மாதிரி அதையும் இது பண்ணுங்க. நாளைக்கு நம்ம மெட்ராஸ் யூனிவர்சிட்டிலேயோ தமிழ்நாடு உங்கள் லா அகாடமி சேர்ந்து ஒரு சாண்ட்விச் கோர்ஸ் மாதிரி கூட பண்ணலாம். ஸோ தட் அவர் கான்வர்சேஷன் will become fruitful for the
exactly sir.
நீங்க பயப்படாதீங்க, நல்லாவே பேசுறீங்க, நல்லாவே எழுதுங்க. Thank you.
Excuse me madam, a சின்ன clarification.
சொல்லுங்க சார்.
Legal clarification தான். What is the impact of alcohol, influence of alcohol over a claim? Over claim insurance claim over.
இல்ல claim exactly அந்த claim வராது இல்லையா?
Because that is the reason.
சார் கரெக்டா சொன்னாங்க. அதான் அவனுக்கு இப்போ ஒரு மோட்டார் ஆக்சிடென்ட்ல வந்து ஒருத்தன் இறந்து போறான் அப்படின்னா இன்டாக்சிகேஷன்ல இருந்துட்டு டூ வீலர் ஓட்டினா அப்படின்னா the claim will not be available. அது அடிபட்டு போகும்.
Not available or little bit less.
இல்ல சார், அது claimே பண்ண முடியாது. that is wholly his fault. அப்படிங்க இல்ல அதுல தான் நான் என்ன சொல்ல வரேன், அப்ப அவனுக்கு பணம் கிடைக்கிற தப்பு இல்ல, தப்பே செய்யாம ஒருத்தனுக்கு மட்டும் தீர்ப்பு கன்விக்ஷன் கிடைக்கிறது நியாயம் இல்லையில்ல. தட் இஸ் வேர் தட் ஒரு நிரபராதி கூட குற்றவாளி ஆகக்கூடாதுன்றதுக்கான சான்று அதுதான். நாங்களே கேட்டிருக்கோம், போலீஸ் டாக்டர்ஸ்ட கேட்கும் போது அவங்க என்ன சொல்றாங்க, மேடம் போலீஸ் இன்ஸ்பெக்டர் சொல்லுவார் பாவம் கிளைம் கிடைக்காது அதனால அதை நோட்டீஸ் பண்ணலன்னு போட்டு விட்டுருங்க அப்படின்னா என்ன ஆயிரும் அப்படின்னா சம் விட்னஸஸை கிராஸ் எக்ஸாமின் பண்ணும்போது அதை கேட்டு வாங்கிடுவாங்க டிஃபென்ஸ் அட்வொகேட்ஸ். அவர் கோயில் கொடைக்கு போயிட்டு வந்தார் அப்படி தானே, கோயில் கொடையில் இதெல்லாம் கொடுத்துருப்பாங்க, லிக்கர்லாம் கொடுத்துருப்பாங்க இல்லையா, அதெல்லாம் சாப்பிட்ருப்பாரு, அதுக்கப்புறம் தான் வண்டியை ஓட்டிகிட்டு வந்தார். அப்படிங்கும்போது ஒரு ஜங்ஷன் உள்ளே கொடுத்துட்றாங்க ஃபார் த ஜட்ஜ் ஆர் த மேஜிஸ்ட்ரேட் டு டிசைட். அப்போ இவன் இன்டாக்சிகேஷன்லாம் இருந்திருக்கான் அப்படின்றது ஐ கெஸ் அது வேணாமே. அது கிளைம் இஸ் அது மானிட்டரி பெனிஃபிட்ஸாக இருந்தாலும் பரவாயில்ல, ஹீ இஸ் நாட் எலிஜிபிள் ஃபார் தட் கிளைம். குடிச்சிட்டு வண்டி ஓட்டக்கூடாதுன்றது வந்து சட்டம். யூ மஸ்ட் ஹவ் நோன் அபவுட் தட். இந்த போர்ஷே கார் ஆக்சிடெண்ட்டை பற்றி தெரியும்ல சார், அந்த பையன் குடிச்சிட்டு வண்டி ஓட்டி the mother was capable to even change the blood samples. How atrocious. ரெண்டு உயிர் போயிருச்சு அதில். அதனால அந்த மாதிரி விஷயங்களை கருத்தில் கொண்டு let us not அப்படியே வந்தாலும் உள்ளதை உள்ளபடி எழுதிருங்க. இன்ஸ்பெக்டர் சொன்னால் என்ன, அவர் அந்த கேஸை முடிச்சுட்டு அவர் போயிடுவார். கேஸ் அங்கே வரும்போது it is we who are facing the difficulties.
One more request madam.
சொல்லுங்க சார்.
I want in your own words to sensitize regarding the signing and having a proper seal, because you find it many a times to fix who has given that document. Many times or to avoid going to the court, some of the experts they just scribble and without proper seal.
Exactly.
In those times you find it very difficult to fix who has given the document.
Correct.
So unga words you please sensitize the audience.
இல்ல அதுவும் சார் சொன்னது வந்து ஒரு பெரிய மேஜர் டிஃபிகல்ட்டி we are facing, because ட்ரீட்மெண்ட் கொடுத்து கொடுத்த டாக்டர் கரெக்டாக வித் நேம் அண்ட் சீல் சைன் பண்ணி அந்த wound certificate கொடுத்துருந்தா மட்டும்தான் we can procure. இப்போது புது அமெண்ட்மெண்ட்டில் புது லாஸ்லேயும் சரி பழைய லாஸ்லேயும் சரி மெடிக்கல் சர்டிஃபிகேட்ஸ் டாக்டர்ஸ் நீட் நாட் கம் ஃபார் ஆல் பெட்டி கேசஸ். எல்லாத்துக்கும் டாக்டர்ஸ் வரணும்னு அவசியம் இல்லை. unless the defense expects the doctor to be available for cross examination, doctors need not come. ஆனால் அப்படி வேண்டப்படுற கேசஸில் some doctor is sent if the signature is not properly affixed and the seal is not properly affixed, யாரோ ஒரு டாக்டர் வந்துடுறாங்க பாவம். they will find it so difficult to explain the kind of injuries. You reminded me. Another difficulty what I face is ஒரு காயம் ஏற்படுது ஒருத்தருக்கு தலையில் ஒரு இரும்பு ராடை வச்சு அடிக்கிற. திஸ் இஸ் அ ரீசெண்ட் கேஸ் விச் ஐ ஃபினிஷ்ட். நான் திருவாடனிலேருந்து வரும்போது there was a cross examination. அவன் கம்பியை கொண்டு அடிக்கிறான் and it is நல்ல கிழிந்த காயம். இங்கே இட் இஸ் லைக் திஸ் டயக்னலாக என்ன சொல்லுவீங்க ஹொரிசான்டல் இப்படி இருக்குது காயம். சூச்சர்ஸ் போடப்பட்டிருக்கு. டாக்டர் எவிடன்ஸ் எல்லாம் கரெக்டாக சொல்லிட்டாரு. கிராஸில் அவர் ஒரே கேள்வி கேட்டார், சார் இந்த காயம் வந்து ஒருத்தர் நிலையில் போய் மோதிக்கிட்டா வருமா சார்? டாக்டர் வரும் அப்படின்னு சொல்லிட்டாரு. அது எப்படிங்க வரும்? நிலையில் போய் மோதினா இப்படி தானங்க இடிக்கும், இப்படி தானே இடிக்கும், இப்படி எப்படிங்க வரும்? கரெக்டு, ஆப்பர்ச்சுனிட்டிஸ் இருக்கு, வாய்ப்புகள் இருக்கு. அப்போ அதை இன்னும் கொஞ்சம் எலாபரேட்டாக சொல்லிட்டா நல்லா இருக்கும். டிபெண்ட்ஸ் ஆன் த ஃபோர்ஸ். அவன் எப்படி போய் இடிக்கிறான், இல்லை கீழே ஒரு கூரிய ஆயுதம் கிடக்கு அது மேலே இவன் போய் அந்த ஃபோர்ஸில் அப்படியே விழுந்தாலும் ஒரு ராடை கொண்டு அடிக்கும்போது ஏற்படுற காயத்துக்கும் தானாக போய் விழுந்து ஏற்படுற காயத்துக்கும் நிறைய வித்தியாசங்கள் இருக்குது. அந்த விஷயத்தில் கொஞ்சம் எலாபரேட்டாக இருந்தீங்கன்னா எங்களுக்கு ரொம்ப வசதியாக இருக்கும்.
தேங்க்யூ.
தேங்க்யூ சார். சொல்லுங்கள் சார்.
One more question regarding the legal point. So sometimes for psychiatry opinion இல்லைன்னா மற்றதோ டீன் ஆர்எம்ஓ அந்த மாதிரி நமக்கு ஜுடிஷியல் மார்ஷில் நம்ம லெட்டர் வருது. ஸோ ஆஃப்டர் we finish the report we will send to the judicial magistrate. If there is any protocol, for example we don't write the judge's name, அந்த மாதிரி இது இருக்கா?
அப்படி ஒன்றுமே கிடையாது. You don't have to mention the name of the judge at all.
Okay madam.
It is the designation. இப்போ judicial magistrate court number 1 2 அப்படின்னு உங்களுக்கு ஒரு array இருக்கும். அதை மட்டும் மென்ஷன் பண்ணா போதும் சார்.
The report sent through only the registrar of the court or directly you can send the report to the concerned judicial magistrate.
Judicial magistrate-க்கு தான் போகணும். To the concerned judicial magistrate-க்கு தான். Name is not necessary.
Sir, sorry to intervene. Sir, any request, sir please, any request you have to reply to the sender. If the letter comes from judicial magistrate, your reply goes to judicial magistrate. If the letter comes from the registrar, your reply goes to the registrar, not otherwise.
But recently, in one court, they told that you don't mention the judge's name. So it is somewhat is called as offense, like they told. And also they told that all the reports sent only through the registrar, not directly to the concerned judge.
No, sir. It is highly unlikely. Highly unlikely.
10 days back, our dean was called to Madurai for this. So because he has mentioned the judge, that is he is asking. So it should be written to the address to the registrar, not to the name to the judge. That is the.
If the requisition is from the judge, it has to go back to the judge, then, sir.
I'll conclude, madam. Sir, the situation is different. I get to the point what you are saying.
Actually, all certificates from where the request has come, you will have to answer there. If it comes from orthopedics professor Pavalan, you have to write only to orthopedics professor. If he has written the name Pavalan, you can also write the name back. But otherwise, it is always to the person who requests that report. By the post, not by the name. Usually, it should not be by the name.
Exactly.
And another thing, madam, what you told is, in many courts, even the judges say, just answer yes or no to every question. He is not saying, we can explain. If we want to explain also, that நிலையில இடிச்சா வராது அப்படின்னு சொல்லணும்னா நீ அதெல்லாம் சொல்லக்கூடாது. வருமா வராதான்னு கேட்டா
அதை சொல்றதுக்கு அவங்களுக்கு உரிமை இல்லை சார்.
ஆமா,
ப்ராசிக்யூஷன் கேஸ் நாங்க பிரசன்ட் பண்றோம்.
அதனால சில we have out of our experience we have derived certain things. வருமா வராதான்னு கேட்டோம்னா வராதுன்னு சொல்லி நெகட்டிவ் திங்.
அது ஏன் ஒருவேளை ஒரு பயமா இருக்கும்.
நெகட்டிவ் சொன்ன உடனே அவங்க ஏன் வராதுன்னு கேட்பாங்க. அப்ப நீங்க சொல்லலாம் சார் நிலை இப்படி இந்த மாதிரி திருப்பி தலையை வச்சு இடிச்சோம்னா வரும் அப்படின்னு சொல்லி சொன்னோம்னா they will record. அது சொல்றதுக்கு தெரியும்.
எக்ஸாக்ட்லி சார் சொல்றதும் கரெக்ட். நிலையில அடிச்சாலும்
இது கோர்ட்ல வந்து வருமா வராதான்னு சொன்னா
வராதுன்னு சொன்னா அதை ரெக்கார்ட் பண்ண மாட்டாங்க.
சோ அதை ரெக்கார்ட் பண்ணணும்ங்கறப்போ நம்ம நெகட்டிவ் சொன்னோம்னா அவங்க they will allow us to explain அல்லது எக்ஸ்பிளைன் பண்ண விட மாட்டாங்க. ஜட்ஜ் ஈவன் the judge and the defense lawyer will join hands சேர்ந்து சொல்லுவாங்க. ப்ராசிக்யூஷன் அமைதியா உட்கார்ந்திருப்பாங்க. we will be thrown to ourselves.
நான் சண்டை போடுவேன் சார்.
நீங்க சண்டை போடுவீங்க நிறைய பேர். ஆக்சுவலா ஒரு செக்ஷுவல் அஃபென்ஸ் கேसेसல நான் வந்து எக்ஸாமின் பண்ணதுக்கு வாட் இஸ் யுவர் டிகிரி, நீ லால என்ன சப்ஜெக்ட்லாம் படிச்சான்னு கேட்டாங்க. அதுக்கு அடுத்து நான் கேட்க வேண்டியதாகி போச்சு. ஜட்ஜ் வந்து நீ கேட்கறதுக்கு மட்டும் பதில் சொல்லு அப்படின்னு சொன்னாங்க. மெடிசனில் என்னென்ன சப்ஜெக்ட் படிச்சிருக்கேன்னு சொல்லி நான் சொல்கிறேன், நீ லால என்னென்ன சப்ஜெக்ட் படிச்சிருக்கேன்னு சொல்லு. அந்த மாதிரி கேட்டு வெதர் யூ ஆர் எலிஜிபிள் டு பி அ லாயர் ஆர் ஐ ஆம் எலிஜிபிள் டு பி அ மெடிக்கல் எக்ஸ்பர்ட்டுங்கிற ரேஞ்சுக்கு பேச வேண்டிய சுச்சுவேஷனில் ஜட்ஜஸ் கீப் தேர் மவுத் ஷட், ப்ராசிக்யூட்டர் கீப்ஸ் தேர் மவுத் ஷட் அண்ட் டிஃபென்ஸ் லாயர் ஆல்சோ கீப்ஸ் தேர் மவுத் ஷட். அண்ட் மோரோவர் டாக்டர்ஸ் வந்து நிறைய பேர் திங்க் பண்ணுறதே கிடையாது. அதனால தான் நான் மேடம் சொன்ன இதில் சொன்னேன், நிறைய பேர் வந்து தப்பான ஒப்பீனியன் நம்ம கொடுக்குறோம். இன்னொன்று தெரியாதனமாக நம்ம வந்து எக்ஸீட் பண்ணுறோம், நம்ம லிமிட்ஸை தாண்டுறோம். அது கோர்ட் ஃபைன்ஸ் இஸ் வெரி, அதாவது ரொம்ப ஈஸியான தொக்கா பிடிச்சிக்கிறாங்க. டாக்டர்ஸுக்கு ஒன்றும் தெரியாது அப்படின்ட்டு. டாக்டர்ஸுக்கு வந்து உண்மையிலே என்ன தெரியணுமோ அது மட்டும்தான் தெரியணும், அதுக்கு மேலே ஸ்டெப் அவுட் பண்ணக்கூடாது. ப்ரீவியஸ் பாக்ஸோவுக்கு முன்னால் டாக்டர்ஸ் நிறைய பேர் எமோஷனலாக ஒப்பீனியன் கொடுத்து அந்த கேஸுகள் வந்து அக்யூட்டல் ஆகிருக்கு. ரேப் கேசஸில் ஈவன் இன் ஸ்பைட் ஆஃப் தேர் இஸ் எவிடன்ஸ் ஆஃப் இன்டர்கோர்ஸ் கொடுக்குறதுக்கு பதிலாக தேர் இஸ் ரேப் அப்படின்னு சொல்லி ஜட்மெண்ட்டே கொடுத்துருக்காங்க. அப்படி கொடுத்ததுனால கேஸ் விடுதலை ஆகிருக்கு நிறைய கேஸ், பிகாஸ் ஆஃப் எந்தூசியாஸ்டிக் கைனகாலஜிஸ்ட் கிவிங் த ஒப்பீனியன். அவங்க ரொம்ப எந்தூசியாஸ்டில் கொடுக்குறது. ஸோ வி ஷுட் நோ அவர் லிமிட்ஸ். அந்த லிமிட்டேஷனில் என்னென்ன பண்ண முடியுமோ அது மட்டும் சொல்லணும். இட் இஸ் ஃபார் த ஜட்ஜஸ் டு டிசைட் தென் பேஸ்ட் ஆன் த ஃபைண்டிங்ஸ் வி கிவ். நம்ம சயின்டிஃபிக் ஃபைண்டிங்ஸ் இருந்தால் சொல்லணும், இல்லாட்டி இல்லைன்னு சொல்லணும், அவ்வளோதான். அந்த போல்ட்னஸ் நமக்கு தேவை. ஆனால் அந்த கிரிமினல் ஆக்ட் நடந்திருக்கா நடக்கலையாங்கிறதுல ஒரு பாயிண்ட் கூட நம்ம சொல்லக்கூடாது. ஏன்னா இட் இஸ் லெஃப்ட் டு த ஜட்ஜ் டு கிவ் த டிசிஷன். அதை வந்து நீங்கள் சொல்லணும். ப்ராசிக்யூட்டர்ஸ், ஐ ஹோப் ப்ராசிக்யூட்டர்ஸ் லைக் திஸ் மேடம் வில் ஹெல்ப் அஸ். தேர் ஆர் மெனி ப்ராசிக்யூட்டர்ஸ், மெனி டைப் ஆஃப் ப்ராசிக்யூட்டர்ஸ். அவங்க ஹெல்ப் பண்ண மாட்டாங்க. மேடம் ஹெல்ப் பண்ணுறதுக்கு தேங்க்யூ.
தேங்க்யூ ஸோ மச் சார். இட் இஸ் மை பிரிவிலேஜ்.
லீவ் த டாக்டர்ஸ். ஸோ டாக்டர்ஸ் ஆல்சோ ஷுட் நோ. ஒரு கேஸ் போகிறதுக்கு முன்னால் ப்ராக்டிக்கலி ஹியூமனாக இதால் முடியுமா முடியாதான்னு பார்த்துட்டு நம்ம திங்க் பண்ணிட்டு போகணும். அதுக்காக தான் இந்த மேடம் சொன்ன எலாபரேட் ஒரு எக்ஸ்பிளனேஷன் மேடம் கேவ், கைனகாலஜிஸ்ட் கேவ் ஒயில் எக்ஸாமினிங் எ கேஸ். அதில் எல்லாமே நமக்கு வராது, பாதி கூட நமக்கு வராது. ஒரு கேஸ் பார்க்கும்போது 25% தான் நம்ம பார்க்க வேண்டியிருக்கும். பட் we will have to have the 100% by them, by our table side, so that we can refer and at least find out this case fits into this only. அதனால இந்த ஒப்பீனியன் கொடுக்கலாம் அல்ல ஒப்பீனியன் கொடுக்கக்கூடாது அல்ல இந்த மாதிரி ஒப்பீனியன் கொடுக்கணும் அப்படிங்கிறது நமக்கு தெரியும். கோர்ட்டில் போனாலும் we will be easily facing the court and coming out. இதில் இன்னொரு பெரிய பியூட்டி மேடம், ஐ எம் வெரி சாரி டு சே, நான் வந்து அசிஸ்டன்ட் ப்ரொஃபஸர் இருக்கும்போது பண்ண ஒரு கேஸ் இப்போ தான் கோர்ட் ஜட்ஜ்மெண்ட் வருது நெக்ஸ்ட் மந்த். ஸோ ஐ எம் ரிட்டையர்ட் அண்ட் 4 years பேக். இவ்வளோ நாளும் கேஸ் வரல, இப்போ கோர்ட்டில் வந்துட்டு நீ இன்னைக்கு வந்தாகணும்னு சொல்லி சமன் கொடுக்குறாங்க.
அதான் சார், இப்போ உங்களுக்கு ஒரு இம்யூனிட்டி இருக்குது. 294 சிஆர்பிசி, பழைய சிஆர்பிசியில் யூ டோன்ட் ஹேவ் டு கம் டு டிபோஸ். பட் இன் கேஸ் தட் மெடிக்கல் ஒப்பீனியனை பேஸ் பண்ணி தான் கேஸே அமையுது அப்படிங்கும்போது டிஃபென்ஸ் லாயர் அவங்க வந்தால் தான் நல்லா இருக்கும். அப்படி அவங்க டிஸ்பியூட் பண்ணுவாங்க. பிகாஸ் நாங்கள் ஃபைல் பண்ணுவோம் வழக்கமாக. எம்பி ரிப்போர்ட்டுக்கு தேவையில்லை, டாக்டர் ரிப்போர்ட்டுக்கு தேவையில்லை, ஃபாரன்சிக் ரிப்போர்ட்டுக்கு. இட் ஸ்பீக்ஸ் வால்யூம்ஸ் இல்லையா? த ரிப்போர்ட் இட் செல்ஃப் ஸ்பீக்ஸ்.
இந்த மாதிரி இந்த மேடம் சொன்ன இந்த கேஸ், இந்த இம்யூனிட்டி நமக்கு இருக்கிறது நிறைய ஜட்ஜஸுக்கு தெரியாது. அதனால நிறைய கேஸில் நீங்களே பார்த்துருப்பீங்க 304A கேசஸில் இது வாகன விபத்தில் ஏற்படுமா, இதான் டிஃபென்ஸ் கொஸ்டின். ஏற்படும் அப்படின்னு சொல்லியாச்சுன்னா உடனே முடிஞ்சு அனுப்பிடுவாங்க. இதுக்காக வேண்டி கூடுறது உங்களை
இல்லை. அதுலேயே ஃபன்னியாக ஒரு கேள்வி கேட்பாங்க, அவன் மண்டை செதறி செத்து போயிருப்பான் அண்ட் கை காலு லிம்ஸ் எல்லாம் உடஞ்சி போயிருக்கும், இது அவன் தானாக போய் விழுந்து அந்த காயங்கள் ஏற்படுமான்னு கேட்பாங்க. வெரி ஃபனி. ஹவு குட் தட் பி பாசிபிள்? சில டாக்டர்ஸ் ரொம்ப ரொம்ப உண்மையாக சொல்லுவாங்க, சார் இது ஒரு யூனோ பக்கா ரோடு ஆக்சிடென்ட் கேஸ் சார், ஒரு ஹெவி வெஹிக்கிள் மேலேயோ இல்லை அவரோ இவரோ அந்த மோதின கேஸு, இது எப்படி தானாக ஏற்பட வாய்ப்பு இருக்குது அப்படின்ட்டு.
ஸோ இந்த மாதிரி உள்ள கேசஸில் வந்து ஆக்சுவலாக யூ ஹேவ் டு பி போல்ட், பட் யூ ஹேவ் டு அட்டெண்ட் த கோர்ட் அட்டன் பண்ணணும். பண்ணிவிட்டு யூ ஹேவ் டு கிவ் எவிடன்ஸ் இன் த ப்ராப்பர் வே. எவிடன்ஸ் வந்து நமக்கு என்ன தெரியுமோ அது மட்டும் தான் கொடுக்கணும். அதுக்கு மேலே கோர்ட் என்ன லீட் பண்ணால் கூட யூ ஷுட் கீப் யுவர் மவுத் ஷட் அண்ட் அலோவ் த கோர்ட் டு கோ பை இட்ஸ் ஓன். தேங்க்யூ.
Drunken pillion rider dies in an accident. அப்போ அந்த
இன்சூரன்ஸ் கிளைமா சார், அது வந்து பில்லியன் ரைடர் யா, அவருக்கும் வாய்ப்பு ரொம்ப கம்மி. But then pillion rider ஆயிருக்கும் போச்சுல if the vehicle the person who
drunk and drive தான மேடம் offense drunk and travel
exactly அவனுக்கு claim வந்து
excuse me madam. Actually recently one judgment from High Court Chennai that the pillion rider actually he was not drunk but the driver was drunk but he knows that the driver was drunk that he allows the driver to drive the vehicle. So one punishment was awarded by one judge. This is available in internet, all internet.
Oh.
That's why he is asking.
இல்ல பில்லியன் ரைடருக்கு அது அப்ளை ஆகாது. பில்லியன் ரைடருக்கு அப்ளை ஆகாது. பில்லியன் ரைடருக்கு வந்து ரோட் ஆக்சிடென்ட்ஸ்ல உள்ள கிளைம் எடுத்துக்கலாம்.
நிறைய கண்ட்ரீஸ்ல டிஃபரண்ட் லெவல்ஸ் ஆஃப் ஆல்கஹால் இஸ் பிரிஸ்கிரைப்ட். அப்படினா ஆல்கஹால் அடிச்சிட்டு வண்டி ஓட்ட அலௌடா? இல்ல அந்த லெவலுக்கு அந்த கண்ட்ரில அலௌட் அப்படினு அர்த்தம். இல்ல பில்லியன் ரைடரை பத்தி பிரச்சனை இல்ல. பில்லியன் ரைடர் இருந்தாலும் இல்லாட்டாலும் ஒன்றும் பிரச்சனை இல்லை. drunken pillion
சார் அவங்க claim பண்ணிக்கலாம். pillion rider claim பண்ணிக்கலாம் சார். It is the one who is on the wheel. அவரதான் மட்டும் accept
பண்ணல. டிரைவருக்கு எந்த லெவல் வரைக்கும் தண்ணி அடிக்கலாம்னு. நிறைய லாரி டிரைவர்ஸ் தண்ணி அடிச்சாதான் வண்டி ஓட்ட முடியும்.
ஆனா அதுக்காக ஆளையே மாத்திர கூடாதுல சார்.
ஒழுங்கா வண்டி ஓட்ட முடியும்.
சார் அதுக்கு
அடிக்கலாம் ஒழுங்கா வண்டி ஓட்டிட மாட்டாங்க. சோ அந்த மாதிரி உள்ள சிச்சுவேஷன்ல இந்தியால என்ன அந்த மாதிரி ஒரு லெவல் ஃபிக்ஸ் பண்ணல. ஒவ்வொருத்தருக்கும் ஒவ்வொரு மாதிரி இருக்கும். சரி சிலருக்கு தண்ணி அடிச்சாதான் வண்டி ஓட்ட முடியும். சிலருக்கு தண்ணி அடிச்சா வண்டி ஓட்ட முடியாது. ஸோ தண்ணி அடித்து வண்டி ஓட்ட முடிஞ்சது யாரு முடியாதது யாருங்கிறத ஜட்ஜு டிசைட் பண்ண முடியாது, டாக்டரும் டிசைட் பண்ண முடியாது. அதை முதல்ல ஜட்ஜஸுக்கு நம்ம வந்து ஹைலைட் பண்ணணும். டாக்டர் 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 கரெக்டாக ஒரு ஒப்பீனியன் கொடுத்துருவார் அப்படின்னு நினைக்கக்கூடாது. டாக்டருக்கும் இதுக்கு ஜட்ஜ் பண்ண முடியாது. இவர் வந்து தண்ணி அடித்தா நல்லா வண்டி ஓட்டுவார் அப்படிங்கிறத டிசைட் பண்ண முடியாது.
இல்ல
அடிக்காதனால தான் ஆக்சிடென்ட் ஆச்சு.
நிறைய இடத்துல பில்லியன் ரைடர்னு ஏன் சார் அந்த கான்செப்ட் வருதுன்னா யார் வண்டி ஓட்டினான்னு தெரியாது நமக்கு. பில்லியன் ரைடர் வண்டி ஓட்டினாரா மது அருந்திட்டு ஓட்டினது யாருன்னு தெரியாதுல்ல. அதனால அந்த கிளைம் இஸ் சப்ஜெக்ட் டு இதுதான் லாட் ஆஃப் அனாமலிஸ் தான் கண்டிப்பா. Sure, sure.
Thank you.
That was a nice discussion.
Thank you,
that
sir.
too, when the topic was alcohol, it will be more and more vibrant. And one more thing, frequently I am attending MCOP cases. During that session, the defense lawyer, that is opposite side lawyer will ask, if a person, pillion driver is drunken, அவர் சேஃபா வண்டியில புடிச்சிட்டு உட்கார முடியுமா? This is the opinion they are asking from the doctor. அவர் பில்லியன் டிரைவர் நல்லா குடிச்சிருந்தாருன்னா அவரால ஒழுங்கா புடிச்சிட்டு பாதுகாப்பா பின்னாடி உட்கார்ந்து போக முடியுமா? This is the question they are asking.
How can a medical expert answer this question? அவன் தோலை புடிச்சிட்டு உட்கார்ந்திருந்தானோ வயித்தை புடிச்சிட்டு உட்கார்ந்திருந்தானோ that is his அவன் ப்ராப்ளம். அது எப்படி ஒரு மெடிக்கல் எக்ஸ்பர்ட் சொல்ல முடியும் சார்?
சார் சொல்றது மேடம், it is a classic example for contributory negligence.
Exactly.
There are situations like
அவன் ஒழுங்கா பிடிச்சுக்காம உட்கார்ந்திருந்தானா ட்ரங்கன் மோட் ஸ்டேட் ஆஃப் மைண்ட்ல இருக்கும்போது ஒரு திடீர் ஜர்க் வரும்போது கூட he will not be conscious to hold tight. டபக்குன விழுந்துருவான். அப்ப ஹெட் இன்ஜரி ஆகி அவனுக்கு காயம் ஏற்படுறதுக்கு வாய்ப்பு இருக்கு.
Like I would like to answer this question. In those situations there are certain cases, not in our country, there are certain judgments in certain countries where the rider was asked to pay the compensation amount.
Exactly. That is how it works. In some countries, the rider has to pay because he took him. Intoxication la avare கூட்டிட்டு போயிருக்க கூடாதுன்ற நம்ம ஊர்ல வந்து பக்கத்துல உட்கார்ந்திருப்பாங்க, பின்னாடி உட்கார்ந்திருப்பாங்க, நல்ல போதையில இருப்பாங்க. ஆனா ஓட்டுநர் மட்டும் போதையில இருக்க மாட்டாரு. அது காப்பாத்துறதுக்கு நிறைய விஷயங்கள் நடக்குதுல்ல சார். டிரைவரை பக்கத்துல உட்கார்ந்துட்டு வண்டி ஓட்டுறவங்களும் இருக்காங்க for safety sake. But that is subject to anomalies Indian laws la. சொல்லமுத்து சார் உங்க பேரை காப்பாத்திட்டேன்னு நினைக்கிறேன். தேங்க்யூ
மேடம். ஒன்று மட்டும் கிளியர், நீங்க சொல்லதை பார்த்தா நீங்க எப்போ ஜட்ஜா வருவீங்களோ அப்போ there will be a drastic changes.
கண்டிப்பா வர மாட்டேன் சார், அங்க போக மாட்டேன்.
Yes, fine. I think we are not having any more questions. I guess we'll close the session. Thank you, madam. That was really an eye opener. Thank you.
Thank you, ma'am. Thank you. We welcome our Vice Principal to Forensic Quest 24. With great esteem, I request our chairpersons to felicitate our honorable speaker, Ms. Judy Angelo, ma'am, Assistant Public Prosecutor, Judicial Magistrate Court, Tirunelveli. With great admiration, I request Dr. Meenakshi Ma'am, HOD of Pharmacology, GTKMC, to present memento to Dr. Manivasagam Sir, Associate Professor of Forensic Medicine, GMKMC Salem. With regards, I invite Dr. Ganga Ma'am, Associate Professor of Anatomy, to honor Dr. Pavalan Sir, HOD, Department of Orthopedics, Government Thoothukudi Medical College. Next, I kindly request Dr. Manikanda Raj Sir, Associate Professor FM Kilpak Medical College, to honor Dr. R.C. Rajesh Ma'am, HOD Department of Pathology, Government Thoothukudi Medical College. Once again, we express our heartfelt gratitude to the speaker and chairpersons.
We'll be commencing the inauguration ceremony of Forensic Quest 2024 shortly. Before that, it is with great pride and enthusiasm that I stand before you as we mark an historic moment for our college. We, the 21st batch of TKMC, under the guidance from the Department of Forensic Medicine, we took an initiative in organizing the first ever intercollegiate online event of our institute, an initiative that truly embodies the spirit of innovation, collaboration, and academic excellence that our institution stands for. We had received a lot of entries from colleges across India under the categories of online quiz, e-poster presentation, art, photography, reels, poetry, memes, movie poster recreation, and story writing. With respect to the national level quiz, on July 19th, we conducted a preliminary round for 56 teams consisting of students from various states across the nation, including central institutes, out of which 7 teams were selected for the finals, which was conducted on the 22nd of July, where the first prize was bagged by SET GSMC Mumbai, followed by Maulana Azad Medical College, New Delhi. Third place was won by Government Kadalur Medical College, Tamil Nadu. With regards to the other events, we've received over 185 entries ranging from colleges across the country, for which we'll be displaying the winners under each category. The winners for the online quiz.
Quiz Mysterio Revelio. Winner Debayan Banerjee, Sanket, Salve, State GSMC. Now we have the runner-up, Mihir Rai and Tejas, Maulana Azad Medical College. Second runner-up, Jayachandran Kashwin, Jayachandran and Ashwin. Sharan, Sri Venkateshwara Medical College. These are the photographs given by various entries.
Memes, Elmemster. The first prize was bagged by KP Naveen, PIMS, Puducherry. Second place is shared by Vasuprata Kims, Deena Surya from Erode Medical College.
Next we have poetry, Echoes de Evidencia. Winners, Janet Kavimalar, Madurai Medical College. Second prize is shared by Kishore from Gundur Medical College and Rashi Singh of Thoothukudi Medical College.
Poster presentation, posted offerance. The first place was bagged by Vishwa from Thoothukudi Medical College. Second prize is shared by Aisha Malik, IGMCRI Puducherry, Tapasya from Dhanalakshmi Srinivasan Medical College.
In Forensic Forge, winners Komal Agarwal from Thoothukudi Medical College. The second prize is shared by Pavitra B, Sri Moogambika Medical College and Tharani Dharan from Thoothukudi Medical College. Crime story writing, Morgue Mysteries. Winners are Nikita from Sri Moogambika Medical College and second prize is shared by Mithun Rahul from Dindigul Medical College and Nakul Pranav from Thoothukudi Medical College.
Reels, Espresso Forensis. The first place was bagged by Harris Sam from Ariyalur Medical College. Second place is shared by Durai Karthikeyan from Thoothukudi Medical College and Rakshita TRL from Thoothukudi Medical College. I request everyone to be seated quietly. We'll be starting the inauguration ceremony in few minutes. We'll be presenting the online entries under various categories on the screen. We welcome our Honorable Dean Dr. Sivakumar sir to Forensic Quest 2024. We welcome you, sir. A science born of curiosity. Through scalpel and scope, they probe and explore. Expert eyes scrutinize each detail fine, reconstructing lives in a forensic shrine. Justice awaits as the truth takes stand, reveals the story of life's final show. Good morning to all the dignitaries, delegates and students. With great joy and immense pleasure, I feel privileged to extend my warm greetings and welcome to all present here for the inauguration of Forensic Quest 2024. On behalf of the entire Department of Forensic Medicine, Government Thoothukudi Medical College, into this propitious day where we all have gathered for this much awaited Forensic Quest 2024, recast and replenish. Now I request everybody here to stand up in respect to Tamil Thaivarthu. Feet that beat with rhythm so pure, eyes that tell stories, movements that allure. Now I call upon Arguna Selvi to enlighten the stage with her classical moves.
गणेशाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
अविद्यानामन्तस्तिमिरमिहिरद्वीपनगिरे जननां चैतन्यस्तबकं करन्दश्रुतिझरे. Translation. Oh gracious one, you're the sun that dispels the darkness of the unlettered. You're the stream of consciousness for the unthinking fool. Narilanam chintamani gunarika janma jalada nimagnalam dhamshamuranipuvarahasya bhavati.
Kirdaka junuta dimta kirdaka junuta dimta kirdaka junuta dumta dhum ta na 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 dhum dhum ta na 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 dhum dhum agappa dhum dhum ta na na de na 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 dhum dhum agasa ragida dhum da 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 di ra na 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 da da gida dhum da da gida dhum da gida dhum 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 da na 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 de na 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 dhum kirta na di ra na gama gama ma gama pa ma ga sa ni sa kirta na di ra na gama gama ma gama pa ma ga sa ni sa kirta na di ra na gama gama ma gama pa ma ga sa ni sa. Come on now, follow my lead. Come on now, follow my lead.
Thank you, Narguna Selvi, for your lovely performance. I now welcome the guest of honor, Dr. Edwin Josa, with great privilege onto the dais. With immense respect, I now invite our resident medical officer, Dr. Sailesh Jayamani sir, onto the stage. With immense respect, I invite our Honorable Dean Professor, Dr. G. Shivakumar sir, onto these dais. With heartfelt admiration, I invite our Medical Superintendent, Dr. It is our honor to welcome Principal Professor Dr. Kalavani ma'am onto the dais. I now invite our Medical Superintendent Dr. Padmanabhan sir onto the dais. I now invite Dr. Sudalai Muthu sir, Professor of Forensic Medicine Department, onto the dais. I now invite Organizing Secretary Dr. S. Peranandam sir to the dais.
The commencement of our gathering today is marked by a cherished tradition, the lighting of the lamp. சுடர் வீசும் அகல் விளக்கை அலங்கரிப்பாய் இவ்விடத்தே, இடர் நீங்கும் ஒளி தருவாய் இருள் சூழ்ந்த உள்ளத்தே. Now we have the lamp lighting ceremony. I call upon the esteemed dignitaries to join the lamp lighting ceremony, thereby initiating our collective journey.
Thank you, sir and madam, for doing the honors.
It is with great pleasure and honor that I welcome Dr. R. Sudalai Muthu sir, the esteemed head of Department of Forensic Medicine, to Forensic Quest. His dedication to forensic medicine and his contributions to the field have truly set a remarkable standard for excellence and innovation. Under his leadership, the department has not only advanced in academic and research pursuit, but also has played a critical role in the intersection of science and justice. His expertise and commitment are deeply appreciated, and we are grateful for the opportunity to benefit from his insight and guidance. I welcome Dr. R. Sudalai Muthu sir to give his welcome address.
A very pleasant good morning to everyone present here. It is with much pride, privilege and honor that I, Dr. R. Sudalai Muthu, Professor and Head, Department of Forensic Medicine, Government Thoothukudi Medical College, stand before you to extend a warm welcome to each one of you for the Forensic Quest 2024 recast and replenished, the first CME organized in Thoothukudi Medical College and the first workshop also organized in Thoothukudi Medical College. The program is conducted which brings together the medicine, judiciary and police departments. So as I reflect on the journey of Government Thoothukudi Medical College, we are reminded of its humble beginning during 2001. But 2021, a year that marked a pivotal moment in our history as we introduced postgraduate course, MD Forensic Medicine in our college. I am proudly honored to welcome our guest of honor for today's program, an extraordinary individual, a true hero in our medical field. I extend my heartfelt welcome to my teacher and my mentor, Dr. A. Edwin Josar, MD BL. Dr. Edwin Joe sir is not just a name, but a symbol of excellence in forensic medicine. His dedication and passion for the field has left an indelible mark in all who have had the privilege to work with him. As a former director of medical education and a distinguished professor of forensic medicine, his influence extends far beyond the lecture halls and laboratories. As a director of medical education, he championed reforms that have had the profound impact on medical curriculum and training standards. We thank you for your dedication, wisdom, and your unwavering commitment to advancing the forensic medicine department. Please join me with a round of applause for Dr. Edwin Joe sir. I warmly welcome Dr. G. Sivakumar sir, esteemed Dean of Thoothukudi Medical College, a distinguished leader in the field of medical education and administration. With a wealth of experience and a commitment to excellence, our Dean sir plays a pivotal role in shaping the future of healthcare professionals and advancing medical research. So in Tamil Nadu, we have more than 36 medical colleges. In all 36 medical colleges, we have so many deans. But our dean has a separate from all other deans. He has the quality, that is, ஈந்த பொழுது பெரிதுவோக்கும் தன்மகனை சான்றோன் என கேட்ட தாய். அத்தனை டீன்களும் வல்லவர்கள், சாரும் வல்லவர் தான், ஆனா நல்லவர். So our recent prayer is that Sir should continue as Dean of Government Thoothukudi Medical College until the next promotion. Yes, sir. I extend a warm welcome Dr. Kalavani Madam, Vice Principal of our college. Madam is one of the most important pillars of our institution, that is academic pillar. She is known that her dedication to student development, commitment towards the institution, and her leadership continues to inspire the students and faculties also. I welcome Medical Superintendent Sir, Dr. R. Badmanabhan Sir, a renowned pediatrician in Thoothukudi and a medical superintendent, Government Thoothukudi Medical College Hospital, who is one of the most important leader of our institution, has exemplified dedication, expertise, and compassion in leading our college. I welcome our strongest administrative pillar, Dr. Silas Javamani Sir, a residential medical officer, Government Thoothukudi Medical College Hospital, to this program. His constant presence and enthusiasm has undoubtedly inspired us. I warmly welcome Dr. P. Kumaran Sir, young and charming Deputy Medical Superintendent. He is our backbone. No word is needed. He is the backbone of our institution. On behalf of Department of Forensic Medicine, with respect and affection, I cordially welcome all eminent speakers, chairpersons, faculties of various departments of this college and other medical colleges, postgraduate students of various departments, and admiring undergraduates to this CME Forensic Quest 2024. Once again, a warm welcome to each one of you gathered here. Thank you.
Thank you, sir, for your lovely words.
Thank you, our Deputy Superintendent, Sir, Dr. Kumaran, sir. Due to official commitments, Dr. Balaji Saravanan, sir, Superintendent of Police, Thoothukudi District, is not able to join us today.
With great respect, I now request our RMO, sir, Dr. J. Silas Jayamani, sir, to share a few words.
Respected professors and my colleagues and present students and former students, and I am very happy to be here and see you all attending this CME. This is the first time our professor has organized this program, and I wish this program a grand success. Thank you.
Thank you, sir. Now I request our medical superintendent, Dr. R. Padmanabhan, sir, to share a few words.
Good afternoon, everybody. Respected guest of honor, Professor Edwin Josar, former DME of our medical curriculum. Respected Dean sir, respected VP madam, respected DS sir, respected Professor of HOD of RMO sir, respected Professor and HOD of Forensic Medicine, other dignitaries of the dais and on the dais. We welcome you all to this CME. I wish to congratulate the FM department who has conducted very well during the flood period. During 2023, February 17, we had flood situation, and under the guidance of our Dean as well as DME sir, Dr. Sangamani, and our Health Secretary, Dr. Bedi, who literally stayed for 7 days in our premises and guided how to mobilize the bodies, came to our mortuary because our mortuary is incapacitated by the flood and freezer box was not functioning, and we literally transported every body to the forensic department, Tirunelveli, and Professor Chodale sir has done the post-mortem there in the Tirunelveli Medical College. So I could be able to see this prowess during this crisis period. He has very well supported the administration. Congratulations to you, sir. And I wish the CME a great success. And thank you, one and all.
Thank you, sir. With great honor, I now request our Deputy Medical Superintendent, Dr. P. Kumaran, sir, to share a few words.
அனைவருக்கும் என்னுடைய காலை வணக்கங்களை தெரிவித்துக் கொள்கிறேன். ரெஸ்பெக்டட் டிஎம்இ சார், எங்களுக்கு எப்பயுமே அவர் தான் டிஎம்இ, டாக்டர் ப்ரொஃபஸர் எட்வின் ஜோ சார், அண்ட் ஹெச்ஓடி ஆஃப் ப்ரொஃபஸர் டாக்டர் எஃப்எம் டாக்டர் சுடலமணி சார், விபி மேடம், ஆர்எம்ஓ சார், டெப்டி மெடிக்கல் சூப்பரண்ட் சார், அண்ட் ப்ரொஃபஸர்ஸ் ஆஃப் வேரியஸ் மெடிக்கல் காலேஜ், டாக்டர் ராஜேஷ், டாக்டர் செல்வமுருகன் சார். And we hope we have seen him when the police riots way back before 5 to 7 years back in Thoothukudi. We really cherish your work those days, sir. And as you know, everyone, we conduct the CME in the clinical meetings during the clinical departments. It is I'm very happy to see one of the prime departments, especially the Helping Hand Department, Forensic Department, which is conducting a CME in a very grand manner. I wish this function a grand success. Thank you. Thank you for giving me the opportunity.
Thank you, sir. Now, with great admiration, I request our VP ma'am, Dr. V. Kalaimani ma'am, to share a few words.
Respected chief guest of today's function, Dr. Edwin Josar, former DME and our former Dean of Thoothukudi Medical College, our present Dean, Dr. Sivakumar sir, Medical Superintendent, Deputy Superintendent, RMO, HOD of Forensic Medicine, and other HODs from nearby colleges and other faculties of our college, and as well as from other colleges, and my dear students. A happy good afternoon to you all. So the CME is conducted to refresh the knowledge of the students. So this CME has covered so many topics in judiciary as well as in forensic medicine, so that it will enlighten not only the students and the faculties also. So we have to frequently conduct such programs in our college so that it will be a good atmosphere for the students to learn. And I congratulate the Department of Forensic Medicine, the HOD and other team, the faculty members and other paramedical staff for organizing such a wonderful CME and workshop in this college. Thank you one and all.
Thank you, ma'am, for your words. Now, with great honor, I request our Dean, Dr. G. Shivkumar, sir, to share a few words.
Respected guest of honor, our former Dean of this institution and our former DME, Dr. Edwin Joseph, respected Vice Principal, Medical Superintendent, Deputy Superintendent, Resident Medical Officers, eminent professors, delegates, faculties, all the students, very good afternoon to one and all. CME and workshop are hand in hand going together with the medical education, and it is an update to each and every medical professor because it is interlinked with all the departments and the judiciary. It is a very important one. You can see on entering itself, they have given us the quiz and the clues and other things. The elaborate manner they are conducting this. The forensic medicine conducting a CME and a workshop is not frequent as in other branches of medicine because of certain constraints. But when it is conducted, we can see the effort and their enthusiasm to spread the knowledge to every person so that it will be useful to all, both on and off the field. So they play a very critical role. Forensic department play a critical role. We have seen that because of their effort, certain times they help in pinpointing the diagnosis or cause of death of the patient, which helps for the further treatment or identifying the culprit or whatever it is. This is evident from our experience during our period also. We know that the cause of COVID also was found only by the forensic department in Italy when they did the post-mortem of all the cases. Then only the light came to on what is the pathophysiology and methods of treatment emerged following that one. So it is a very important department, and we see that as this department actually is aloof. It has been separated from the college, and it is only integrated when it is after death. So they play a great role here. Many can come across scenarios, what is happening around only by reading the medias and papers and other things, and scenarios created in this storybooks and movies. Even the latest movie, everybody have seen this, another movie named Cadaver. பார்த்துருப்பீங்கன்னு நினைக்கிறீங்க. So we keep in touch with them, but not as the reality what he is seeing. Another one is what has came to light is another movie which I saw is, if I don't know whether people know or come across that movie acted by Will Smith called The Concussion. That movie, it is a very important movie. The diagnosis of multiple injuries, head injuries caused during playing was being detected by one forensic pathologist, Ubuntu, who has put it the safety needed for protecting the head to prevent the injuries. So the department, because of them, forensic medicine, preventive aspects also come into light. So their work is very high. We doesn't recognize that much. When you sit in the top, when you get the recommendations from other people, from judiciary and other one, we come to know about the importance of the department. Otherwise, nobody cares about them. But I knew the hard work put in forth by the department, and I wish them, they are conducting such a great CME, and I wish them a great success. Thank you for giving me the opportunity.
Thank you, sir. With great admiration, I now request our guest of honor, Professor Dr. A. Edwin Jose, sir, to share a few words.
To follow the example and come out with many more laurels. And actually, forensic medicine in Coimbatore Medical College, I was promoted from here as Dean to Coimbatore Medical College Dean. And there a model mortuary was built on a trial basis, and it has been now very successful. And it is named as Temple of Medical Education. And as our Dean told, many diseases were found in autopsy, and that is how a medical person can achieve greatness, and many more important findings after death. Actually, before death you can see the clinical findings, but you will have to correlate with the findings that happen after death, so that you can come out with certain diagnosis and certain confirmations, and you can give it to the world as a research project, which is not happening to the required level in departments of forensic medicine, where cadavers are being wasted, autopsies are being done in half an hour and given to the relatives, and not given proper care. So I hope and pray that this department after the CME will become one center of excellence, where you can do lot of research and find out many things about the respiratory problems that occur over in this region, and find out with the solid solutions for prevention and treatment of the existing diseases. I hope and pray this CME will enlighten you a little about forensic medicine, so that this light that is lit here may travel many areas and set fire the entire world, so that forensic medicine will be more recognized. I hope this, I appreciate this venture taken by Dr. Sodalemuthu and his team. I wish them all success. Thank you.
Thank you, sir, for your esteemed words. Sir is nothing but a symbol of excellence in forensic medicine. His dedication and passion for the field has left an undeniable mark on all who had the privilege to work with him. As the former director of medical education and a distinguished professor of forensic medicine, his influence extends far beyond the lecture halls and laboratories. Thank you, sir.
I now request our Dean Sir, Dr. G. Shivakumar Sir, to felicitate our guest of honor, Professor Dr. A. Edwin Joseph.
Hukum, tiger ka hukum.
Next, I request our HOD Sir, to felicitate our Dean, Dr. G. Shivakumar Sir.
Now I request our HOD Professor to present the shawl to Dr. Edwin Joseph.
Now I request our HOD Sir to felicitate the Dean, Dr. G. Shivakumar Sir. I once again request our HOD Sir to felicitate our VP, Dr. V. Kalaivani Ma'am. Uday Kumar Sir. Now I request Dr. Uday Kumaran Sir to felicitate our Deputy Medical Superintendent, Dr. P. Kumaran Sir. Next, I request Dr. S. Peranandam Sir, Associate Professor, to felicitate our Medical Superintendent, Dr. R. Patmanabhan Sir. Next, I request R. Gangalakshmi Ma'am, Assistant Professor, to felicitate our RMO, Dr. J. Silas Jayamani Sir.
Now, I request Dr. S. Peranandam Sir, Associate Professor, Department of Forensic Medicine, Government Thoothukudi Medical College, to present the word of thanks.
Good afternoon, one and all present here. I would like to thank our chief guest, Dr. L. Balaji Saravanan sir, who is unable to come because of the official reasons. Anyway, thank you, sir, for the acceptance of as a chief guest in this occasion. And my sincere thanks to our former DME, Dr. A. Edwin Joseph, to coming here as a guest of honor. Sir's achievement and involvement in our field makes us proud, and it will be definitely a milestone to our medical fraternity. I would like to thank our respected Dean Dr. G. Shivakumar sir for coming here and gracing the occasion. My sincere thanks to respected Vice Principal Madam Dr. V. Kalaivani Madam for coming here and giving constant support to the entire event. I like to thank our administrative pillars of this institution, Dr. Padmanabhan sir, Dr. Silas Jaimani sir, Dr. Kumaran sir, for guiding us to make this event possible. I would like to thank Dr. Sivakumar sir, Associate Professor of General Medicine, Dr. Saravanan sir, for helping us to conduct.
SP Dr. Balaji Saravanan sir will be joining us shortly. We'll be moving on to the further sessions. Thank you all for joining us here and making the inauguration ceremony of Forensic Quest 2024 into a grand success. Thank you.
Our esteemed chief guest, Superintendent of Police, Thoothukudi Thoothukudi District, due to some urgent meeting with Chief Minister's video conference, our collector and SP sir went to Kulasai. So little bit late was there. He will be arriving within 20 to 25 minutes.
Moving on to the next section, medico-legal role of doctor in casualty. The medico-legal role of a doctor in casualty involves several key responsibilities, not just limited to medical assessment and treatment, but extends beyond to documentation, ethical responsibilities, and other aspects. Overall, the medico-legal role emphasizes the intersection between medical practice and legal requirements, aiming to provide optimal patient care while fulfilling legal obligations and responsibilities. I now invite our speaker, Dr. A. Selva Murugan sir, Professor of Forensic Medicine, Government Tirunelveli Medical College, to share his esteemed words for the session, Medico-Legal Role of a Doctor in Casualty. A TVMC trained scholar who has transitioned from being a student to serving as a professor at his own institution. His profound knowledge and unwavering determination towards commitment to excellence with regard to the forensic department makes him an invaluable asset to our student community. I now invite our chairpersons for the session, Dr. K. Gokul Ramanan sir, Professor of Forensic Medicine, GMKMC Salem. Welcome, sir. Moving on to our next chairperson, our very own Dr. Rajavel Murugan sir, Professor of General Medicine, Government Thoothukudi Medical College. Finally, I welcome our beloved Dr. Rakesh Fernando sir, Professor of General Surgery, Government Thoothukudi Medical College. We request the speaker and the chairpersons to occupy their seats. I would like to call upon Dr. Shivashankari ma'am, Associate Professor ENT, as the chairperson. Welcome, ma'am.
Good afternoon, everybody. First of all, I thank the organizers for giving me this opportunity to talk in front of the elite forum. And I also thank the chairpersons for permitting me to start my small talk. I thank Gokul Ramanan sir and my UG senior Rakesh sir for permitting me to start. Okay, the topic given to me is topic given to me is medico-legal role of doctor in casualty. So, you must know what is casualty. So we have, whenever we are writing the word casualty, we may have confusion about the spelling of casualty. Sometimes we may include I and made it as a casualty. Okay. A doctor who is doing medico-legal work not properly in the casualty will become a casualty for his career. So, they have to take extra care while doing medico-legal work. Right. So, casualty is a place where medical professionals has to take care. It is just a spelling mistake. Take care of medical and medico-legal needs of patient. So, who will do that medico-legal work and who will do that medical work? Is there any demarcation or any special post? Is there any demarcation or any special medical officers posted to take care of these two different varieties of work? It is not so. So a doctor who is posted in the casualty has to do both medical as well as medico-legal work. Whether it is knowingly or unknowingly, because only a thin line separates these two. During our education in medicine and also in practice of medicine, we are trained to do medical nature of work, and we are very much little exposed to medico-legal nature of work. But medico-legal nature of work must gain knowledge from our own experience, or at least from our peer knowledge, from those who experienced in that. Even now, many of the medical officers who are working, who are faculties working in other departments, various departments, don't know how to write an AR register and how to give a certificate and whom to give the certificate, etc. Okay. Why I am insisting that doctors must know not only medical work and also the medico-legal work? It's because both of them are separated by a thin line that we don't know which medical case may turn to be a medico-legal case. There's a possibility of a medical case converted to be a medico-legal case and not vice versa. Because once you entered a case as a medico-legal or branded it as a medico-legal, it remains as a medico-legal case until otherwise it is disproved. But that is not in our hands. So, there's a maximum possibility for a medical case to become a medico-legal and not in vice versa manner. Moreover, once you initiated or converted a case as or branded a case as a medico-legal case, then it will become multi-departmental nature. So that is to be investigated by the police department and further case may go for trial in judicial department. So it is interdepartmental in nature. So care must be given while branding a case as a medico-legal case, and care must be given while registering and documenting such cases. One such example I just mentioned here. Even a small word may made a medical case into a medico-legal case. For example, if a person is presenting to the casualty with a minor injury, stating that that is because of out of self-fall, and on examination you notice that it is not possible to attain such injuries, even though it is very small, in multiple places by a single fall. So you have to convert it as a medico-legal, and you have to raise suspicion about somebody's involvement in causing that injury. So, the branding of as a medico-legal case lies with the hands of a medical officer who is posted in the casualty. The noticement by a medico-legal case. So, I think this definition is explanatory. A medico-legal case is defined as any case of injury or ailment where the attending doctor, after history taking and clinical examination, considers that investigations by law enforcing agencies are warranted to ascertain circumstances and fix responsibilities regarding the said injury and ailment according to law. There is a definition for medico-legal case. So how to demarcate a medical case from a medico-legal case? Is there any yardstick to differentiate? No. Because at any time the medical case may convert it to be a medico-legal case. So the doctor who is making an entry must have a high degree of suspicion about the illness or about the injury, what the person is showing. And also he may have a dictum that it is until proved, presume all cases attending casualty as a medico-legal case. In that way, it is better to save their skin. So the usual medico-legal works carried out by doctors in casualty are, one is making of AR entry and issuing of wound certificate based upon the AR entry, what they made, and drunkenness examination and certification, sexual offences examination and certification, age estimation, and other needed time-to-time requirements. So here are some important points that we will discuss. How to make an AR entry? So in some courts, we used to saw some casualty medical officers who are depositing evidence before us. And in the court, they are handing over the original accident register copy to the doctor. Doctor is not able to read, as if he is pretending as that letters or handwriting is like they are dead ancestors, and started weeping. Because then the court, from the court they ask, what happened, doctor, why you are not able to read? Sir, the writing is not legible, they say. Then they will tell, even if it is not legible for you, then what for? How we are able to interpret that for writing? But in reality, it is not so. That was written by some other person, some house surgeon or CRMI returned that. And this fellow simply signed at the end of the paper. Or in advance, he may sign and hand over that to the house surgeons. It is not correct. Because once you are assuming or ready to do a medico-legal work, you must give undue care, because you are fully responsible for the thing what you return in that paper, and that paper will go till the end. What madam in the morning session told. The doctors are commit panna easy, commit aitannu vechu senjiruvanga. Then he is fully responsible for all the events that follows. That's why I used to tell to my students, if you are confident, proceed. If you are not confident, don't commit. So, sir சொன்னபடி கோர்ட்டில் வந்து டாக்டர் அவருக்குரியதை மட்டும் சொல்லணும், அதோட எக்ஸ்ட்ரா எதுவும் பேசாதீங்க அப்படிங்கிறது தான். எமோஷனல், there is no role for emotion in the court of law. So, by nature, doctors are loosey in nature. They used to give loosey talk. அடுத்தது வந்து பேஷண்ட்ஸ்ட பேசி வெர்பல் டைரியா நிறைய பேருக்கு இருக்கும். They'll go on talking. They don't know where to put the break. பேஷண்ட்டாக பார்த்து போதும் சார் அப்படிங்கணும், இல்லைன்னா அடுத்த பேஷண்ட் வந்துட்டு சார் நேரம் ஆகுமா அப்படின்னு கேட்டால் தான் நிப்பாட்டுவாங்க. And also, in practice, patients never talk back. ஸோ வந்துட்டோம், ரூபாயை கொடுக்கணும், அதுக்கு ஒரு அரை மணி நேரம் இருந்துட்டு போவோம் அப்படின்னு அவங்களும் கேட்டுட்டு இருப்பாங்க. ஸோ அதே ஆட்டிடியூட் இஸ் கண்டினியூயிங் ஃபார் மெடிக்கல் டாக்டர்ஸ். Wherever they go, they will talk. But when you are in a place where you are in a receiving end, better to avoid over talking or over talkative. Not be emotional. Stick on to the point. Before going to the court for the purpose of giving evidence, prepare and go. Without preparation, please don't go. At least you go through the document, what you send to the court, and read those documents once or twice. Okay? At least you may notice the mistakes what you did in that document. And in the open court, you may declare it as a mistakenly written, there is a spelling mistake, that is not in my original document, there is a rough document, that is a little bit change in the certificate created. Like that you may give and deposit the proper thing. Okay. So, while making an AR entry, you must take care that it must contain the date, time, name, age, sex, date of examination, time of examination, name, age, sex of the person whom you are doing an examination, and brought by, identification marks, and history given by the patient or the informant. That is very important to be recorded as such. If they are giving a history that they are beaten by some person with, and they are able to explain the, recollect the name and designation of the person who did, better you write. Because accident register entry is the alleged statement given by the victim. It is not your own investigative finding. So don't bother. So the seniors will guide. Accident register la யாராவது வந்து என்ன 2 பேர் அடிச்சான் அப்படினு சொன்னா அடிச்சான் மட்டும் போடு 2 பேர் அடிச்சான்ட்டு யார் பேர் எழுதாத அப்படினு. Why should we? Because it is an alleged statement. அவர் சொன்னதாவது தான் நம்ம சொல்ல போறோம். நம்ம புதுசா ஒண்ணு செய்ய போறதில்ல, நம்ம போய் அவர் அடிச்சாரான்னு பார்க்க போறதில்ல. பார்த்தா ஐ விட்னஸ் ஆயிரும். இல்ல பெட்டர் அவங்க சொல்றதை எழுதிட்டு போறது நம்மளுக்கு நல்லது. Because முன்னால மாதிரி இல்லை. இப்போ வந்து then they will register complaint against the doctor, or they may include the doctor as another accused, stating that that fellow is preventing from exposure of the accused. அவர் மறைக்கிறார், சாட்சிகளை மறைக்கிறாருன்னு சொல்லி அவரை சேர்க்கலாம். ஓகே. ஸோ அடுத்தவங்களுக்கு ஹெல்ப் பண்ணணும் அப்படிங்கிறதுலாம் வேண்டாம். ஃபர்ஸ்ட் சேவ் யுவர் ஸ்கின் அண்ட் தென் அதர்ஸ். தென் injuries in order with dimension. I saw so many AR copies that the patient sustained both sustained abrasion, laceration, contusion. Bracket la opinion, patient sustained both simple and grievous injury. Who asked that from you? Who wants such a comment from you? That a layman will say. So how to differentiate yourself from the layman? You have to number the injuries and specifically write what type of injury it is. Okay. And another thing, dimension. So used to write everything in 2 dimensions. But lacerations are in 3 dimensions. So at least keep it in mind. Then state of consciousness. You return everything that was the patient stated everything, etc., etc. And at the end you return as a patient semi-conscious. Then how it is possible to relay the words given by him? So you must be conscious. You must be conscious to write correctly. Okay. Then breath smell of alcohol. Recent High Court direction and our Director of Medical Education issue an order to collect blood for alcohol estimation in all traffic accident cases, including broadened cases. I don't know how it is possible to collect blood in a broadened cases in casualty, as there is no blood circulation. How it is possible? That I don't know, but that was in the circular. Then, is there any evidence of previous treatment? Because they may get treated in 2 or 3 hospitals and came to the government hospital only for the purpose of making accident register entry. So if there is any proof or any evidence of a previous treatment, please notice it and mention it. Okay. Then go for needed investigation. So in some cases, some patients may present with very minor injuries. Yesterday we had a discussion in our, along with our PGs. Patient may show a small abrasion in the right side of the abdomen below the costal margin. It looks as if it is a very simple injury. And the patient is not really insisting you to do or permitting or requesting for any investigation, and the doctor is also a little bit reluctant. But that may be an external presentation, but internally there may be some organ injury with internal bleeding. It's possible. Oozing of blood from the liver, lacerated liver, and the person may die in a later date, or a patient becomes serious within some hours. So even though this injury appears smaller in nature, don't take risk. Send them for investigation. Send them to do proper investigation and find it out whether it is relevant or relevant. Okay. Then needed treatment and what which shifted, that is to be mentioned in the AR copy itself for the easy follow-up of the investigative authorities. And at last, the signature, and the signature must contain the name of the person who signed, his date of signature, designation, etc. Because in a medical college, in the same name, more than one or two doctors may be there. Okay, right. So in case of preparing wound certificate, which is based upon the accident register, all relevant documents to be viewed before giving opinion. Each injury to be opined separately. Number 1, number 2, number 3, like that you have to write the injury, and number 1 injury is simple, number 2 grievous, like that you have to mention. And date of issue of such wound certificate is a must. It must be after or at least on the day of discharge. Because sometimes mistakenly, by mistake, before the discharge of the patient, the over-enthusiastic casualty medical officer may write the wound certificate in advance. So ஒரு வாரம் லீவில் போகிறேன், அதுக்கு முன்னால் எல்லாத்தையும் முடிச்சிடும், கொண்டா அப்படின்னு எழுதிட்டு போகிறது. So that is usually medical records department people will not allow, but sometimes that may happen. Then date of issue must be, okay, then against medical advice discharge cases, issue after scrutinizing other records and examine the patient. If absconded cases, don't go for instruct the investigating officers to produce the patient in front of you. Give a certificate based upon the document what you are having in your hand. If death occurs, what to do in such cases? So no need to write a wound certificate, send the body to mortuary. Issue MCCD, medical certificate of cause of death. I think that practice is not existing in Tamil Nadu. We are directly sending the body to the postmortem, that's mortuary, and whenever the relatives are approaching, we are instructing them to go and get the postmortem certificate from them. But it is not correct. In all other states they are issuing MCCD. That is only for the purpose of registering the death. So the doctor who is treating the patient is very well know the time of death. An autopsy surgeon will give a range of death, range of time of death. So sometimes it may extend between 2 days. We are having some cases where the Tahsildar send letter to fix a date for the purpose of registration of death. Because in postmortem they return it as time since death 2 to 3 days prior to autopsy. Then which one they have to take, whether second day or third day, like that they get confused. And so many other things also depends upon the date of death. Since so, it's my request, and also it is highly helpful for the deceased relatives. The doctor who is treating the patient, even though it is MLC case, may issue MCCD by mentioning at the cause of death column as sent for postmortem examination. Just register the time of death, those designation, ward, and send a copy to the for the purpose of registration. And whatever the wound certificate, you have to sign with the name, designation, seal. And regarding issue of wound certificate, some people have some problem with that. If requested, give a quadruplicate copy or an attested copy to the affected person. If requested by the patient or the legal hire through RTA, you have to give the copy. If asked for an attested copy means attested copy given under RTI petition that you have to write. So it is not just an attestation. You are stating that it is that copy is issued under RTA. So that is as per State Information Commission's order. With the purpose of seeking is mentioned and it needs attested copy, better you give. If the request made by them is not specific or not mentioning the reason for what it was asked, and it was asked by a third person with no authorization at all, then you may deny, stating the reason why you denied. And if it is asked by the third party, mentioning the purpose, and that is justifiable. So recently we are getting petitions under RTA stating that they are the inspectors of some private insurance company, and for the purpose of yearly disposal of the cases and for the benefit of the deceased relatives, we are requesting you to submit a copy of the postmortem certificate along with the chemical analysis report. Like that they are sending a letter. But we are not able to check their genuineness, and they are not attaching anything relevant to that. That is, they are representing any documents state that they are representing the particular insurance company or etc. like that. So in such case, you may reject. If they are attaching such copies that the petitioner is a legal representative of a particular insurance company and a copy of the claim request submitted by the deceased legal hire, then you may consider. If there nothing is enclosed, better to deny. So in case of sexual offense examination, so two types, accused examination and another one is victim examination. Accused examination, if it is an emergency, the police will give a memo to the casualty medical officer and he has to examine the examination. And with magisterial order in FM department. But some controversy is going on throughout the state, especially in Thoothukudi. We faced heat for the past 9 months, where we are forced by the police authorities to do this forensic, accused examination in the department itself for the person who is in bail. Not even in police custody or not even judicial custody. He is in the bail, but they are sending memo for examination. When I consulted that with our public prosecutors of Thoothukudi courts, they said it is not correct to do based upon the police memo in the department. They have to obtain order from the respected courts. I conveyed that message to the high-ups. For that I received show cause notice from district collector to give an explanation why I am refusing to do this examination. Then I sent the ball to the high-ups, that is to the dean's office. If the dean is ordering, we as a subordinate we can't do anything. So only with the dean's order, even though the police memo is addressed to us, we are sending that to the dean of Thoothukudi Medical College. The dean is authorizing us to do, and based upon the dean's order we are doing. That procedure is followed for the past 9 months. But I don't know where it will end. Okay. Because there are some issues with that, if you are receiving a police memo, that is for emergency examination, to avoid the loss of material evidences, or to know about the health status of the accused person, because he may be boarded to the any jail. Before that, they want to know the health status. அது பண்ணலாம். ஆனால் அவருக்கு வந்து ஆண்மைத்தன்மை இருக்காங்கிறத வந்து பார்க்கணுங்கிறது எனக்கு இன்னும் லாஜிக்கலாக சரியா இல்லை. And that too become a violation of human rights to the best of my knowledge. If they claim it under any such section, it is, I think it's punishable. So if court is giving direction, means court is taking that burden. So you may proceed directly. Okay. So regarding collection of summon, of course, nowadays and many requests are not having that question. Collect summon for analysis. But this is I think this one is a better one. If requested by magisterial order, requested by the magistrate in the magisterial order, and the accused is ready to collect, let them. There is no need to avoid. It's okay, we will proceed. With the magisterial order, it is mentioned, but the accused, that is a person who was subjected for examination, is not ready to collect. So we'll learn in our PG that we have to use a minimal strength, but there is no exactness of minimal strength, even though it is described in previous IPC, such and such thing is minimal strength. நம்மையும் போய் எதை தலையிடணும் கொடுக்க முடியுமா முடியாது. You record it and send that to the magistrate, then let him decide what to do. And also it is better to use a sexual offense examination form for writing. I saw in many medical colleges, a forensic department, they are having that form, but in obstetrics department they don't have that form. They are writing it in AR copy and in OP ticket like that. So they may change their way of documentation. A new modified form is not yet issued by the government of Tamil Nadu. So once they release such documents, we have to use that. Then victim examination. So victim examination, it is an emergency one. not only for legal view, it is for the health issue also. And there are one-stop centers in some colleges, of course, at least in the board. So the one-stop center that will take care of all medical as well as legal, medico-legal needs of that victim. If there is no such one-stop center, the patient or the victim may be examined in a casualty by a female medical officer. If it is not available, better in OG. But preferably in OG department, they are having their own entry, and always they are having a female medical officer, standby female medical officer, and they are doing that. Collect samples needed. So avoid two-finger test. Actually, in the morning, madam told, but it is completely removed. But what from the legal side, performing two-finger test, the reason for performing is different. Whereas from obstetric side, two-finger test, even though they are using that, they are using it for mainly for the purpose of sample collection. They will do a provisional examination, say using the same thing, then they will prepare slide and smear. So one obstetrician asked that. So two-finger test பண்ணலாம் எப்படி sample collect பண்றது, she asked. But actually that test is not meant for sample collection. Sample is collected by means of any swabs. So பழகின கையை நிப்பாட்ட முடியாது. obstetrician பார்த்துட்டு கையே இப்படி தான் வரும், 2 ஃபிங்கர் ப்ரொசீஜர் பண்ணி கையே அப்படி வரும். பழகின கையை நிப்பாட்ட முடியாது, ஆனால் எழுதுறதை நிப்பாட்டிக்கோங்க அட்லீஸ்ட். ஓகே, then refer psychiatrist. The victim is in deep mental trauma. I think I shall stop with this and will resume later.
It is my great honor and privilege to welcome our chief guest of the day, Dr. L. Balaji Saravanan sir, Superintendent of Police, Thoothukudi District, to Forensic Quest 2024. We welcome you, sir. I request Dr. R. Sudalaimuthu sir, Professor HOD Department of Forensic Medicine, TKMC, to share a few words about our chief guest.
Good morning once again. I am profoundly honored to welcome our chief guest for today's program, a special person, true hero of our society, Superintendent of Police, Thoothukudi District, Dr. Balaji Saravanan sir. His journey is marked by relentless dedication and remarkable achievements. His humble upbringing led him towards his academic and professional milestones, showcasing his intelligence, perseverance, and determination to serve our society. His tireless effort in combating drug abuse has brought about significant positive changes. His work has saved countless lives and given many a second chance to rebuild and thrive. He exemplifies the qualities of a true leader, courage, integrity, and a deep sense of responsibility towards society. We are greatly privileged to have you with us today, sir. Let us all take a moment to applaud and express our heartfelt gratitude Dr. Balaji Saravanan sir for his extraordinary service and unwavering dedication.
Now I request our chief guest, Dr. L. Balaji Saravanan sir, to share a few words.
Good afternoon to everybody. First of all, I'm privileged to be a part of this program. I wish to convey my sincere apologies because I was supposed to come by 9 o'clock to 10 o'clock, but because of today's CM's VC, I'm supposed to be there at Kulasegarapatnam along with the collector. So that's why I couldn't come on time. So my sincere apologies to all. And Doctor, I know quite a long time when he was in Coimbatore itself, forensic chief. So we still have an interaction. Whenever I have a doubt in forensic medicine, Dr. Joe only will give us guidance on all of the aspects. So this aspect is, I was called here to talk about the forensic medicine, the police point of view. It's a quite interesting subject. Actually, every murder cases, when we go to the spot, when unknown murder cases, when we go to the spot, we will go blindfolded actually. We do not know who is the killer, and we do not know what is the motive and everything. And the SOC and the body, the deceased body, will teach us or tell us so many stories. Actually, there will be so many visiting cards. That's what we used to call. Visiting cards will be there. The culprit, the accused, will leave some visiting cards. So either it will be there either it will be there on the body or at the SOC. So everything, not only body. When we discuss about a murder case, we don't discuss only whatever the injuries on the body. We go beyond that. Even we used to discuss with the doctors, how was the SOC, how things would have happened. So this is like, restructuring of a crime. That is more important. How the occurrence would have happened from the SOC we will. Long back we identified one peculiar case also. I want to place on record because that is through scientific method we detected the case. The case is that one body was found on the roadside. Just on the roadside, one body is there. We do not know who is the person, the victim, we do not know. His identity was not established. We called nearby villages, everybody. They said, I do not know this guy. So it is an unknown body, but body is there. So how to detect him? That is the problem. All villages, we called so many villages, they came, no sir, I do not know. How the scientific investigation helped us is that, fortunately, immediately we preserve the SOC, that whatever the articles nearby. I think in English movies we see that preservation of SOC will be a very crucial part. We will, they will cordon that area, they will mark some police tapes will be there like that. We do not do that actually, but still now we are trying to do that. What I thought is that at least in the nearby the body, whatever available, whatever the pieces, even small match boxes or bottles, fortunately we got 2 bottles. So that bottles, I asked my fingerprint team, normally, actually we have or myth or something like that, we do not engage the fingerprint team effectively in the murder cases. Generally, fingerprint team will be used with only crime cases like house burglary and all. But as long as I'm there, I used to have this fingerprint concept. So I called the party, just go and check it out, what is there in the bottle. So we got some fingerprint from the bottle. Then I asked the team, I tasked the team to detect it, who is this, whose fingerprint is there. We matched with that deceased, no. So definitely it must be suspects. Then further we probed into them. Fortunately, we got one name from Virudhunagar district. This murder is in Kayathar area. One suspect, so fingerprint tallied with one person in Virudhunagar district. So then we went and searched that fellow and we got that fellow. And we asked that fellow, Hare, tell me, who you killed whom? Tell me. We do not know the deceased actually. So without knowing, then he only said that, no sir, yes, he was a lorry driver, he tortured us, that's why I killed him. So after arresting the accused only, we came to know who is the deceased. So this is what the scientific investigation lead us. So many these things. I was so happy. Without knowing the deceased, we arrested the accused, then we fixed them. The next development is the DNA fingerprinting. Now it is in the rise, but still we have a shortage of the labs in our area. And the duration also 4 months, 6 months is there. But it's not so in the developed countries. If we get the DNA fingerprinting within 7 days, if you are able to get the DNA fingerprinting matching within the 7 days, then our, so many issues will be solved. Whenever we go to the SOC, we will preserve the saliva, blood, whatever hair particles, all these things will go for DNA fingerprinting and matching. Even I can say that third degree method, adichu variety, we can reduce. No need for that. There is no need for that actually. So that technology, if we have, we are putting demands to the government also. Once we have the DNA fingerprinting test analysis report within 7 days, then this match and everything will be very easy for us. And it is scientifically proved also. So those are the areas that we have to concentrate on this. And the third thing, doctor's role in the murder case investigation. Mostly after the detection of the case, we will say whether this weapon can cause these injuries. First, it will start. After the post-mortem, you will know the cause of death you are going to tell us. Through that, we are going to prove it in the court. Only my request is that take it that actually, if you know what is the SOC motive and all has to be analyzed with the IO, investigating officer. It will be quite interesting once you come into that area. Because it's like when murder takes place, we will be totally blank. We do not know who is the deceased, how the scene of crime will be there. And once we go there, only we will come to know, okay, this deceased, this, and even the role of, I appreciate the forensic team. It's very hard that, some bodies, burnt bodies, even decomposed bodies. நிறைய பேர் படம் பார்த்துருப்பீங்களா? அது என்ன படம்? அந்த கமல் ஒன்று நடிச்சிருப்போம் அப்படி இல்லை? வேட்டையாடு விளையாட தான் அந்த ஃபாரின்ல அந்த இடத்துல போயிட்டு he will start with only very few things. I'm just taking very few elements that he was last seen or their movement was suspected to be in a particular or farm area. Where this fellow will go and the foreign police officer will say, hey, you should not go there. And there's a trespass and all. And our police will break. And they will go inside and after that they will find one boy, this larvas they will be finding, some larva, something like they will find. Then they will go there and they will dig into the thing and so many bodies will be there. So like that it goes. Even it happened like that also. For me, when I was my first DSP in Ulundurpete subdivision, I came across a case. That is it is a very remote located on forest area. It is totally remote located on forest area. I was told that one body was found with kurta. The body is fully blown, white, and the hairs are there. So somebody called me, sir, one North Indian guy died. There is no, the underwear, nothing was there below, only top is there. So that is the thing. Even nobody knew that it is a male or female. Initially it was informed to me, since it was white in color and all, so they informed me that it is a North Indian guy with kurta. So then after subsequently only we came to that much stage, actually it is almost decomposed state. So somehow we got a clue of this one, SOC, how we fixed. So then we came to know about this one, we went to the spot, then we came to know about the, studying about the pelvic bone and all these things, we came to know that is a female body. First investigation. Oh, that is a female body, okay. Now, then we went further ahead. those who are the persons there and all. That was also another beautiful case for investigation. Nobody knows how it happened because it's a totally remote area where many people used to drink and this thing. So, and we got hold of the things. So only one thing, we got our first clue is that it is a female body through only medical, your forensic analysis. It is a female body. Okay, fine. Now next we would, how to identify this one. So then we were asking about the missing details and all. So we came to know about, yes, one girl missing is that she's a 17-year girl. Just 17-year girl. So, okay, fine. Then next, we started our own investigation. And the area, whoever went there and drank, all these persons we called and you are treating the patients, no? Like that, we also treat the accused also. Okay, treatment only I'm telling, I'm not telling nothing. Okay, we also treat them properly and ask them some questions, relevant questions, and they may answer also. So like that we started treatment, we started giving treatment to many of the persons who went there. Even our பழைய கணக்கெல்லாம் இங்க டேலியா இருக்கு. இதெல்லாம் தப்பிச்சிருப்பானோ அந்த கணக்கெல்லாம் என்கிட்ட கொஞ்சம் வாங்கியிருப்பான் அந்த ட்ரீட்மெண்ட்ல. That is a different one. So we got this thing. So I couldn't get any clue. Finally, I changed my view. Just go, since it's a village area nearby this one, whoever comes and watching our activity, he will be monitoring. No? The accused will be monitoring us. He will be keen also. So then I told my SI, just keep an eye who is coming and watching our activity, what we are doing. Finally, he came. Sir, this street fellow, one colony area is there, that street fellow, they are keen to, they are coming and every day watching our activity. Those who are getting beating and going out, those things they are watching. Okay, fine. Now we concentrated that area, we went to that area. Then we asked about that one, whether this lady is there or something. Because at the SOC, we got only one clue is that there was a plastic bag cover was there. And within that sambar, when we have a parcel, meals will be there in our area. Or full parcel meal kudupanga. Adhu enna sambar irukum, rasam irukum, thair irukum. Then one rice pack will be there. All will be having some covers and one more. So that was there at the SOC. So that we went there and we inquired, anybody bought this one? Then one fellow, one shop fellow, one hotel fellow, he told, sir, yes sir, that day these two fellows came and bought this thing on that afternoon. So then we came to, because what was the last scene theory was that lady, that girl was actually seen alive. She is slightly mentally disturbed, 17-year-old, unfortunately. She went there after fighting with her house. And last scene, one old 85 years old lady, she only saw her. She is grazing her goats. She said, why you are going alone? No, I'm not having a good, comfortable with my parents. I'm going out. Like that, she went. So by the time when her goats went that side, she went there and this fellow went in this lady was carried away by somebody in a cycle. This is the clue. One clue is cycle. Second one, we came to this hotel. So we came to the hotel. Hotel fellow sold, these two fellows bought something. Then around in the midnight, 2 o'clock, my SI called. Sir, case is detected, sir. These two fellows only did those things. He went, while going, he saw this girl is going in a different, this thing. He called, okay, we will go there like that. They brought the girl into that forest area, deep forest area. From the road itself, 2 kilometers forest area. Then they said that, cool, we will be here like that. She is mentally disturbed. So then they used her. They got some, food items also. They shared with her. And they raped, actually. It is a rape and murder, actually, unfortunately. Rape and murder. So there also scientific evidences, he went and bought some condoms also. That was also, we made it as an evidence. So these are the roles, how it happened, your role will come there. So, but when we detect the case only in the satisfaction, when we go and see the body, initially we do not know whether it is a male or female. After some time coming to that accused and fixing the accused and the victim, that will be really a challenging thing. We faced a lot. So My young students are there, my friends are there, so kindly concentrate. It is a quite interesting subject. Every injury on the body will teach you, will tell us, it will tell us the criminal's activity, attitude, mindset, everything will be there. Every criminal will have a different views. Not all psychopaths. Psychopaths is a different story. Recently also one fellow, it's not a murder case, but still, he has a habit. This will go and he has stolen some property, but there was no property actually. Only 500 rupees was there. So he was totally disappointed. After doing so much of breaking and entering into the house, no property was there. Only 500 rupees. So he want to, just go like that. So he has written only 500 rupees. He has written in his house after doing the burglary. He has written in the house, veru 500 ruwa dhaan irukku. So don't get confused, officers. Only I got 500 rupees also. So he has clearly declared. One more fellow in the Colossae area only I got recently. So he has written, I'm sorry, எனக்கு ஃபேமிலி பிரச்சனைனால திருடி இருக்கேன், விரைவில் திரும்ப கொடுத்துருவேன். He has written a note. Seriously. So this criminal's behavior, it will change. It varies. I was thinking how he has that. So at the time, he will be there jumping, he will be cutting that gate, then he'll be watching everybody, anybody is there, then slowly he's cutting the main door, then he goes there, and எவ்வளோ நேரம் ஸ்பெண்ட் பண்ணியிருப்பான், அங்கே தேடி இங்கே தேடி வேற எல்லாம் தேடி, வெறும் 500 ரூபாய்னா 500 rupees. So அவனுக்கு மனசே பொறுக்கல. He couldn't digest that. Okay, I want to declare only 500 is there. So இது criminals-ஓட mindset. அதை we can get it. That's what I'm telling. When doing the forensic science, you will know how based on the cut injuries. Yes, true. சில இடங்கள்ல வல்லம்படுகை கட் அப்படின்னு சொல்லுவாங்க, நான் லாங் பேக் சொல்லுவாங்க. அந்த கட் இன்ஜுரியில் they will mark like that. It is a cut injury. It is meant for வல்லம்ப குறிப்பிட்ட people, they will do the cut injuries. So that is their habit. They have a MO, we will call as MO, modus operandi. So every criminal will have a modus operandi. Even the cutting injuries also, I have seen that it differs from one place to another place. In place, Coimbatore area, Andal cutting straight will be there, stabbing will be there, okay, murders. But in Thoothukudi, if you see the cut and murders you face, correct, adan. Actually, to be frank, I have seen in Coimbatore area, face cut panna maatanga. Face la avlo seekram, they may stab. Irukum. Thoothukudi, they will cut into here and inge pieces irukum. Skull abde cut பண்ணுவாங்க. அந்த habits கொஞ்சம் இருக்கும் அது. So by seeing that we can identify certain இதெல்லாமே இருக்கும். So that is your role. You can identify என்னங்கிறது. அந்த weapons, அதில் variety of இருக்குல்ல, we have a lot of variety of weapons also there. So this is a quite interesting subject. That's what I'm telling you. Why I'm telling experiences are there. It's not like, through you, once if you are able to prove that. Because one case I went in when I've investigated. After 17 years, I went and I deposed my evidence in Ulundurpet. That is a cold-blooded murder that took place on the main highways. Anga Kedilam main road, Kedilam solluvaanga. That is near towards Viluppuram. Main highways, Ulundurpet main highways. Cold-blooded murder. And he was also a rowdy fellow that he was murdered. And I made the witness as that fellow driver is a witness, so other fellows also their witness. And fortunately or unfortunately, he has 3 wives. Okay. And I made them also witness also. Because at least wives will say, some of this thing. But unfortunately, after 17 years, I went there. All the witnesses, all the 3 wives turned hostile. Yarume saachi sollala. Yarume sollala. But fortunately, what I did is that, and the car killing, when they went and attacked the car, and after the car, nirthi adikranga. So, appo the car open பண்றப்ப fingerprints இருக்கும்ல, இருக்கும், அவ்வளவுதான், இருக்கும் அங்க. அந்த கார்ல இருந்த fingerprints I made it. அப்போ எப்போ சொல்றது, நான் சொல்றது 2008ல. I was DSP there. அந்த fingerprint மட்டும் evidenceல நிக்குது. So, at the time of the occurrence, because immediately after that we are seizing the car. At the time of the occurrence, this accused fingerprints were there on the car which was used by the deceased. So if that குள்ளே யாரும் போயிடக்கூடாது. ஏன்னா பிகாஸ் இமீடியட்லி ஆஃப்டர் சம் டைம் தெரியாது. அந்த யங் ஏஜில் யூ வில் பிகம் ஓல்டு. சொல்கிறேன் 28 years old guy, if he consumes the drugs more, 2-3 yearsல அவனை பார்த்தீங்கன்னா அவன் எதுக்குமே யூஸ் இல்லாமல் ஆயிடுவான். எதுக்குமே தான். ஈவன் ஐ வாஸ் டோல்டு பை அ டாக்டர் he will become an importantன்னு சொல்லியிருக்காங்க முக்கியமாக ஆஃப்டர் சம் டைம். அப்புறம் வாட் இஸ் த யூஸ்ங்கிறது அடுத்த கேள்வி வந்துடும், நீ என்ன தான் போட்டு. அதனால் ஸோ மை ரிக்வஸ்ட் இஸ் தட் ப்ளீஸ் ஸ்ப்ரெட் தட் கான்செப்ட் தட் நோ ட்ரக்ஸ் எங்கேயும் இருக்கக்கூடாது, இருக்க வேணாங்கிறது நம்ம எதுப்போம். அதுக்கு நாங்கள் எல்லாருமே நிறைய ஃபைட் பண்ணிட்டுருக்கோம். தூத்துக்குடிலையும் நிறைய பண்ணியிருக்கோம், நிறைய கண்டெய்னர்ஸ் பிடிச்சிருக்கோம், க்ரோர்ஸ் கணக்கில் பண்ணியிருக்கோம். லாஸ்ட் 1 monthக்குள்ளே கூட ஐ காட் அ மெத்தபெட்டமின் 8 kilo, தட்ஸ் க்ரோர்ஸ் வேல்யூ இருக்கிற பிடிச்சிருந்தோம். ஒரு பெரிய நெட்வொர்க் எடுத்திருக்கேன், ரிமாண்ட் பண்ணிட்டு தான் இருக்கும். we are doing that, it's a chain process. never ever think that இல்லை போலீஸுக்கு தெரிஞ்சுதான்னு சொல்லிட்டு இருக்காதிங்க. அது இந்த சினிமாவில் ஐஜி தெரியும் கதை சொல்லுவாங்கல்ல, அதெல்லாம் தெரிஞ்சுதாங்கிறதெல்லாம் வேண்டியதில்லை. யூ கேன் கிவ் த நம்பர்ஸ். I leave the numbers 8300. யார் வேணாலும் நோட் பண்ணுங்க. 8300145667 ஒரு நம்பர் வச்சுருக்கோம். ப்ளீஸ் இன்டிமேட் டு தட் எனி ட்ரக் எனிதிங் பண்ணலாம். The next is young, girl students are there. I wish to stay that now the era is with cell phone. Another dangerous cell phone mattumalla, camera phone is there, and WhatsApp video calls are there. There are some issues happening there, many issues there, when the girls may get trapped. என்னன்னா சில நேரங்களில் தெரிஞ்சு ஃப்ரெண்ட்ஸுன்னு பேசுகிறப்போ சம் எக்ஸசஸ்னால அதை வீடியோ எடுத்து வச்சுக்கிறாங்க. அப்புறம் த்ரெட்டனிங் இருக்கும். அப்புறம் அந்த கேர்ள் என்ன பண்ணுறதுன்னு தெரியாமல் இருக்கும். அப்படியான சூழ்நிலைகள் கூட வரலாம். அப்படி இருக்கக்கூடிய நேரங்களில் தயவு செய்து யாரும் எந்த காரணம் கூட தவறான முடிவுக்கு போக வேண்டியது இல்லை. ஐ ரிப்பீட் தட் no at any point of time no need to think otherwise. இது வாழ்க்கை போயிடுச்சு, நம்மளோட ஃபோட்டோவை எடுத்துட்டான், வீடியோ எடுத்துட்டான், இனி வாழ்க்கையில் இந்த த்ரெட்டனிங் எல்லாம் இருக்கும். அவன்லாம் மொத்தம் ஆம்பளைன்னே சொல்ல மாட்டானா. ஒரு பொண்ணுகிட்ட ஒரு வீடியோ எடுத்து வச்சுட்டு அவன் நம்பி கூட இருந்ததை வச்சு ஒரு வீடியோ எடுத்துக்கிறதோ, அல்லது சில டைமுக்கு இருக்குது இந்த கழுத்தை மட்டும் கட்டிட்டு மார்பிங் எல்லாம் வந்துருச்சு இல்லை இப்போ தான் டெக்னாலஜி, கழுத்தை கட் பண்ணிவிட்டு வேறு விதமாக வச்சு ஒரு வீடியோ நான் சோஷியல் மீடியாவில் விடுறேன். இந்த த்ரெட்டனிங்கை பற்றி யாருமே கவலைப்பட வேண்டிய அவசியம் இல்லை. பிகாஸ் there is a section in 66 EIT Act, 66E 66 EIT Act, which says that anybody's private parts whichever publicly exhibits, யாராவது ஒருத்தர் அந்த டிரான்ஸ்மிட் பண்ணால் போதும், with knowledge or without knowledge, that doesn't matter. அதை டிரான்ஸ்மிட் பண்ணாவே அவனை 3 years ஜெயிலில் அடைச்சி வச்சிடலாம். 3 வருடம் கடுங்காவல் தண்டனை, 3 years imprisonment can be given those persons. ஓகே, ஸோ நெவர் எவர் ஹெசிடேட் தட். ஓகே சார், அதுக்காக நாங்கள் வந்து கம்ப்ளைண்ட் கொடுத்தோன்னா எங்கள் ஃபேமிலி என்ன ஆகிறதுனால நெவர் எவர் பாதர். ஐ ஹவ் டன் லாட் விச் ஐ கேனாட் எக்ஸ்பிரஸ் த நேம், பட் ஐ ஹவ் டன் அ லாட். அவங்களுக்கு நான் சொன்னேன் இல்லையா, கூட்டிகிட்டு வருவோம், இந்த மாதிரி இருக்கிறவங்களுக்கு அன்பா சில ட்ரீட்மெண்ட் கொடுப்போம். நீங்கள் கொடுக்குறீங்களா ட்ரீட்மெண்ட்டில் இன்ஜெக்ஷன் போடுவீங்களா, அந்த மாதிரி நாங்களும் சில ட்ரீட்மெண்ட் கொடுத்தோன்னா எல்லா கேட்ஜெட்ஸ், ஆல் த செல்ஃபோன், iPad, whatever, laptop, whatever it is that we will get, and based on the request of the female, the victim, அவங்களுக்கு என்ன பண்ணணுமோ அப்படி நம்ம எல்லாத்தையும் வாங்கிட்டு, நாளைக்கு இந்த ஃபோட்டோ வெளியே வந்ததுன்னா, எப்போ வெளியே வந்தாலும் bloody you will be the accused and you will be behind the boss forever அப்படிங்கிற ஒரு உறுதிப்படுத்தி நிறைய பேர்த்த கொடுத்துருக்கோம். நிறைய இட் ஹேப்பன். கோயம்புத்தூர்லாம் ஆக்சுவலி பாவம் ஒரு கேர்ள் வந்து, I must say that she is an engineering student in ME. ஒரு சின்ன வீடியோ எடுத்து வச்சுட்டு அவளை கல்யாணமும் பண்ணிக்கல. He doesn't want to marry. somehow ஏதோ ஈகோ கிளாஸ் வந்துச்சு. I am not, உன்னை மேரேஜ் பண்ணவும் விட மாட்டேன், நீ யாருக்கு பண்ணனா நான் அங்கே வீடியோ அனுப்புவேங்கிறான். And he was dare enough, that fellow came. அவன் வீட்டுக்கே வந்து உன்னால் என்னடா பண்ண முடியும் அவங்க அப்பாட்ட கேட்குறான். வயசான அப்பா என்ன பண்ணுவார், கண்ணை தண்ணி விட்டு அழுகிறார். One day he came to me, just he cried. I said, no, don't worry, we will take care ன்னு சொல்லிட்டு வழக்கம் போல அதே கேர்ள்டே சொல்லி ஃபோன் பண்ணி வர வச்சோம். Then we called them and we gave good respectable treatment to that guy, and we got all the gadgets, and finally now there is no issues. She got married, now she is in UK. She gave the invitation for my marriage, for her marriage also. So இது எதுக்கு சொல்லனா, be confident, never ever get trapped into these cell phone related things. Even if it happens, never ever bother about them. Please come forward. You have to live your life, okay? And the third thing, doctors, I need not order anything. You know about serotonin? Doctors know, no, serotonin? Here. That is our mood syndrome, correct? The suicidal thoughts, that you have to educate. The suicidal thought, that's more important. The pressure, yes, we do have pressures. Being in police, definitely we will have more pressures. But still, it is due to not anything. Love failure nala, நம்ம நினைச்சிட்டு இருக்கோம். Or the suicidal thought எதனால நினைக்கிறோம்? Love failure, or money related issues, family husband and wife issues, etc., etc. These are the issues. Are these the, can we say, are these are the reasons for the suicidal thought? No. பண பிரச்சனைனா உலகத்தில் எல்லாத்தையும் ஏகப்பட்ட பேருக்கு இருக்கு. லவ் ஃபெயிலியர்னு எடுத்தீங்கன்னா அதுக்காக சூசைட் பண்ணிக்கணும்னா இந்த உலகத்தில் முழுசாக இருக்குமான்னு தெரியல மக்கள் தொகை. ஓகே, லவ் ஃபெயிலியர், இட் மே ஹேப்பன், நெவர் பாதர். ஓகே, இஃப் தட் இஸ் அ ரைட் சாய்ஸ், இட் வில் கம். If it is not that, don't get stuck there. Just go ahead with your life. Love or life is not, that's not the entire life. You can love after getting married also, you can love her till whatever the age you want. Okay. So my only concept is serotonin imbalance agarappo ungalku and you will create, the repeated thoughts, OCD or something you will call. You are more technical than me. So andukapram dhan then the suicidal thoughts varudhu, adilundu veliye vara mudala. We need the right intervention, right time intervention. I saved many in this regard. நம்ம கோயம்புத்தூர்ல எனக்கு சைக்காட்ரிக் டாக்டர் ஒருத்தர், அவர் தான் சொல்லி கொடுத்துருக்காங்க. இங்கேயும் சைக்காட்ரிக் டாக்டர்ஸ் இருக்காங்க. எனக்கு இங்கே டாக்டர் சிவசைலம் அவங்களும் சொல்லியிருக்காங்க. ஸோ அதனால் நெவர் கெட் இந்த மாதிரி சூசைடல் தாட்ஸை பொறுத்தளவுக்கு யூ ஹேவ் டு அட்வைஸ், யூ ஹேவ் டு டெல் தம் தட் இட் இஸ் நத்திங் பட் அ டிசீஸ் லைக் ஹெடேக் அண்ட் ஃபீவர். யூ கேன் கெட் கியூர்ட் பை ப்ராப்பர் மெடிகேஷன். ஸோ இதை மட்டும் நம்ம யங்கர் ஜென்ரேஷன்ஸ்க்கு சொல்லிக் கொடுங்க. ஐ வாண்ட் ஆல் ஆஃப் யூ டு பி successful in your life, be happy in your life, and be fit always in your career. I hope that you all will be successful and you will have come out with a prosperous lifespan. Okay, thank you very much for giving me this opportunity. So finally, I want to conclude, life is beautiful. Take it as it is. Aim for the best, but live with present, live with today, and live with reality. Thank you very much.
Becoming a police officer is a challenge. Becoming a head for the police officers is a very difficult challenge. That too, becoming a head of officers of Thoothukudi district is very, very, very tough. Actually, I want to tell the one sad thing. We are doing many cases, hardly 800 cases, post-mortem examination, autopsy cases, medico-legal autopsy cases in Thoothukudi Government Medical College. 9% of the cases are murder cases. Then Sir has already told here, Thoothukudi and Tirunelveli also, most of the cut injuries around the face, the most sensitive people. So, chanda start ஆகிறது வாய் பேச்சில் தான், அதனால தான் வாயிலே வெட்டு. Then one more style in Tirunelveli is that decapitation. தலையை துண்டா எடுத்துறது ஒரு கெத்தான ஜாப் மாதிரி. Another sad thing. So, Sir has insisted that no drug. That is, drugனாலே இப்போ வந்து என்னன்னாலே psychotropic drug தாங்கிற மாதிரி ஆயிடுச்சு. But all our doctors, Sir is not telling about our drugs given in pharmacology, what we are using for the treatment. Drugs, psychotropic drugs. Sir, thank you, sir, for enlightening us. In spite of your busy schedule, you are attending, sir. Thank you very much.
Now I request Dr. R. Sudalai Muthu sir, HOD, to present the shawl to our guest of honor, Dr. L. Balaji Saravanan sir. Now I request Dr. V. Kalevani ma'am, Vice Principal TKMC, to present the memento to Dr. L. Balaji Saravanan sir. Thank you, sir, for your enlightening words and alluring anecdotes. Now we'll be resuming the session on medico-legal aspects of a doctor in casualty. I request the chairpersons to occupy these seats. We'll be resuming this session, medico-legal role of a doctor in casualty by Dr. Selva Murugan, sir, Professor of Forensic Medicine, Government Tirunelveli Medical College.
Okay, thank you. Okay, we shall continue. As far as the victim examination is concerned in sexual offense cases, this will be done by a female medical officer, preferably a female medical officer, collect samples wherever it is needed, and if the college is having a one-stop center, that will take care of the entire things. And if the patient or victim is having any psychiatric issues, proper guidance will be given to overcome that mental stress. Then, regarding drunkenness examination, so citizen asks this examination to be conducted immediately without delay to avoid unwanted loss of material evidence. It's better to be conducted by casualty medical officer on reception of police memo. And it is important to record the date and time of examination. And it is always advisable to do a complete examination. And it's a must to collect samples, that is blood for alcohol estimation. So it is a common practice in many medical colleges that they will get a signature from the person to be examined without intimating what for they are collecting their signature. And after obtaining the signature, they will write that not willing to give sample. But that is not correct, because now we are supposed to take blood and send it for alcohol estimation even in road traffic accident cases. So if any person is produced in the casualty for the purpose of drunkenness examination, it is always advisable to collect blood. That will save your skin in a later date. Then age estimation. So medico-legal age estimation have to proceed only after obtaining a request from the proper authorities. Without that, you are not supposed to proceed with the examination. So a complete age estimation includes both physical, dental and radiological examination. Plan accordingly and to avoid unwanted radiation exposure to growing children. Issue certificate with the proper identity, sign and designation of the medical officer. Then other medico-legal works carried out at casualty are collection of blood for alcohol estimation in road traffic as per the based upon the court order, So in that it was mentioned that blood to be collected even in broad dead cases. So I think no one objected this one. Broad dead, how it is possible to collect blood in casualty in broad dead cases without doing a dissection? I don't know whether they have any other methodology for collecting blood. Okay. And blood collection for DNA fingerprinting. Usually in suspected or rape cases or sexual offense cases, to confirm the maternity or paternity, we are ordered by the court to collect blood for DNA fingerprinting. And in some centers, the DNA for collecting blood for DNA fingerprinting is carried over by the forensic department. But to my knowledge, if you are trying to collect blood, you have to prick, at least you have to make a prick in the tip of the finger for collecting blood. If the person becomes unconscious due to pain shock, what to do in the forensic department? You are having bed for doing postmortem dissection and not for treating a patient. So it is always better to send such blood collection to casualty where they are having an emergency management system to maintain. Then, if anyone is brought to the casualty in a dead state, there is broad dead cases with injuries, etc., etc., it is the duty of the doctor to record the state of postmortem change and, if possible, try to assess the time since death. Because he is the person who is first seeing the dead body and a qualified person seeing the dead body, and he is having the capacity to assess properly. And also in cases of poisoning, medical officers, as a medical legal work, they have to collect samples and send it for chemical analysis for the confirmation of the poison. That is helpful in cases where the person or patient died after some days of treatment, and because of the treatment we are not able to retrieve the nature of poison in a later date. So it is advisable to collect samples in such cases and in suspected criminal abortion cases. Then precautions to be taken while doing, that is not during, that is doing medical legal examination. Sufficient history taking from patient or attender that will throw light where to focus. Then proper consent for examination, documentation of the examination findings, needed investigation, needed timely intervention, and last one is maintenance of professional secrecy. So history of the case. The history of the case, usually you are obtaining the history of the case from the person who is attending or from his relatives or from unknown persons, informants. And you must verify whether it is relevant to the case or not. So in many cases they will give irrelevant information regarding to the related to the case. And also verify whether they are realistic in nature. Sometimes the history may be well tutored to suit or to frame any case against any person. So you have to finalize it accordingly. Then consent, two types, implied and express consent. For medical legal work, it is advisable to get written express consent. Like for some examinations, like sexual offense examination, collection of samples, etc. Then documentation. So this part is usually say over skin. Proper documentation is a must as far as medical legal case is concerned. We doctors are very poor in doing documentation. Because we thought we are relying our remembrance memory, and we thought that we are thinking that we will withhold that memory for a longer time, but it is not so. It is always record any medical legal work. Documentation is a very important as far as medical legal work is concerned. See, once one police officer, the inspector came to me. He asked one doubt to me. Doctor, நெஞ்சில ஓங்கி குத்துனா ஹார்ட் அட்டாக் வந்து செத்து போயிடுவானா அப்படின்ற கேள்வி கேட்டார். I told, நெஞ்சில ஓங்கி குத்துனா ஹார்ட் அட்டாக் வர்றது சாகலாமான்னு சொல்ல முடியாது, ஆனால் ஓங்கி குத்துனா ஷாக்கில் செத்து போகிறக்கு வாய்ப்பு இருக்கிறது அப்படின்னு. சும்மா கொஞ்சம் எழுதி கொடுக்க முடியுமா அப்படின்னு கேட்டேன். Now I sensitizing that there is something is going behind. ஆனாலும் அவர் கேட்டு நான் சொன்னது தான் கேட்குறாரு. சரி நீங்கள் கேட்ட மாதிரி கேளுங்க, நான் எழுதி கொடுக்குற மாதிரி கொடுக்குறேன் அப்படின்னு. He started reading this from Kaval Inspector of Police and some other station he is returning. I said, சார் நீங்கள் அந்த ஸ்டேஷன் எப்போ ட்ரான்ஸ்ஃபர் ஆனீங்க? நோ எனக்கு இந்த டவுட் இல்லை, அவருக்கு தான் டவுட் அப்படின்னாரு. சரி எழுதுங்க, ஆனால் கையெழுத்து அவர் கையெழுத்தை போடுங்க அப்படின்னு. அவர் கையெழுத்து எப்படி இருக்குன்னு தெரியாது அப்படின்னா நான் காமிச்சேன், எனக்குள்ள ரெக்யூசிஷன் அவர் கையெழுத்து இப்படி தான் இருக்குது, அது மாதிரி போடுங்க. He tried and almost simulate like that. So I gave the opinion stating that to that inspector and gave that if anyone is punching directly to the region of chest, especially over the heart region, there's a possibility for the person to die because of acute shock, pain shock. I gave that one. So இது நடந்து சில வருடங்கள் மறந்தே போயிடுச்சு. கோர்ட்லேருந்து சம்மன் வருது, செஷன்ஸ் கோர்ட்லேருந்து. இப்போ இந்த மாதிரி இந்த கிரைம் நம்பரை நாங்கள் கேஸே பண்ணலையே. இல்லை சார் நீங்கள் கேஸ் பண்ணல, நீங்கள் ஒரு ஒப்பீனியன் கொடுத்துருக்கீங்க. என்ன ஒப்பீனியன்? நெஞ்சில் குத்துன்னு செத்து போவான்னு கொடுத்துருக்கிறீங்க. அப்படியா? அப்படி நான் தான் PW1. அந்த கேஸ் பண்ணப்பட்டது கன்னியாகுமரி மெடிக்கல் காலேஜ். ராஜேஷ் சார் பண்ண கேஸ். சார் ஒரு ஒப்பீனியன் கொடுத்துருக்குறாங்க, அதை வந்து திருநாட்டு ஆல்டர் பண்ணுறாங்க. அது ஆல்டர் பண்ணுறதுக்கு என்கிட்ட லெட்டர் வாங்கினதாகவும் போயிட்டு. ஸோ இந்த படத்தில் பார்த்துருப்பீங்களே, ஒரு கையெழுத்து போடியா அடிமார் மட இன்னாருடைய மகன் இத்தனை சுயமாக எழுதி பத்திரம், சொத்து பத்திரம் அப்படின்னு அதே மாதிரி எழுதி ரெடி பண்ணிட்டாங்க. ஸோ கோர்ட்டுக்கு போயிட்டு அந்த கேஸ் ஷீட்டை கொடுங்க, கேஸ் பண்டில் கொடுங்க அப்படிங்கிற பிபி கொடுத்தாருப்புல. பார்த்தா கதெல்லாம் வருது. அது எங்கெல்லாமோ போயிட்டு கடைசியில் என்கிட்ட மூலம் முடிச்சு கொண்டு போய் நான் சொன்ன அந்த பேப்பரை வச்சு தான் அது வந்து கன்வெர்டட் அஸ் திருநாட்டு அப்படி போகுது கேஸ். ஸோ என்னை ஃபஸ்ட்டு விட்னஸ் ஏற்றி விட்டோடனே உங்களுக்கு என்ன தெரியும் அப்படின்னு, நெஞ்சில் குத்துனா செத்து போவான்னு ஒரு லெட்டர் கொடுத்துருக்கு, அது மட்டும் தான் தெரியும். யாருக்கு கொடுத்தீங்க? இந்த இன்ஸ்பெக்டர் கொடுத்தேன். எந்த கிரைம் நம்பர் கேஸ் கொடுத்தீங்க? அது எனக்கு தெரியாது. வேறு டாக்குமெண்ட்ஸ் பார்த்தீங்களா? தெரியாது. எதுக்கு கொடுத்தீங்க? அவர் பொதுவாக கேட்டார், நான் பொதுவாக கொடுத்தேன். ஸோ ஐ ஸ்பெசிஃபிகலி மென்ஷன் தட் இன் ஜெனரல், இட் வாஸ் நாட் ஸ்பெசிஃபிக் டு எனி கேஸ். ஸோ ஜட்ஜிக்கு சிரிப்பு வந்துருச்சு, இதை வச்சே நீ வந்து கேஸை பில்டப் பண்ண. ஸோ டோன்ட் அண்டர் எஸ்டிமேட் the other department people, especially those who are in police as well as in judiciary. அவங்கள்ட்ட ஒரு வேலை வேணும். ஏன்னா அவங்கள்ட்ட அவர் சார் எஸ்பி சொன்ன மாதிரி போலீசிங் அப்படின்றது வந்து ஒரு டிபெண்டன்ட் டிபார்ட்மெண்ட். லைக் ஒரு கொடி மாதிரி அவங்களுக்கு படறதுக்கு ஏதாவது கிடைச்சாதான் பிடிச்சிட்டு படற முடியும் அவங்களுக்கு. நம்ம தான் இன்னசென்ட் பைஸ்டாண்டராக போய் மாட்டிக்குவோம். அவங்கள்ட்ட எல்லா கேஸ் பில்டப் பண்ணுறதுக்கு, ஈவன் ஒரு அக்யூஸ்ட் அரெஸ்ட் பண்ணி அவனை ரிமாண்ட் பண்ணணும்னு சொன்னாலும் ஃபிட்னஸ் நம்மக்கிட்ட தான் வந்து வாங்கணும், எதுனாலும் நம்மக்கிட்ட தான் வந்து வாங்கணும். ஆனால் நம்ம தான் அவனை பார்த்து பயந்து நிற்போம். என்ன கேட்டாலும் எழுதி கொடுப்போம், நோ. ஸோ உங்களுக்கே தெரியும், ஒரு ஆட்சி மாற்றத்துக்கே காரணமானது ஒரு ஃபிட்னஸ் தான். சாத்தாங்குளம் கேஸ். I came across that videograph in a later date. So pathetic. The victim person நடக்க கூட முடியாமல் அப்படி தவழ்ந்து வர்றாரு. அவருக்கு வந்து அந்த மெடிக்கல் ஆஃபீஸர் ஃபிட் ஃபார் ரிமாண்ட் கொடுக்குறாங்க. It's an inhuman attitude. Such things should not be repeated. So once you are committing anything in black and white, you are supposed to face the consequences of that. So you must have a forethought of that. Medical, there is a possibility for you to do a review. Where medical legal issues, there is no possibility to do a review. So once you are committing, you must have a forethought. If you don't have any forethought, don't do that. Okay. And whatever thing you are documenting, the documentation must be legible and sign wherever it is needed. And நம்ம இன்னைக்கு எழுதுறது 10 வருஷம் கழித்து வாசிக்கிறப்ப நம்மளுக்கே அது மேலே காரி துப்பலாம் போல இருக்கு, அப்படி எழுதியிருப்போம். சர்டிஃபிகேட் அப்படி தான் இருக்கும். அதனால் லெஜிபிளாக எழுதுங்க, டைம் எடுத்துக்கோங்க. டோன்ட் ரைட் எனிதிங் ஆர் டோன்ட் கமிட் எனிதிங் இன் அ ஹரி. சீக்கிரம் கொடுங்க, நோ. எஸ்பெஷலி மெடிக்கல் லீகல் ஒர்க், டைம், கிவ் சம் டைம். ஓகே.
Then investigation and treatment. Patient survival is of prime importance. Rather than writing medico-legal recording and medico-legal examination. You may say excuse பண்ணிக்கலாம். ஆனால் பேஷண்டோட கண்டிஷன் சீரியஸாக இருந்துச்சுங்கிறத யூ ஹேவ் டு ரெக்கார்ட். அந்த ரெக்கார்டை பண்ணாமல் நான் வந்து ட்ரீட்மெண்ட் கொடுக்குறக்காக இதை கவனிக்கலன்னு சொல்ல முடியாது. Even one example I want to say, in one murder case that was done by one pathology professor when I was in Thoothukudi Medical College. Because அப்போ வந்து ஒரு தனி வித்தியாசமான ஒரு செட்டப் இருக்கும். ஃபாரன்சிக்கில் நான் ஒரே ஆள் தான், அதனால் எனக்கு வாரத்துக்கு ஒரு நாள் லீவ் தருவாங்க. அன்னைக்கு pathology people will do the autopsy. So on that day that case was done by, it's a murder case done by our pathology professor. I think now he is in Chennai. அவர் வந்து அந்த கேஸ்க்கு எவிடன்ஸ்க்கு போகிறாரு. ஒரே ஒரு இன்ஜுரி, ஸ்டாப் இன்ஜுரி டு தி ஹார்ட்டை மட்டும் டிஸ்கிரைப் பண்ணியிருக்கிறாங்க, அது மட்டும் சொல்கிறாரு. அவங்க டிஃபென்ஸ் சைடில் இருந்து ஃபோட்டோகிராஃப்ஸ் காமிக்கிறாங்க, 3 இன்ஜுரி இருக்குது. ஒரு இன்ஜுரி ஹார்ட்டில் மட்டும் எழுதியிருக்கிறாரு, மீதி பக்கத்தில் உள்ள இன்ஜுரியெல்லாம் அவர் எழுதவே இல்லை. நான் அவர்கிட்ட கேட்டக்கு இது மட்டும்தான் சொன்னாங்க அப்படின்னாரு. சார் நீங்கள் பார்த்து எழுது. பட் ஜட்ஜ் இஸ் வெரி குட். He asked, sir, what is your qualification? Sir, I am pathology professor. Okay. Defense வந்து ஒரே பதில் அவர் சொன்னது, முக்கியமான காயத்தை எழுதியிருக்கிறார்களா, எப்படி செத்து போனாங்கிறத அதை வச்சு தானே சொல்கிறார், எழுதியிருக்காருல, விடுங்க அப்படி சொல்கிறார். ஸோ அதர் பீப்புள் in some area, some people they are able to understand our difficulty and give some lenience. இதே இது வந்து ஒரு ஐ விட்னஸ் சொல்லியிருந்தா அவன் ஹாஸ்டலில் டிக்ளேர் பண்ணியிருப்பாங்க. ஓகே, பட் ஒரு கேஸ் வந்து ப்ராப்பராக நான் எக்ஸாமின் பண்ணலை, ஏன்னா அவனோட லைஃப்பை சேவ் பண்ண வேண்டியது இருந்துச்சு அப்படின்னு ஓரலாக சொல்லி பிரயோஜனம் இல்லை. டாக்குமெண்ட் இட். மேக்கிங் ஏஆர் என்ட்ரி இதுக்கு மேலே பண்ண முடியல, அவர் வந்து ஷாக்குக்கு போயிட்டான், ரிவைவ் பண்ண வேண்டியது இருக்குது. ஃபினிஷ் இட். As the patient condition be deteriorated, I am stopping with this and proceeding with the treatment of the patient. No one will find it fault. Okay. Then, the injury what the person sustained is of dilemma and you are having some suspicion about some severe illness. Then you go for investigation and other treatment procedure rather than writing medical legal documents. Then secrecy. See, even though it is a medical legal case, you have to maintain some secrecy. Only in certain circumstances you have to overcome that secrecy. They are one is privileged communication. And for investigating purpose, if the investigating officer is asking, you have to tell. Then in the court as a witness, and if the person is suing against you as a negligence case, then you have to reveal the fact. Then the same thing. Here are some tricky scenarios. Actually, I want to elaborate all these scenarios, but I think there is no time, and some more speakers are there to finish. Already it is a post-lunch session, almost like a post-lunch session. So I am rushing this in this slide. Okay. In some cases, the patient may come with injuries caused by assault, but the bystander or the patient himself is claiming that may be because of accident. For example, cut injury to the neck, you may state that some sharp objects fall and cut their neck. Then, accident as assault for false claiming, false victimization, then they may ask, tell like that. Self-inflicted injuries as assault. Why I am telling all this thing? So you have to think and certify that these are all fake cases. Okay. The unconscious patient with ill-informed attenders. Here I want to say one good example. I am saying that from starting from my employment in Thoothukudi Medical College. நேற்று கூட அதை பற்றி எங்கள் பிஜிஸ்ட்டை பேசிக்கிட்டேன். ஒரு ரயில்வே ஸ்டேஷன் கிட்ட ஒருத்தர் அன்கான்ஷியஸாக படுத்துருக்கிறாரு. அவர் அன்கான்ஷியஸ் வித் பின் பாயிண்ட் பீப்புளாக இருக்குது, கூட்டிகிட்டு போகிறாங்க. எந்த ஏரியான்னு சொல்லுவோம், நேசரத் ரயில்வே ஸ்டேஷன் பக்கம். அவர் கூட்டிகிட்டு திருச்செந்தூர் ஜிஹெச்சுக்கு போகிறாங்க. பின் பாயிண்ட் பீப்புள், இப்போ நிறைய டாக்டர்ஸ் வந்து ப்ராக்டிசிங் இட் லைக் மேத்தமெட்டிக்ஸ். பின் பாயிண்ட் பீப்புள், ஓபிசி பாய்சனிங், ஸ்டார்டட் PTA. From as the patient condition is not improving, patient was referred from Tiruchendur GH to Thoothukudi Government Medical College Hospital with a tag that OPC poisoning. Here also the patient was treated for the same and he died after 2 days. subjected for postmortem examination, samples collected and sent for chemical analysis. Report came as alcohol. Stomach, small intestine, liver, kidney contains alcohol and there is no evidence of OPC. Now, what is the cause of death in this case? The disease would appear to have died of hospitalization. Isn't it? If the person is allowed to sleep for another 2 more hours, that fellow may be alive now, living happily with his family members. So, over enthusiastic nature and ill-informed attenders. அதே போல from கோயில்பட்டி GH, they are having some formulas. யங் ஏஜ் செத்து போயிட்டா பாய்சன் தானே. இந்த வேர்டு வந்து ஒரு சீனியர் மோஸ்ட் டாக்டர் வந்து என்கிட்ட சொன்னது. சார் யங் ஏஜில் இறந்து போயிட்டான்னு பாய்சன் தானே. So one such case was reported to us. கோயில்பட்டி ஜிஹெச்சில் இன்னொரு ஃபன் ஒன்று நடக்கும். அங்கே வந்து பேஷண்ட்ஸை இறக்கியெல்லாம் ஏற்ற மாட்டாங்க. 108 ஆம்புலன்ஸில் வந்தால் டாக்டர் வில் கம் இன்சைட் தி ஆம்புலன்ஸ் அண்ட் ரைட் தி ஏஆர் அண்ட் ரெஃபர் தி கேஸ் டு திருநெல்வேலி மெடிக்கல் காலேஜ் ஹாஸ்பிட்டல். ஸோ இது வந்து முன்னால் இருந்தது, இப்போ அப்படியான்னு எனக்கு தெரியாது. ரொம்ப ரொம்ப குயிக்காக ஆக்ட் பண்ணுவாங்க. மற்ற ஊர் மாதிரிலாம் இல்லை சார். போலீஸ் யூஸ் டு சே, மற்ற ஊரில் மாதிரிலாம் இல்லை சார். கோயில்பட்டியில் உடனே ரெஃபர் பண்ணிடுவாங்க. என்ன பண்ணுவாங்க அப்படின்னா, மற்ற ஊர்லலாம் இறக்கி ரேம்பில் வந்து உள்ள பெட்டில் படுக்க வச்சு என்ட்ரி போட்டு திருப்பி வண்டியில் ஏற்றணும். இங்கே அப்படிலாம் கிடையாது. டாக்டர் வில் கம், நேரே உள்ளே வருவார். அந்த பக்கத்தில் அட்டெண்டர் சீட் இருக்கும்ல ஆம்புலன்ஸ், அதில் உட்காந்து மடமன பேர் என்ன எழுதுவார். ஏட்டு கிழிச்சு கையில் கொடுத்து போ போ நேரம் வந்து மெடிக்கல் காலேஜுக்கு வந்துடும். வர வழியில் இறந்து போகும். இட்ஸ் அ ரொட்டீன். ஸோ அப்படி ஒரு கேஸ் வந்தப்போ போலீஸ் வந்து கொடுக்குற ரெக்யூசிஷன், அவர் விஷ மருந்து அழுதி இறந்து விட்டார். அவருடைய ஏஜ் வந்து 34 லைக் தட். So we did the autopsy and we gave opinion and everything. After some months, one lady came, was a young lady, maybe in her 20s, early 20s. She's go on weeping. என்னம்மா எதுக்கு வந்திருக்கிற? என் ஹஸ்பண்ட் இறந்து போன சர்டிஃபிகேட் வாங்க. ஓகே, என்ன எந்த கேஸு? அவர் சொன்ன டீட்டெயில் எப்படி எடுத்து அப்பவுமே அழுதுகிட்டே இருக்குது. ஏன் அழுதுட்டு இருக்கிற? எப்படி இறந்து போனாருன்னு சொல்லிட்டு என்ன சொல்லுங்கள் அப்படின்னு சொல்லி. அவர் நெஞ்சுவலி வந்து இறந்து போயிருக்கிறாரு. இல்லை சார், பாய்சன் அடிச்சு. பாய்சன்லாம் இல்லைம்மா, ஹஸ்பண்ட் நெஞ்சுவலி வந்து இறந்து போயிருக்காருன்னு தென் ஸ்டார்ட் சத்தம் போட்டு அழ ஆரம்பிக்குது. ஏற்காக அவர் இறந்து போனோடனே அவங்க ஊர் பாணிப்படி பாய்சன் அடித்து செத்து போயிட்டான். அவன் பாய்சன் அடிக்கிற, நீ என்ன கொடுமை பண்ணியோ தெரியலை அப்படின்னு சொல்லிட்டு she was blamed. நீங்கள் அப்படியே சார் எழுதியிருக்கீங்க. ஆமாம், டைட் ஆஃப் மைக்கார்டல் இன்ஃபாக்ஷன் எழுதியிருக்கேன். பெத்தாலஜிக்கு அனுப்பல, பெத்தாலஜியில் ப்ரூவ்டு அக்யூட் எம்ஐ சேஞ்சஸ் போட்டிருக்கிறாங்க. அதனால் எம்ஐ பாய்சன் ஒன்றும் இல்லையா? ஒன்றுமே இல்லை. விசரா நெகட்டிவ் ஃபார் எனி பாய்சன். ஸோ ஆஃப்டர் சம் மந்த்ஸ் கழிச்சு தான், அது மாதம் வரைக்கும் இவ்வளோ நாள் அது அழுதுட்டு இருந்ததுக்கு ஒரு முடிவு கிடைத்தது. அதுக்கு அவர் இறந்து போல அப்படின்னு தெரிஞ்சது. புருஷன் இறந்து போயிட்டான், அது வேறு விஷயம். ஆனால் நிச்சயமாக பாய்சன் அடித்து இறந்து போல, அந்த பாய்சன் அடிக்கிறதுக்கு அந்த அம்மா காரணமாக இல்லை அப்படிங்கிறதே ஒரு ரிலீஃப். அட்லீஸ்ட் மே கிவ் சம் குவாண்டம் ஆஃப் சொலேஸ். ஸோ in that way a small move taken by us will change a lot. So broader cases, you have to be careful with those broader cases. Then in case of drunkenness examination, if the patient, do you call him as patient or victim? What to call? So the person whom you are examining, if he refuses to give sample, what you have to do? A minimal force to be used to collect. It may go against you. டாக்டர் அடிச்சிட்டாருன்னு சொல்லி உண்மையில கேஸை போடுறோம். அதுக்கு ஏஆர் என்ட்ரி எழுதுறதுக்கும் வேற ஆள் இருப்பாங்க. அதனால் if he is not willing or not ready to give, record it and send him out. Refusal to give samples by sexual offense, the same thing, record it and send him to the magistrate concerned. Then another is a false age claim. So how to manage this false age claim? How to do a complete examination for giving an age certificate. So in this case, ஒரு கோர்ட்டில் வந்து ஒரு ஜட்ஜு கேட்டது, டாக்டர் சரியான நியூட்ரிஷன் இல்லைன்னா 15 வயசு பையன் 10 வயசு பையன் மாதிரி இருப்பான். ஆமாம், ஓவராக நியூட்ரிஷன் இருந்தால் 15 வயசு பையன் 18 வயசு பையன் மாதிரி தானே இருப்பான் அப்படின்னு. இது லாஜிக் நல்லா இருக்குது சார். எக்ஸ்டர்னல் அப்பியரன்ஸில் அப்படி இருப்பான், ஆனால் வந்து மற்ற செகண்டரி செக்ஷுவல் கேரக்டர்ஸ் டெவலப்மெண்ட்லையும் அப்படி சொல்ல முடியாது. அண்ட் ஆல்சோ ரேடியாலஜிக்கல் எக்ஸாமினேஷன் அது வராது. பட் இன் எக்ஸ்டர்னல் எக்ஸாமினேஷன் ஹி லுக்ஸ் லைக் ஆஸ் இஃப் ஹீஸ். இது வந்து ஒரு செக்ஷுவல் அஃபென்ஸ் கேஸில் உள்ளது. எப்படி வந்து நான் வந்து 18 வயசு பெண் என்று நினைத்தேன், கூட்டிகிட்டு போகிறதுக்கு முன்னால் வெர்சர்டிஃபிகேட்டை வாங்கி பார்க்க முடியும், அந்த மாதிரி கேஸ். அப்போ அவனுக்கு டிஃபென்ஸுக்கு ஃபேவரபுளாக உள்ளது தான். ஜட்ஜ் வந்து அந்த கேஸை முடிக்கணும்னு முடிவு பண்ணிட்டனால ஹி ஆஸ் தட் கொஸ்டின். ஸோ கோட்டார் கேள்வி அப்படின்ட்டு கேட்டு ரெக்கார்ட் பண்ணார். ஓகே, ஐ திங்க் தட்ஸ் எனஃப் ஃபார் டுடே as far as this topic is concerned. There are some more topics are there. Thank you very much for your patient listening. Thank you.
Thank you, sir, for taking the time and beautifully sharing the insights of the medico-legal aspects to be followed as a doctor. Now I request the chairpersons to felicitate our honorable speaker, Dr. A. Selvamurugan, sir, Professor of Forensic Medicine, Government Tirunelveli Medical College. Now I request Dr. S. Peranandam, sir, Associate Professor, Department of Forensic Medicine, to present the memento to Dr. K. Gokulramanan, sir, Professor of Forensic Medicine, GMK, MC, Salem. I now invite Dr. Mani Megle, ma'am, HOD, Department of Emergency Medicine, to honor Dr. Sivasankari, ma'am, Associate Professor, Department of ENT, Thoothukudi Medical College. I now request Dr. Tamal Mani, sir, Professor, Department of Forensic Medicine, Tanjavur Medical College, to honor Dr. Rakesh Fernando, sir, HOD, Department of General Surgery. Once again, I cordially express my gratitude to our beloved speaker and chairpersons. We will now be having a 30-minute break for lunch. Please return to your seats by 3 p.m. as we promptly start the next session, Autopsy, Unveil the Hidden. Please disperse yourself in an orderly manner.
His expertise includes areas such as forensic pathology, toxicology, forensic anthropology, and other medico-legal aspects crucial in the investigation of crimes and legal proceedings. His role involves teaching, research, and overseeing the application of forensic medicine within the medical college and possibly in the broader community. I now invite our chairpersons to this session. Firstly, we have Dr. Manigandaraj sir, Associate Professor of Forensic Medicine, Garment Keelpark Medical College. Welcome, sir. Next, we have Dr. Arumugaselvi ma'am, Assistant Professor, OG, Government Thoothukudi Medical College. Welcome, ma'am. We request the speaker and the chairpersons to occupy their seats. Next, we have Dr. Nagendran sir, Assistant Professor, MMC. Welcome, sir. Associate Professor, MMC. Welcome, sir.
So, good afternoon, everybody. நானே செஞ்சுப்பேன். ஓகே, இது மேலே கீழே. Yes, good afternoon everybody. So today's topic of discussion is about autopsy unveil the hidden secrets of death. So yes, thank you. So few days back, I sent this PowerPoint presentation to your professor, Dr. Sodlimuthu. He asked me to give a brief introduction about the procedural protocols which should be adopted before conducting this autopsy, right? So as I am able to see so many of the undergraduate students, I just want to recollect the different types of autopsies before going to the actual topic. So there are different types of autopsies. Yes, gentleman in the back. Hello. Can you able to hear me? I am able to hear you. Yes, thank you. So there are different types of autopsies. One is what we do in the Department of Anatomy. Another one in the Department of Pathology. Another one, the Department of Forensic Medicine. And there are so many other autopsies also, like obscure autopsy, negative autopsy, virtual autopsy, psychological autopsy, right? I just want to tell about these three. One is the autopsy which has been conducted in the anatomy department. So that is otherwise also called as academic autopsy. The main purpose of conducting this academic autopsy, or the autopsy what we do in the Department of Anatomy, is to study about the different external and internal structures and the variations seen in the different external and internal structures. So who should give the permission in case of this anatomical autopsy? So normally if there is a unknown, unclaimed dead body which has come to the Department of Forensic Medicine or to our hospital, it is not our property. You understand? It is not our property. It is a property of the government, right? So we have to inform the police, and the police will find out whether they will try to find out the identity of the individual. So if they are not able to find out the identity of the individual, they will give a non-traceable certificate based on that. If the anatomy professor prefers to take that body for anatomy dissection, the RMO will ask the local municipal authorities or corporation to take that body for anatomy dissection, right? So for anatomical autopsy, we have to get the permission from the municipal authorities, right? So you please listen, and at the end of, after a week's time, you have to submit this assignment to your professor, right? So you have to listen it and you have to submit. So from the morning I am listening, I am watching. So most of the people, you are conducting a small meeting. Each and every 5 students, they are conducting a meeting, right? That's not good, right? Once in a while, you'll get this opportunity, right? So you should listen. So now I have told you about one, that is academic autopsy. Next one is pathological autopsy. The pathological autopsy is what will be done by the Department of Pathology. The professor of pathology will be doing this autopsy. The main purpose is to find out the cause of death, or to confirm the diagnosis, or to know more about the disease. All right? So who will give the consent here? The relatives. If the relatives have not given the consent, they cannot proceed with the autopsy. So the third one is what we do in the Department of Forensic Medicine, that is medico-legal autopsy. Here, no need for any consent. The letter will be given by the investigating officer. The investigating officer will be either a police officer or an executive magistrate or a judicial magistrate. So normally the police officer will be conducting inquest. Sometimes the executive magistrate will be conducting inquest. In case of dowry death, exhumation, the executive magistrate will be conducting inquest. Who is an executive magistrate? Can you give an example for executive magistrate? Any one of you? Yes? Any one of you? Yara solla mudiyuma? Executive magistrate na yarunu? Adala therinjirukkanum, right? Collector is the district executive magistrate. Who is next to collector? District revenue officer, DRO. What is next to DRO? He is RDO, that is revenue divisional officer, then Tahsildar. So these people are called as the executive magistrates. Normally the Tahsildar or the RDO will be conducting inquest. So that is executive magistrate. Okay, and the next one is judicial magistrate. Sometimes in police firing, death in police custody, then prison death, the judicial magistrate will be conducting inquest. All right, okay. So these investigating officers, they will be giving the requisition. Along with the requisition, they will be giving one form 86, then history of the case. Sometimes the copy of the FIR, copy of the AR, treatment particulars. So we have to go through all these things and then we have to proceed with the autopsy. Yes, next, coming to the topic. In medico-legal autopsy, we can find out so many secrets. Yes, next. So, the first one to start with is identification. So most of the time in post-mortem examination, it will be easy to find out the cause of death, but it will be difficult to fix the identity of an individual, right? So what is identification? It is fixing or determination or establishing the individuality of the person from some prefixed data. That is identification. So even in burns cases or decomposed cases, we can find out these tattoo marks, right? So tattoo marks, then moles, scars, these are all certain things by which we can fix the identity. So in Kanyakumari district, we received one case where it was a highly decomposed body and partly the body was burnt and there were some cut injuries, and also the penis was cut and the penis was inserted into the mouth, right? The body was a decomposed body, right? And also partly buried, partly burnt. So they didn't identify this individual, but the only thing is The person had one tattoo mark named Ramesh. So with this tattoo mark, the people, this police personnel, they find out who is that Ramesh. So the Ramesh is a person who has come out of the jail. While he was in the jail, he had a very close association with one another criminal. That criminal has told this fellow at the time of getting this bail to meet his wife. So he has met his wife. Also, he had some illegal intimacy with the wife also. Coming to understand about this, knowing about this, this fellow, after getting out of this jail, he has murdered, not only murdered, also cut his penis and inserted into the mouth, right? So with this single tattoo mark, the police were able to identify the individual. In 2005, in Nagarkoil, that is in Adversarial, there was one fire accident. Some 5 people died in one incident. So out of these 5, 3 were young and 2 were old. So we are able to fix the identity from the dentition as well as from the fusion of these sutures and also from the height. We are able to identify the individuals. In Kanyakumari district, in 2 of the Shishore hamlets, 2 people were missing and 1 body was recovered, and 2 people, they were climbing that body, right? So at that time it was possible to fix the identity by this DNA comparison. So if you know this prefix data, it is easy to fix the identity. What are the prefix data? Sex, age, moles, then tattoo mark, then fingerprints. From all these things we can fix the identity. So this is a very rare, some people, they are having these things. Teeth, dentition, by that also we can fix the identity. Scar, mole, right? Superimposition, DNA comparison. So one is identification. The next one is cause of death. If you see this photograph, you are able to see an oblique ligature mark. So normally in all cases of hanging, you can expect this oblique incomplete ligature mark. So as far as PGs are concerned, it is not only oblique and incomplete, sometimes it can also be oblique and complete, right? So it doesn't mean that a horizontal ligature mark is only strangulation. It can also be hanging depending upon the situation. So in all cases of hanging, that is, it is a type of violent asphyxial death, where the ligature mark will encircle the neck and the constricting force of the neck is being the weight of the body. So that's why it is oblique. Okay. So you can expect all these findings, that is finger and toenails will be blue in color, and all the internal organs will be congested, right? So that is, you can also expect this vertical salivary dribbling. So this is vertical salivary dribbling. So if it is vertical, it is significant. If it is horizontal, it is of no significance. So why you get this vertical salivary dribbling? Because it will, this ligature mark will be applied over the salivary gland. If it is applied over the salivary gland, naturally there will be vertical salivary dribbling. So it is very significant of antemortem hanging, right? So there are pinpoint hemorrhages. Okay, that is also, it will be seen in all cases of asphyxial deaths. Sometimes the tongue will be protruded. Why it is protruded? Because the pressure is applied over the base of the tongue. And it is a case of drowning, where you can expect this white, leathery, copious, continuous froth. So here it is not that copious, right? But still there is froth. And as the body is submerged in the water, you can expect this soddening of hands and feet. So this is lung. If you closely observe, this lung is voluminous, and you are also able to see this rib markings over the lungs, right? And you are able to see this froth in this photograph. So that is pulmonary edema. So this case of bones peeling, blackening, then singeing of hair. If it is antemortem, the base of the burnt area will be reddish in color. And here you are able to see this extreme third-degree burns. So internal organs have come out. So if it is antemortem burns, you can expect this soot particles in the trachea. But not necessarily in all cases you can see these soot particles. If the person has been burnt in the open area, sometimes you may not get these soot particles. So this is a case of electrocution, right? So this crater-like burns wound. So it is very typical of electrocution. In most of the cases, you may not get this exit wound. Sometimes you may get this exit wound. In some cases, you won't get this entry as well as exit wound, right? So if you still have a doubt whether it is due to electrocution, you can take this skin bit and send to forensic science lab. They will find out whether there is any transference of metallic elements or not, right? So this is a case of acid poisoning. There are so many ulcerations in the oral cavity, right? So that is a case of snake bite. Two tiny punctured wounds seen 1 centimeter apart, but here we are not kept this scale, so you are not able to see whether it is 1 centimeter apart or not. If it is viper snake bite, and if the person survives, there will be a good swelling there. So what is this? This is finding? As there are so many PGs and undergraduates, first one? It is subdural hemorrhage. So the hemorrhage is beneath the dura mater. Yes, next. What is that one? Intra-natural, or sometimes due to injury also. Okay. What is it? This one? This one is extradural hematoma. Yes. That one? Intraventricular hemorrhage. This is sutural separation, and also they have done one burhole surgery. That one? Hemorrhage, that is contusion in the scalp region. What is this? This is, it is hot. In the pericardial sac there is clot. What is that? The death could be due to cardiac tamponade. So how much amount of blood is necessary to cause death due to cardiac tamponade suddenly? Even 500 ml of blood is sufficient to cause death due to cardiac tamponade. Right? That is also clot around the heart. So the next one is nature of death. What is nature of death? The question is whether it is natural or unnatural. So most of the people, if the person dies because of natural cause, they will be happy. If they die because of unnatural cause, they won't be that much happy. The reason is, unnatural death is a stigma. ஒருத்தன் தூக்கில் தொங்கி இறந்தாம்னா that is a stigma, right? Poison குடிச்சு இறந்தாம்னா that is a stigma. So most of the people, they don't like to say that their close one have died because of unnatural deaths, right? So this is a case of HELP syndrome. What is HELP syndrome? Hello, madam? Yes? Very good. Hemolysis, elevated liver enzymes, low platelet count. So one lady, so there was, she was suffering from infertility, and later on she has got treatment in one private hospital in Nagarkoil. Hello? Are you here? Right? She has got treatment in one private hospital. அம்மா இதெல்லாம் உனக்கு தெரிஞ்சிருக்கணும். ஓஜியில் படிக்க வேண்டியது இங்கேயே உனக்கு சொல்லிக் கொடுக்காங்க. HELP syndrome. He was able to tell. What is HELP syndrome? அதான். ஆமாம். பார்த்தியா மைனா கொஞ்சம் மாதிரி வாயை அசைக்க வேண்டியது. அதாவது உனக்கு ஒரு வாய்ப்பு கிடைக்கும்போது you please get utilized. Right? Okay. So she was getting treatment in one private hospital, and they have delivered the child, right, by cesarean section. Then after that they referred the case to government hospital, that is Medical College Hospital. On the way the lady died, right? If they would have referred a little bit earlier, they would have saved that person. There was an enormous amount of bleeding inside the abdominal cavity, also everywhere, right? Uterus, abdominal cavity, then wherever they have touched, it has bled, right? So it was that case, and she died because of this bleeding. We cannot blame even anybody. It is a natural death or unnatural death? Either? Preventable, yes, very good. It is natural but preventable, right? Good. So this is natural or unnatural? Snake bite? Unnatural, but also it is preventable, yes. That one, that is a case of stab injury, but it is suicidal one. He has tried several times, but he didn't die. Suicidal. Suicidal is natural or unnatural? Unnatural, yes. This one, what is that organ? What is that organ? That is kidney, right? Huh? Yes, there are so many cysts, and this is kidney. The kidney is completely out, right? So that is natural or unnatural? Natural, yes. This one, this is heart, but can you able to see one white scar here, right? So that is natural old infarction. There is a scar. நீ வாழ்க்கையிலே பார்த்துருக்க மாட்டேன், ஹார்ட்டுக்குள்ள அட்டாக் வந்து பொழைச்சி வேற ஏதோ காரணத்தினால இறந்திருக்காரு, ரைட்? ஸோ தேர் இஸ் எ ஸ்கார். திஸ் இஸ் it is homicidal. Homicide is the, can you able to see one another cut fracture in the tibia, left tibia? So this one is murder. So this is homicide. What is the manner of death? Manner means there are three manners of death: homicide, suicide, accident. What is the manner of death? It is homicidal. What is this? Multiple gestational marks. Then what is this? What is the manner? It is suicidal. Understand? Multiple suicidal gestational marks. Right? This is suicidal cut injuries. So this unfortunate person, after consuming alcohol, he has kept another quarter bottle inside this underwear. And without his knowledge, he has fallen down, and these broken pieces of glass, it has punctured this great vessels, these vessels. And because of this hemorrhage, he has died. Right? So, தண்ணி அடிச்சு இறக்குறது ஒன்று, இன்னொன்று தண்ணி பாட்டில் குத்தி இறக்குறது. இது அது அந்த கேஸ். Right? So this is a case of murder. Can you able to see this? There are so many contusions, right, in the neck. In the injury, naanga undakanadu. Otherwise, that is contusion, right? He's a 30 years old man. He's having illegal intimacy with some 50 years old another man. That man has killed this man. நீங்கள் வந்து illegal intimacyனா மேன்னா ஒரு ஃபீமேல் நினைப்பீங்க, அப்படி தானே? இது அப்படி இல்லை, man with man. So it has happened in காவல் கிணறு விளக்கு, right? Murder case. So as per this police history, this gentleman was found sleeping over the stones which is meant for laying this basement. அதாவது அஸ்திவாரம் போடுறதுக்கு கல் வைப்பாங்கல்ல, அந்த கல் குவியலுக்கு மேலே இவன் படுத்து தூங்கிட்டு இருக்கான். இதுதான் ஹிஸ்ட்ரி, போலீஸ் ஹிஸ்ட்ரி. தண்ணியை போட்டுட்டு மேலே போய் தூங்கிட்டு இருக்கான். But in post-mortem, we are able to see these injuries. Injuries over this knuckle, back of the elbow, then injury over here, right? So actually this is not sleeping, right? Over the back of the elbow. So we suspected road traffic accident. On the other day also, they confirmed that with CCTV, right? So from the injuries, we can find out whether it is suicidal, accidental or homicidal. It is suicidal or accidental or homicidal? Huh? No. Auto idichadana adu peru accidental. Yes. So this case, this person accidentally has fallen, right? After completing his night watchman work, while returning back, he has accidentally fallen down, right? And he was admitted in a hospital. Then after 3 days, he died. So the case came to our college. On examination, we are able to see this cut injuries, right? So after that, the policemen, they checked and it was assault. Who has assaulted? The own son has assaulted the father. அப்பாவை வந்து மகன் வெட்டுறான், வேற எவரும் வெட்டல. So that is, so injury, from the injury we can say whether it is suicidal, accidental or homicidal. It is accidental or homicidal? Homicidal. So this gentleman, he was found recovered from the water, right? In autopsy, we are able to see a faint ligature mark around the neck. Can you able to see the ligation mark around the neck? Also, some perimortem injuries over the dorsum of the toes. So, we informed the inspector. Within a matter of half an hour, they found out the accused. The accused was the son of this person. அதாவது வீட்டுக்கு வந்த உடனே ஒய்ஃப் வந்து சொல்லியிருக்காங்க அவங்க அப்பா சரியில்லைன்னு மகனும் ஒய்ஃபுடைய தம்பியும் சேர்ந்து அப்பாவை கொண்டு பைக்கில் வச்சு கொண்டு ஒரு ஆற்றுல தூக்கி போட்டாங்க. That's why he has got these perimortem injuries. So this is a case of murder. So another thing is mode of death. There are 3 modes of death. All these 3 modes are interlinked, right? There is one is heart, brain and lungs. If any one of these 3 systems fails, the other 2 systems will also fail. So this is mode of death. Okay. Next one, we can also find out the time of death. Time of death. So the first photograph, it is rigor mortis. So not necessarily in all cases you should keep the 2 stools and keep the body over that. So as to demonstrate, I will just put this photograph. So by flexing you can find out whether rigor mortis is present or not. The next one is, it is post-mortem hypostasis. So normally the rigor mortis will be seen after 6 hours and it will be there up to 24 hours. This hypostasis will be seen after 6 hours and it will be fixed in 12 hours. So if the hypostasis is found and it is fixed, it is more than 12, and rigor mortis is also present, it is 12 to 24. Like that we can calculate, right? This is decomposition stages. This is marbling. Another one is honeycomb liver. So because of this Clostridium welchi, you can expect this one. This is skeletonized body, that is adipocyte formation, right? This is the brain is liquefied, right? And that is decomposition. So you should understand one thing while you are alive, right? So as far as you are alive, you can do all this makeup, you can talk, everything. But after death, your body will be broken into bits and pieces, right? Slowly the decomposed fluid will be coming out of mouth and nostrils. Your tongue will be protruded out. The abdomen, scrotum, penis, everything will be bloated, right? These flies, green bottle, blue bottle, all flies will come and lay eggs, right? It will be turned into maggots, then pupa, again they will fly. These dogs, vultures, everything will be removing all your fleshes, right? Finally, it will be skeletonized, right? So how long the body will take to get skeletonized? It will take 2 to 3 months if it has been left in the forest area, right? If it is encased in the caffeine, it may take 2-3 years, right? So from that we can find out the time of death. So the brain is liquefied, that means 3 to 5 days. If the brain is softened, 36 hours. If it is pulpy, 2 to 3 days. Pasty, 3 to 4 days. Liquefied, then 3 to 5 days. Like that we can find out. All right? This skeletonized body, that one, it was found after 2 years. This fellow was hanging in a tree, right? Then head was seen separately, the body was seen separately. After 2 years they recovered this body. Okay. In autopsy we can also find out whether it is antemortem or postmortem, right? It is postmortem and bite mark, and that is antemortem abrasion. All right? Okay. So this is postmortem, right? So most of the people, after the person is found dead inside the house, they will keep this body in between. One will be driving, another one will be sitting behind. So they will be least bothered about the this leg, whether it is hanging or it has been dragging. So you can get this one. This is post-mortem injury. Other one is silencer injury. That has also happened in the same body, right? That is also post-mortem. To find out whether it is ante-mortem or post-mortem, we have put one cut. There is redness, so it is that one in our mortuary. The rat has bitten the nose. That is also post-mortem. Actually, it should not bite, it has bitten. Right. So, in autopsy, we can find out the type of the weapon. So, this is a elliptical wound, it is a stab wound. So, in this stab wound, in one border there is a small tailing like thing. So, it is a single-edged weapon, right? Other one is incised wound, right? This is a cut wound. So, in the morning, Dr. Sorlemuthi was telling about, so in Tirunelveli, people used to cut like this. Kalutha rendakadu, right? So, that is, okay. So, from this we can say the type of weapon used. What is the type of weapon used? It is arval, yes. Next one is tire mark. What is the weapon? It is a tire. So, this is avulsion laceration. So, what is laceration? It is due to grinding or tearing or stretching. This is due to grinding, run over injury. So, in one body there is one stab wound as well as a cut wound, we can say two weapons are used. So, from that we can say more than one accused or involved in that particular crime. So, we can also find out the motive behind. So, if you see this one, there is a tear in the 6 o'clock position, right? Can you able to see this tear in the 6 o'clock position? What do you mean by 6 o'clock? South. 6 மணிக்கு 6 மணிக்கு நடந்த சம்பவம்னியா? 6 o'clock means, what do you mean by that? Is position, right? Okay. So here, what is the motive? Enna motive? Yes, robbery. Here, the person is been restrained. கையை காலையும் கட்டி போட்டிருக்காங்க. சிலவனுக்கு, if one person is suffering from unsoundness of mind, some people they will tie. Okay. So, from the injury, we can say whether the person has assaulted from the front or from the back, right? From the direction of the wound, we can find out whether he has been assaulted from the front or from the back. So, here you are able to say that the person has been shifted, okay. Right? So, as far as the fetal autopsy is concerned, we can also find out the intrauterine age of the fetus, right? So, at the end of the second month, this placenta will be formed. So, after that, that fetus is called as, that is embryo is called as fetus. So, there is one rule called as rule of Hasse, that is from the length of the fetus, we can approximately find out the age of the fetus. So, if the length is less than 25 centimeters, we have to take the square root, and if it is more than 25, we have to divide it by 5. It will approximately give the age of the fetus in lunar months. Okay. So, second months. What is the importance of 4 months? Sex will be differentiated. So, after that only we can say whether it is a male or a female fetus. Okay. Then 6 months, up to 6 months, doctor they can decide whether to terminate the pregnancy or not according to Medical Termination of Pregnancy Act. 7 months, that is Yes, sit down. Okay. So there are three things. One is live born, dead born, stillborn. So the live born child is a child which has crossed the period of viability. Live born child is a child which has crossed the period of viability and has shown all signs of life after completely born. The pill like crying, moving the limbs, that is called as live born. So the child was has crossed the period of viability and it was live inside the uterus and it has died during the process of labor. That is called as, what is that called as? Stillborn. Next one is the child which has crossed the period of viability and it is dead inside the uterus and also has not shown any signs of life after completely born. That is called as dead down. So in dead born fetus, one of the signs of either maceration or mummification or decomposition will be present, right? What is maceration? It is aseptic autolysis. If the air enters, it will go for decomposition. Okay. So sometimes we will be having a doubt whether it is a stillborn or live born. So at that time we can do this test. This is called as lung flotation test, right? If the child has respired, the lung will float or otherwise it will sink. And there are so many other tests also, right? So if it is a live born, we can also find out how long the child has survived, right? If the umbilical cord has fallen, most probably 10 days. If physiological jaundice is present, most probably 2 to 3 days. If there is desquamation of the skin, 2 to 3 days. And there is one other thing, that is fetal hemoglobin, adult hemoglobin. Have you heard about that? Yes. Then about all these things from all he has poured brandy into the mouth and finally one day the child has aspirated and died. But there were so many injuries, right? Injuries around the neck also, right? ஊர் உலகத்தில் என்ன நடக்குனே தெரியாமல் அங்கே கொஞ்சம் பேர் பேசிக்கிட்டே இருக்காங்க, right? So these sort of things should not happen. For that you should be aware of these things. ஒருத்தனை கல்யாணம் முடிக்கிறார், கல்யாணம் முடிச்சுட்டு அந்த பொண்ணு இன்னொரு ஆள் கூட ஓடி போயிடுறா. ஓடி போனோடனே அந்த குழந்தைய அந்த ஓடி போன ஆள் வந்து சிகரெட்டை வச்சு சுடுறான், வெண்ணிக்குள்ள மூஞ்ச முக்கி எடுக்கிறான், வாய்க்குள்ள பிராண்டி ஊத்துறான், இதெல்லாம் செய்கிறான். கடைசியில் அந்த குழந்தை இறந்து போயிடுது. This is act of commission. What is commission? Doing something what you are not supposed to do. This is act of commission, right? What is act of omission? not ligating the umbilical cord, not wrapping the child, right? Not giving proper food. That is okay. இது பாருங்க தீ வச்சு சொல்கிறோம். அதனால் கல்யாணம் முடிஞ்சதுக்கப்புறம் யார் கூடயும் ஓடி போயிடக்கூடாது. அந்த குழந்தை இந்த கஷ்டம்லாம் வரும். So in Kanyakumari district we did one small statistical analysis. புரியுதா? அனாலிசிஸில் என்ன ஆச்சுன்னா யாரெல்லாம் யாரை ரேப் பண்ணியிருக்காங்கன்னு ஒரு அனாலிசிஸ் பார்த்தா, ரேப் பண்ணது யார்? சொந்தக்காரன், இட்ஸ் ரிலேட்டிவ், நெய்பர் அண்ட் ஃப்ரெண்ட். வெளியூர்லேருந்து எவனாவது வந்து ரேப் பண்ணானா ஒருத்தர் கிடையாது. இட் இஸ் ட்ரூ. இவன் யார்? ஸ்டெப் ஃபாதர், சப்போஸ் டு பி தி ஸ்டெப் ஃபாதர். ஹி ஹஸ் கில்ட் த சைல்ட் and trial is going on, right? So you please be careful. நீங்கள் உங்களுக்குள்ள நீங்களே ட்ரெஸ்ஸு, ஹலோ மேடம், நல்ல புதுசாக ட்ரெஸ்ஸு போட்டுட்டு அப்படி ஸ்டைலாக ஒரு நாள் இருக்கிறனால ஒரு லாபம் கிடையாது. இதெல்லாம் தெரிஞ்சு வச்சுருந்தா யூ கேன் பி வெரி கேர்ஃபுல் இன் த ஃபியூச்சர். ஆல் ரைட், தேங்க்யூ வெரி மச்.
With great esteem, I request all the chairpersons to felicitate our honorable speaker, Dr. R. Rajesh Sir, Professor and Head of the Department of Forensic Medicine, Kanyakumari Government Medical College. With great admiration, now I request Dr. Ravi Pratap Singh Sir, Assistant Professor of the Department of Forensic Medicine, Government Thoothukudi Medical College, to present the memento to Dr. Manikandaraj Sir, Associate Professor of Forensic Medicine, Government Keelpak Medical College. Now I request Dr. Uday Kumar Sir, Assistant Professor of the Department of Forensic Medicine, to honor Dr. Nagendra Kumar Sir, Associate Professor of Forensic Medicine, MMC Chennai. Now I request Dr. Kanagalakshmi Ma'am, Assistant Professor of the Department of Forensic Medicine, to honor Dr. Armuga Selvi Ma'am, Assistant Professor of the Department of OG, Government Thoothukudi Medical College. Once again, I cordially express my gratitude to our beloved speaker and chairpersons.
Now, moving on to the next session, trace evidence implicative of crime. In the realm of criminal investigations, trace evidence plays a pivotal role in uncovering clues that can lead to solving crimes. The importance of trace evidence in criminal investigations highlights its role in identifying perpetrators, reconstructing events, and contributing to pursuit of justice has become unavoidable. It is with great pleasure and honor that I extend a warm welcome to Mr. D.V. Arulraj, Deputy Director of Regional Forensic Science Laboratory in Tirunelveli. Sir, we are honored by your presence and grateful for the time you have taken to join us. Your vast experience and expertise in the field of forensic science are truly commendable, and we look forward to learning from your insights and perspectives. We are privileged to have with us today the esteemed chairpersons who have graced these occasions with their presence. Firstly, please join me in welcoming Dr. A. Selvamurugan, sir, Associate Professor of Forensic Medicine, Professor of Forensic Medicine at Government Tirunelveli Medical College. Next, we have the pleasure of having Dr. R. Rajesh, sir, Professor of Forensic Medicine, Government Kanyakumari Medical College. Welcome, sir. Last but not the least, we are honored to have Dr. Janani Ma'am, Associate Professor, Trichy Medical College. Please join me in extending a warm welcome to our esteemed chairpersons. We request the speaker and the chairpersons to occupy the seats on the dais. Now, please join me in extending a warm welcome to Mr. D.V. Arulraj, sir, to share his esteemed words for the session, Trace Evidence Implicative of Crime.
What is forensic science? Application of scientific methods to law is defined as forensic science. When science is applied, science or scientific methods are applied only to criminal laws, it is called as criminalistics. Whereas in forensic medicine, in forensic science, the scientific method is applied both to criminal and civil laws. Forensic science is not a single science. It is an amalgamated science and it is multidisciplinary. It employs the science of biology, physics and chemistry, computer science, etc. for law. What are all the responsibilities of a forensic scientist? Imparting the knowledge of preserving, packing and forwarding of physical evidences to the investigating officers. Collection of evidences at scene of crime. Reconstruction of a how trace evidence is also a physical evidence. How trace evidences are transferred. Locard principle of exchange. According to Locard's exchange principle, when two objects come in contact with each other, there will be always transfer of evidence. For example, if I touch the wall, the cement and other things will stick to my palm, whereas my palm print will be transferred to the wall. This is an example of Locard's principle. Whether all the methods are acceptable in the court of law? No. It should come in accordance with the Frye standard. What is Frye standard? Expert opinion based on a scientific technique is admissible only when the technique is generally accepted as reliable in the relevant scientific community. What does that mean? Suppose DNA fingerprinting is an emerging technique. If it has to be accepted in the court of law as an evidence, it has to be accepted by the scientific community, which is molecular biology. So molecular biologists should accept it as an evidence. But it is always necessary. The court, it's not mandatory to accept even the evidence is based on Fry standard. It may also supersede the Fry standard. Chain of custody. What is chain of custody? Continuity of possession of chain of custody must be established whenever evidence is presented in court as an exhibit and followed by submission to the forensic department. In the SOC, if some physical evidences are collected, the inspector himself cannot carry this throughout all the time. So he packs it properly and affixes a seal, and it was produced before the court. In the court, they will affix a seal and forward it to the forensic science laboratory for examination. The exhibit should be recorded for the location and identification. Class characteristics. Class characteristics are associated with the group of objects or person. Examples: fibers, small fragments of glass, and which could not be matched to a particular source. Individual characteristics. It can be identified with a particular person or object. For example, blood grouping, ABO blood grouping is a class characteristics. By finding the blood group, we cannot match a person. Whereas, if DNA fingerprinting is made, we can individualize a person. So, fingerprint is an individual character. Hair is not an individual character, it is a class character. Whereas hair roots is an individual character because we can extract DNA and individualize. As I have already told, trace evidence is a term used for small and often microscopic physical material. General examples: blood, semen, saliva, fibers, hair, drugs, documents, firearms, etc. When a blood stain is received at forensic science department, we undergo some test. We subject to some test. Some spectroscopical test and benzene turpentine test. In case of seminal stains, we do Florence iodide test followed by microscopic observations, PSA 30, enzyme markers, and seminogeline tests. Once we detect semen or spermatozoa, then we go for DNA profiling. What is DNA profiling or DNA fingerprinting? It means a pattern or pattern of distribution which is highly unique is called as fingerprinting. You all know all the nucleated cells will have DNA. So in DNA profiling, first DNA is separated. How the nucleus, the DNA is brought out from the nucleus by some buffers, and the histone molecules are, histone proteins are hydrolyzed, and DNA is extracted. The extracted DNA, when available in small quantities, are amplified using PCR techniques. In PCR technique, a small strip of primates, pure DNA is added, and the 3 nucleotides along with enzymes are added. Polymerizing enzymes are added. When it is heated to 55 degrees, the 2 strands of DNA separates. and the primer binds to each strain by on cooling. The PCR polymerase enzyme starts to build the another chain. So within one cycle we get 2 chains. So within 6 or 7 hours we can get millions of copies of DNA. This is blood strike pattern. When blood falls on a smooth surface, the edges are well defined without any serrated margin in 90 degrees. This is the first. In the second one, if blood impacts on a rough surface, the edges become serrated, have a serrated margin. When he hits less than 90 degree in a wall, one side is elongated, and the place in which the blood strikes has a well-defined edge. Trace evidence. Hair belongs to class characteristics. We cannot individualize the hair. The color of the hair, the pattern of the hair, the area of the hair can be identified. Whereas, to whom the hair belongs to could not be established. Why DNA profiling is made? To establish personal identity. Reveal family relationship or heirship, identifying disaster victims. As I have already told, DNA profiling can be made on all the cells which have nucleus. So blood stains, bone, tissues, tooth, semen, etc. A medical college postgraduate girl, when she was returning from a theater in the night show, along with her fiance, was raped by 4 auto wallahs, along with a driver. The lady never, the rape victim, that is the medical college PG student, didn't prefer any complaint. But the accused were accidentally detained in a drunken mood by the police, and they told the incident. The medical student never preferred a complaint, but the police went and got a complaint from the girl and searched the room, and they found out an innerwear that was worn by the girl at the time of rape. That was examined and semen was detected. But it was a gang rape. So the stains were forwarded to forensic department for DNA profiling, where the DNA profiling matched for the 4 accused. And he was punished. And they were punished. And one more case, Dr. Selvamurugan sir had done the autopsy. One gunshot injury. He was a left-hander, but the injury was on the right abdomen. So there was a suspicion that, sir, so there was a dispute whether he has whether he himself shot or somebody has shot. But gunshot, while the gun was shot, unexploded, the propellants will come from the back side and get stuck in the forefinger. So a test called dermal nitrate test was performed. A swab was taken and sent for detection of nitrates and detected nitrates on the right hand. So, suicidal gunshot was confirmed. Similarly, a 70-year-old woman was raped by a 40-year-old man. And during violence, he hit the lady in the tooth. So, the blood streams were transferred to the accused shirt. The accused didn't wash his shirt. So, some days after, some 4 or 5 days after that incident, his shirt was recovered, and the DNA fingerprinting was, DNA profiling was made, and that matched with the 70-year-old lady, and his presence at the SOC was confirmed. Now coming to the alcohol. Usually, for blood alcohol estimation, blood is preserved in sodium chloride, but it has to be preserved in sodium fluoride. Why it is preserved in sodium fluoride? Already in our blood, glucose is there. The glucose will be converted into alcohol by yeast. Even if you add sodium chloride, the yeast will act and glycolysis of glucose will take, and alcohol is formed. So, 140 milligrams. If the patient, if the accused or victim is an alcoholic, there will be the alcohol will be glycolized, and glycolysis will take place and converted into alcohol. Addition of fluoride ions. If you add fluoride, then glycolysis will not occur. So, I request that sodium fluoride may be added in the future for correct alcohol, blood alcohol value. Okay, thank you.
Thank you, sir, for beautifully sharing the insights on this topic. Now, I request all the chairperson to felicitate our honorable speaker, Mr. D.V. Arulraj, sir, Deputy Director, Regional Forensic Science Laboratory, Tirunelveli. Now, I request Dr. Sukan Chandra sir, HOD in charge, Department of Forensic Medicine, Tiruvannamalai Medical College, to present the memento to Dr. A. Selvamurugan sir, Professor of Forensic Medicine at Government Tirunelveli Medical College. I now invite Dr. A. Nagendra Kumar sir, Associate Professor, Department of Forensic Medicine, MMC Chennai, to honor Dr. R. Rajesh sir, Professor of Forensic Medicine, Government Kanyakumari Medical College. I kindly request Dr. R. Udayakumar sir, Assistant Professor, Department of Forensic Medicine, Government Thoothukudi Medical College, to honor Dr. Janani ma'am, Associate Professor, Trichy Medical College. Once again, I cordially express my gratitude to all beloved speaker and chairpersons. Now, I request Dr. Rakesh sir to present a memento to Dr. K. Tamilmani sir, Professor of Forensic Medicine, Government Thanjavur Medical College.
So dear students, thank you very much, particularly the organizers, 21 batch. Next year we will give a chance to 22 batch also. We have the plan. One word, thank you a lot. National anthem. National anthem.
Now, I request everyone to stand up for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 जय